All right. Yeah, I kept that introduction short because I remember Bronk coming through the course, so we didn't want to make it any harder on you than we needed to. See what yeah, I'll let somebody else more qualified touch the computer. This is the perfect size crowd. I didn't know what I was getting into coming here. And the way I like to run these things is a discussion. So don't be shy to raise your hand, ask questions, make comments. Just don't disagree with me. I've got a really small ego. It gets hurt really easily. So your job is to make me feel really good by the end of today or towards noon. So I wanted to talk a little bit. I'll talk a little more about the program at Iowa State in the next lecture. How many of you were around practicing before digital x-rays came out? Yeah, so I was too. It seems like all of us with gray hair remember that time. So one of the things I noticed with the old style was, you know, as far as it pertained to farriers, we were usually just looking for pathology. We would look for rotations possibly in P3 or in the coffin bone with laminitis, but mainly we looked for pathology. And then as the digital x-rays came around and the programs got better, we were able to start taking measurements and angles and start adding all of these other dynamics into that. Those were great in some instances, but what I'm finding as time goes on is that we can't always rely on those measurements to shoe horses. There's a different aspect to shoeing horses. And that's what I wanted to talk about today. It's not that we have to throw the whole works out the window. And I want to preface this too with what you're hearing is a hypothesis. I'm working towards collecting data on this stuff, but this is still in the works as far as a lot of the data collection. What I'm proposing really a lot, and I'm doing a lot of talk within the farrier industry too, is that there's two moments within the horse that he lives in, right? And it's either going to be standing, which would be the static, or it would be the dynamic, which would be that characterization of moving. This is probably 90% of the clientele I see at Iowa State now. So it's probably the same here. A lot of founder cases. Yeah. So that dynamic just is a characterization of movement. And then what we learn as farriers is that the horse above the foot is what always determines the movement. And there's been an argue with farriers for years. Do we shoe the horses to stand or do we shoe them to move? There's farriers that have argued that, well, most horses spend 20 plus hours a day standing, so we should shoe them to stand. I disagree. I don't think horses sprain suspensories. I don't think they develop side bone and other types of pathologies that we would see radiographically standing. I believe they do it moving. I think that's our repetitive strain injuries, catastrophic injuries. They're going to occur during movement, not when they're standing in the cross ties. So my philosophy there is that we need to be shoeing them for that movement. So this won't be as funny to you guys. Jake knows these two farriers here, but this is I'm kind of stole a lot of these slides from a presentation I did at the American Farriers Association. So, you know, and I want to take just a quick second to tell you there is an association now here between South Dakota and North Dakota, the High Plains Farriers Association, or is it Horseshoers Association? And Jake Stonewall's here. He was kind of fundamental in getting that going. But that's a really good resource for you as veterinarians to find farriers that are qualified to help you with the lameness, because I think you'll all agree that's 90% of what you're going to be doing as an equine vet. And your prognosis is always better when you've got a good farrier to work with. So most of this topic is on medial lateral balance and looking at medial lateral balance. And part of the reason I focused more on this is because I think it's lending to more lameness than we originally thought. And there's a lot of new data that we're able to collect with better ultrasound and MRI. And it's interesting, a lot of the findings we get at MRI there at Iowa State. I wish it was more affordable and we could put more horses through the tube than we do, because I think we get some pretty valuable information there. So traditionally, farriers have been taught to sight down the cannon bone through the fetlock and the pastern, and then trim the heels perpendicular to that plane. And so they called that the long axis. So the cannon bone would be the long axis, below the pastern would be the short axis, and then the heels were trimmed perpendicular to that. They came out with those little T-square rulers that helped farriers so that they were able to visualize that. And probably, I'd say, for the last couple of 100 years, that's how we've been doing it. And I don't think it's necessarily wrong. I think it's one of those things that works on a large majority of horses, but there's the few that slip through the cracks that we're missing the big picture on. When the digital x-rays came out, then we started looking at joint spacing. So we were looking at P3's orientation to the ground, as well as the joint congruency above it. And we're looking to see if any of those were impinged. And then we'd get, a little note from the veterinarian with an arrow that says this is impinged, and that would indicate we needed to trim more off of that side. So this is our kind of our gold standard for shooting radiographs at Iowa State, is 2 feet on the blocks. When we're shooting our DPs, as well as laterals, right? And part of the reason is just so you're getting it up high enough that you can get to your plate. I started to kind of play around with positioning of the horse, and those radiographs below each position is an indication of what can occur if that horse happens to move when you take an x-ray. And it kind of blew my mind that that would change that drastically. I expected a little bit of impingement, but that was pretty dramatic, the difference that I saw there. What I haven't even experimented with yet is the difference when we have them jacked, because at Iowa State, those blocks are over 4 inches tall. So I kind of wonder what happens when we lift the front end of the horse up and not the back end. Are they going to adjust, out in front or behind, which could also change the relation of your lateral views. So these are just all kind of things to think about when we're evaluating the x-rays, because what's been happening more and more to the farriers is, you guys run out and you shoot the x-rays, and then we get the x-ray, and basically we get our feelings hurt because you looked at the x-ray and said he's got way too much toe, you've got to lower the medial side, you got to do this, you got to do that. One thing that I really try to get into my students in the 2-week clinical rotation at Iowa State is the very first thing you have to ask when you're evaluating a horse is, when were they shod last? Because if that horse is at the end of a 6 or an 8-week schedule, there will be nothing in balance, even radiographically. Because what we do as farriers is maintain a foot. So we put the whole foot back together where it needs to be, and then it grows away from that point for the next 6 to 8 weeks, or whenever we go out. And then you have to keep in mind too, that if you ask the owner, when was this horse shod last, they'll say 2 weeks, because they know that they're getting in trouble if they tell you 12 weeks. So keep that in mind too, that there could be some bias that way. So this is just a horse. I got a few case studies that we can go through. Any questions or comments so far? Like I said, don't be shy to pipe up if you do. The radiograph that you see on your left there would be that horse's left front leg. So that's a DP of that horse's left front leg. So in a lot of these horses that you're going to see me talk about today are what we call our mystery lamenesses, horses that are just on again, off again. Nothing really shows up radiographically. It's really hard to pinpoint a specific area. And it's a mild lameness. We're looking at, 2 on an average of 2 on the AAP scale. Maybe they'll jump to a 3 once in a while. And then they're riding that roller coaster of good, bad, as the owners are reporting to us. So that is that horse's left foreleg. So what's wrong with the left front leg? Anybody want to stick their neck out? It's the same as in my rotation. I can't ever get anybody to jump in. So I would call that a valgus knee, and it has an inward deviation of the fetlock. So the reason I have this together here is because we can't appreciate any of those conformational defects in that X-ray. So the X-ray doesn't show us that horse is valgus in the knee or has an inward deviation of the fetlock. I can tell, like I had to crop out the marker for the lateral side. I would be able to tell you, and I think a lot of experienced farriers would be able to tell you if they saw that mark lateral over here, that there is a conformational defect in that horse's foot because his hoof is on backwards. Instead of being a little more upright on the medial side and having a little more slope on the lateral side, he's going backwards, which means he's loading opposite. He's not loading flat anymore. He's coming down on the lateral side of his foot. The foot is so dynamic, changes very drastically based on load and weight bearing. So if we looked at the X-ray and we're going to pick apart my trim, I think we'd say I did okay. You know, the joint congruency looks good. There's nothing way out of level. The coffin bone looks flatter level to the ground. If we look down the cannon bone, same thing. And I've been trying to get farriers to get away from doing this too, or at least to take in a few different ways to evaluate the foot. And we'll go through those as we travel through this, the PowerPoint here. So this is this horse moving. Let's see, I think I've got to push. And it's pretty cool, the technology that we all have in our back pockets now, because this is just an iPhone camera that I put on slow motion and then put it on the ground. Whoops, let me go back. So you pay attention to landing then. That's what I'm focusing on here. Because again, what I'm proposing is causing the deformation in this foot, or the morphology is actually the load during landing, not just the load during standing. I'm sure they both are going to contribute. It's nice if you have a handler that'll stop before they run you over. I haven't been run over. Yeah, anybody want to see that again? Yeah. So this is also going to be something that's kind of breed specific. And I'm assuming here in South Dakota, you're working on a lot of quarter horses like we are at Iowa State. If you're working on a majority of thoroughbreds, you're going to see more of those toe out and possibly stay toed out through maturity. Whereas our quarter horses, most of them are born toed out and they all die toe in as their chests develop and they develop some musculature through the front end and through their pectoral muscles. So you see them start like this and go like this. So both those conformations are going to cause a horse to land laterally, which is kind of confusing, but I'll show you some later here. This is a horse I did at a clinic in Missouri. And this is just a before and after of how this horse is shod. And I only worked on this horse's right front foot. So focus on that one more as you're watching him travel before the shoeing. Some of these are quite dramatic. You know, other ones like the first horse we saw, there was, you know, a mild imbalance in landing, but this one is one of the worst ones that I've worked on. The guy walking the horse lands laterally too. It's one of those curses of being a farrier. You're watching, you're just looking at everybody's feet all the time. I can't fix humans, but horses, we have better luck. So this is the horse after it's shod. So yeah, again, watch that right forefoot. The left needs some help too, doesn't it? Yeah. But I like when you're doing these clinics, you're lucky to get 1 foot done in a certain amount of time. So some observations from this. There's a before and after just as the foot's on the ground. So what, you guys notice something there? Yeah, good job, man. So coronary band. And that was something I had a mentor that would kind of ingrain that in me. When you're walking up to these horses, the coronary band tells you a lot about the health of a foot. And we'll get into some of that in the next lecture if you're looking at distortions or areas where it's pushed up proximally, different things like that. But the coronary band is also a pretty good indication of how feet will hit the ground. So you see that before where we have that coronary band is really high on the outside. And then after, and what I've done with shoeing this horse is I built up his medial side until I got him to land flat. And then once I did that, I saw that I had a coronary band that was level. What's remarkable, and I didn't get the x-rays on this horse in the after, but in the subsequent ones that I'm doing, when we put them in a foam pad and we load them, because one of the things I worried about is, what am I doing to joint congruency once I've wedged up the medial side, right? So now we're talking about the horse standing in an out of balance position. And again, my argument is going to be that it's not as detrimental standing as it's going to be moving. So that, but what happens is all of these horses, if you put them in a deformable surface, pick up their other leg, you're going to see them shift slightly to the lateral side and they're going to drop laterally just a little bit. So standing, they're just going to find their own position where they're comfortable. How many of you guys have seen horses dig holes to stick their feet in? I know Jake has. You know, when you're working in large barns with box stalls, we go to get the horses out of the stall and they've got a hole in the corner and they back up and stick their hind feet. They stick their toes down there. It relieves their hocks. So horses are pretty intelligent when it comes to finding a place that makes them comfortable. And that helped me justify doing this a little bit more. Okay, if he needs to transfer weight, he can. He'll figure out how to do that. But what I'm finding is that they don't seem to adjust during movement. I haven't witnessed that yet. Here's a horse that toes out. Remember, I was saying that what you'd expect is if you have a horse that toes in, that hits laterally, and then you have a horse that toes out, you'd expect him to hit medially. And one thing that perpetuates that theory is that we oftentimes see those quarter cracks develop on the medial heel. But these horses still load on the lateral side during movement. This is that horse moving. I apologize. This isn't the best video. And there's one still shot there in the center of that foot, just as it comes down and hits the ground. And I'm only working on this horse's left forefoot, the one with the quarter crack. But you guys would agree that that's a lateral landing, and I'm not crazy. So then the question is, why do they develop the quarter cracks on the medial side if they're landing laterally? So I think what we have to pay attention to when we're shoeing horses is that there's always two forces that come into a hoof capsule. So you have the load of the horse, you have the horse's weight and his mass coming down through the cannon bone, through your pastern into the hoof capsule. And then you have the ground reaction forces that are also coming in to that foot. So when you put those two together, that foot's in a pretty big bind, especially when we look at horses traveling at speed and the amount of load that's going through those feet. So if you look at this horse's, see this thing have a pointer? No, I made Russ's name flash, so hopefully I didn't screw Russ up. Anyway, you can see where our fetlock is no longer in the center of the heel balls, right? So as that horse is going through load, that fetlock is falling hard to the medial heel. At the same time, then, if he's pushing down hard on the medial heel, the ground's going to come up harder on the medial heel, and he no longer has this equalized weight bearing coming into the foot in both aspects, medial to lateral. So the goal would be to get both forces coming up through the center of your heel bulbs into the frog. And so I think that's why we're seeing these medial quarter cracks. And these are hard. So what this horse needs is a medial extension as well as the side bone shoe. That's the side bone shoe, and I'll talk a little more about it in the middle, but that's that asymmetrical shoe that I built for the white horse to make them land flat. So in a kind of a combination of things, and this is where farriers, we're nowhere close to getting away from forging, because we can't buy enough. There's no way they can make therapeutic shoes that really contain all of the components we need, especially when we get into horses like this. So ideally, this horse would get what we call a spiral shoe. So it's got a thicker medial side, thinner lateral side. There's a heart bar welded in so that we can incorporate the frog in the load. And then we have this huge medial extension so that we're mechanically putting his foot back underneath where it needs to be. So the really tough thing about horses that toe out, though, is that medial extensions become dangerous because they have what we call a winging motion. So horses that toe in are going to paddle and go outward. The horses that toe out are going to wing and come inward. And if we put too much of a medial extension on there, they cut the opposing limb. So they'll start hitting their fetlock or their cannon bone on the other side and interfering. So the best that I can do for most of these horses is what I did on this horse, and that's to float that affected heel off of a heart bar, and also try to incorporate some flat landing into it. So this is kind of a patch on a Band-Aid, and we'll talk about more about quarter cracks, or this is a Band-Aid on the wound, right? So we'll talk about more about quarter cracks in the next lecture. But if you can keep that heel from touching the shoe, you can make those horses go away sound. And this happened to be a Western pleasure horse, so they don't need to be sound anyway. No offense if anybody rides Western pleasure here, but I watch those horses go all the time, and the owners go, it looks so much better. And I'm thinking that, okay, yeah, I'm getting paid for that, but they all look lame to me. It's such an unnatural movement with their nose in the dirt. And anyway, so this horse, that's also why he's got to be shod in aluminum, because he's a Western pleasure horse. And there's that, the owners, if they, you can put steel on those horses as long as the owner doesn't know, and the horse will move great. But if they discover you put steel on the horse, then they no longer will move right. But so this is it's kind of an interesting response, though. So there's another horse that toes out. And what I'm doing here in the picture on your right is I grab these horses right above the carpus, take their leg forward, and try to get them just to relax it there in that position. And what I'm finding is that actually shows me the real conformational defect in the limb. And what's really odd, and I can't really put together why this occurs, but when I have these horses that toe out, when I take their limb forward and hang it, they toe in. They have an inward deviation at the fetlock. And it's so complicated when you're going all the way down from the cannon bone, because we have quite a few joints there. So there's the possibility for a slight twist or an unevenness in the joint surface itself. You can have slow twists of the bone. You can have bones that are longer on one side than the other. And then you can have the combination of all those things in several congruent joints. So I almost have to go back to building models to see where this is actually occurring and really trying to wrap my head around it. And I'm fortunate that I get a lot of cadaver legs in. The unfortunate thing is that I don't always get to see the legs on the horse before they come to my freezer. So I don't have that history. And the same thing, once we take them off the horse, we can no longer really appreciate some of those conformational defects that we see on a live horse. But this and the other thing that I noticed then is if you extend that limb forward, the further you extend it forward, the more you'll see those front feet twist. And so I think that's where we're getting this lateral landing on these horses that toe out. So opposite of same as when they toe in. So, and the reason that the other thing I teach a lot of my students to look at them, evaluate the horses this way, because one thing that can affect horses on the forelimb is number one, the farrier. So if you do have a farrier that's trimmed that horse way out of medial lateral balance, that can create that deviation on the ground. If you take that limb forward and pick it up and it goes away, then you know that that posture is probably artificial or created by either shoeing or trimming. And then, like I said, going forward too, and it goes the other way, then you know you've got a little more of a complicated deviation, and it's occurring probably at several different joints. So the good thing is that treatment is the same. That isn't going to change. What I'm noticing now, when I've really gotten into looking at feet, so on top of the T-square method that I showed you that a lot of farriers are using, and as well as looking down the cannon bone and the long axis, farriers have often been taught to for years to trim to the highest, widest part of a healthy frog. And again, I think that probably gets us in the ballpark on, 70, 80, maybe better % of our horses that we're working on. That'll get us pretty good. But as I got further along in my career, and especially when I started working on a lot of these asymmetries in landing, I found that there's distortions occurring in the heels. And if I paid close attention to the distortion in the heels were telling me where they wanted to be trimmed to. And so it would vary from medial heel to lateral heel. And so this one here, you can just see, I just put the ruler on there so you can kind of appreciate some of that distortion that's occurring there. And so what I found is that if the foot allows, and I can trim maybe a few millimeters below that distortion, what I'm doing then is giving the horse a few weeks to grow to the distortion and a few weeks to grow past the distortion, but I'm maintaining a better foot than if I left that distortion in, because then he's growing further out. And like what you see on this horse is that distortion occurred over and over and over again as it was growing out from the heel bulb. So I've been training a lot of my farriers now to watch this. So we watch the coronary band, we watch the distortion in the heels, and we trim based on what the foot, each individual foot is telling us it needs. Any questions so far? So this is a pretty dramatic horse, but so this is a horse that has that hard lateral landing, and what you'll see is the distortion on the lateral side makes that heel curve inward. He's loading there so that it's forcing that lateral wall to roll under, and then he's breaking over and pushing off on the medial side, which is causing that foot to distort in the opposite direction. So you see the distortion then in the heels occurring in two different directions. And then each heel, you can see that in a trim, this horse wants more foot taken off of the medial side than the lateral side. So I would be doing this horse a disservice just to trim, perpendicular to the frog or the cannon bone. The problem with trying to trim these horses into balance, like especially this particular horse, is I don't have enough foot to do it. He's going to be bleeding on one side and he's going to be too long on the other side. And until I started working at Iowa State, I got fired if I made horses bleed. At Iowa State, they like it. So it's like a lot of times, especially abscesses or different things, they're like, go deeper, go deeper. So it's hard to get over that. But, like for years, you get fired if you draw blood, but we got a license to do it at Iowa State. So then you have to question your hypothesis all the time, right? And so why do they have to land flat? That was the next thing that I really had to address here. And part of it is, I think that this massive amount of load coming into the foot at speed and then equal distribution. But then you start thinking about the structures in the foot that dissipate shock. So your frog, and so there's two components there: sensitive and insensitive frog, digital cushion, collateral cartilages, they're expanding outward. Farriers can really appreciate how much a foot moves when we pull our old shoes out off of a horse, and they've worn grooves into our steel from those heels moving in and out on top of the shoe. And it's really important that we get away from using that fourth nail hole on a lot of our shoes. And, you know, some of the keg shoes or factory made shoes that I'm seeing now have 10 nail holes in them. And if you're repeatedly nailing behind the widest part of the foot, you're starting to restrict the movement there in the back half. So that nails really should occur in the front half of a foot. And, you know, you can keep a shoe on just as long with 6 nails as you can 8 if you're incorporating clips and it's a well-fit shoe. So you don't always have to have the 10 or 15 nails in a shoe. This is a model of a foot moving. This was done by some researchers in Japan where they put all these sensors all over the foot to get a reading on what's actually occurring in these feet when they're coming under load. And it was surprising to me what occurred there because I knew the heels were going to move in and out. I didn't expect that dorsal coronary band to descend further. And in their paper, what they associate that with is the fact that inside of that hoof capsule, there's going to still be some forward momentum or movement within the coffin bone. So the coffin bone's got some room to move slightly with inside the hoof capsule. And so you see that extensive process coming forward in the area of the coronary band and maybe just sort of pulling it down with it. That was what they're thinking is occurring there. So the other thing that we're learning is also helps with this shock dissipation then is your venous plexus. So you have this basically a great big hydraulic cushion built all the way around the coffin bone so that can compress and dissipate some of that concussion. So what I think is happening then with these horses that are hitting really hard laterally is that none of those shock dissipating structures in the back half of the foot have a chance to engage before the shock has traveled up the limb. So we have that ground force reaction coming in hard to the lateral side. The first thing that's going to contact is your distal interphalangeal joint, your proximal interphalangeal joint. You're working up your joints before that foot rolls to the flat surface and engages the frog. So I think at that point, then it's too late. We've lost our shock absorber and we've already done the damage up the limbs. One of the things that's interesting on the MRI findings, and this has to do with our navicular horses, is a lot of times I'll see the radiologist will make a little side note for our navicular horses that says coffin joint synoviitis. And how do navicular horses move? Toe first, yeah. So same thing is going to occur with the toe first landing as they're missing the back half of their foot. And so I'm wondering if that's why I see that little side note from our radiologists on the MRIs is because we're jamming the coffin joint every time those horses walk. They're not using the back half of the foot. So this is a really long way around saying be careful with what you evaluate in your x-rays, right? And it's not that I think they're not useful, but I think they're like the horse's movement is the biggest limitation we have when we're looking at those x-rays because it doesn't indicate the movement. So these are all different pathologies that I think this would contribute to. I have no doubt it contributes to side bone because we have farrier books that go back 200 years that prescribe the side bone shoe or the spiral shoe for these horses that are hitting hard laterally. So one of the questions that was never answered for years is, well, if it hits hard laterally, why do they get side bone on both sides? It's a good question. And the old timers used to say, well, that's because once they start to develop the side bone laterally, they adjust their gait to hit medially, and then they develop it on the medial side. That's something that I've never observed a horse do on the forelimb. And regardless of the amount of pain it's causing, I have never observed one modify the gait. And I'll get into why I don't think they can at speed, especially in the thoracic limb. So quarter cracks would be another thing. That picture in the middle is our sheared heels. And a lot of times when we see those really deep sulci in the center of the frog, we associate it with thrush. I think thrush is very opportunistic. So if we have a foot that's already compromised in landing, that's going to start to tear at those structures. The first thing that's going to work is our insensitive frog, our sensitive frog, right on through our digital cushion. And then we've got that really deep thrush in the center sulci that we often refer to as a sheared heel. But I think it's the landing that's bringing this on first in the large majority of horses. And then the thrush is just coming in and invading a structure that's already compromised. So, and thrush is something that we need to do more research on thrush. It's a frustration for a lot of us, I know. But so then the others would be your high and low ring bone. And then I just threw in there that coffin joint synoviitis. So this is the shoe that I'll forge for most of those horses. So you can see that my piece of steel in the straight it's forged like a wedge. So, and there's no exact science to what you do in the forge. You know, the students ask me all the time, how do you know how much to build up the medial side? Well, it's a good guess. It's the best I can do because I have no way to measure it while they're moving. I'm not that fast with my ruler. So we take our best guess, and most of the time it's enough to get them to land pretty close. If it's not quite enough, I could always pull it off and add a wedge pad or a rim pad of some sort to try to build up the medial side a little bit more. But that's what traditionally was called a side bone shoe or a spiral shoe. And I think so, you know, farriers, there's two types, and I'm sure you guys, if you've worked with farriers before, you know there's some really good ones and there's some not so good ones. But there's also two different camps within the farrier industry. And there's the farriers that are proactive in shoeing horses. And then there's the farriers that are reactive in shoeing horses. Well, you want the proactive farrier. So that's the farrier that sees the whole horse above the foot, as opposed to the farrier that's only looking at what he's got right between his knees in that moment. Because it's the horse above that affects everything that we do on their feet. So I think what I'm talking about here then with being proactive is that we're looking at the conformation of the horse and we understand where that horse is going to break down based on his conformation. And we're shoeing the horse to try to aid those conformational faults, help him to land flat, help him to travel more correctly. And then maybe instead of having to retire that horse at the age of 15, we can get another 20 or, you know, maybe we can get 20 years out of them or longer. It's hard to say, right? That would be a really hard thing to put any kind of data to, but I really believe that can occur. And so like when you have those conversations with well-established farriers that have been in the same area for 20 years that are really good at doing their job, and you ask them what percentage of lameness do you work on, they say none. Their horses are all sound. And other than the catastrophic stuff, right? So if he kicks the stall wall or has an abscess, stuff like that. But the fact is that these farriers are looking at the animal above the foot and they're shoeing them accordingly. And I think that really is contributing to that horse's soundness going forward. So this is going back to this observation that I had of these horses, the idea that they would avoid medial or lateral side based on pain. This here, this is the only time that I'm going to see that go back and forth on a horse is when we turn them in a super tight circle. So that would be the only time that we could make that horse land lateral on one foot and medial on the other. And then if we go the other way, we can swap it, right? So then we can make them land lateral on one and medial on the other foot. When I get these horses going forward in a straight line, I can't make them modify that. And I'm starting to think they can't physically do it because of that. You know, our thoracic limb is carrying 2/3 of the weight. It's got a little bit of a different job than the back end, and we'll look at that too in a little bit. But they also, the only ball and socket joint in our thoracic limb is a scapulohumeral joint, right? So everything below that is a ganglymus joint or a plane joint. So it's got to go in one direction. That horse can't twist his digits like we do as humans. So that is built in going forward. If he's going to adduct or abduct during travel, it's going to come from the shoulder, and then he loses equilibrium. So especially at speed, right? So once you got him into a fast walk or a trot, he throws a foot out and he's going to stumble into that other direction, which is why I think they continue to land on that sore side of the foot. It was really hard to get information on this. When I started going down this road, I went through lots of different vet books and asked our surgeons, where is this occurring? What muscles are contributing to this? It was not an easy thing for me to find, but so your abduction is primarily your deltoid. So again, very high up, you know, in the axial skeleton portion of the horse. So it's way above our limbs where this is going to occur, or above the digits. And then the adduction would be primarily your pectorals. So again, very high up in the horse. So I think that's the contributing factor to them not coming down or hitting flat as they're moving at speed. So I threw this in there this was a talk I did for the farriers. I know that all of you understand using your blocks as a diagnostic tool. I was able to convince one of our surgeons at Iowa State, when I had these horses coming in, to only block the side that hit first with our Palmer digital block, instead of just going to both sides immediately. And I didn't know if I had to ask him, will it work? You know, I mean, can you only block one side or will it diffuse? And he said, yeah, I mean, after a certain amount of time, it will diffuse and you probably will have both heels blocked, but so there's a timing in there, right? So you get your ballpoint pen out and poke on your heel bulb. As soon as you have that lateral side blocked, or the side that hits, make them travel. And so that gave me some indication as to whether I was crazy or if this was a real thing. And so we did have especially some of our more severe horses, we could get to go sound just with that lateral block. The other thing I would encourage too, it's really helpful for us as farriers if you don't skip your Palmer digital. So it's just a really good diagnostic tool. And I get that all of us are dealing with a human element when we're doing our job. And that's usually, that's motivated by the money in their wallet. So they know that one more block is going to cost them more money, but it really kind of helps farriers determine what part of that foot we're addressing. And if we skip that, a lot of times, especially, we'll get into that in the next lecture here, but we skip that, and you know, sometimes the farriers are actually seeing indications of the feet that we're not really dealing with toe pain here, we're dealing with heel pain. And so unless there's something pretty catastrophic that would make you go higher, I would encourage you to stay with the heels on your initial block. And then, you know, if you're seeing this lateral landing, you might consider that, especially in the horses that I was talking about, where it's kind of an on again, off again lameness. You guys want to take I don't even know how long I've been going. No.
We're at 8:45.
What's that?
We're at 8:45 right now.
So did anybody need a break, or do you want me to? Nobody's sleeping. So, all right, we'll keep going. So interpreting the lateral medial views, you know, again, this is something that, you know, I got you guys to raise your hands, and we were talking about, you know, prior to the digital x-rays, we didn't get these angles and different things like this. This is something that also changes very drastically. So one thing that farriers have to get really good at is not only shoeing the horses based on their conformation, but also shoeing them for their job and the types of substrate that they're going to work in. So what sort of footing is this horse primarily on? And that's going to affect not only the flight of the foot, but where that foot settles into that deformable surface. And are you guys familiar with Denois? Most people are raising their hands. So he was a French veterinarian and researcher, and he basically proposed a hypothesis, well, it's been over 20 years ago, looking at hoof flotation of the foot. So, it's the best analogy I can think of is if you're going to drive your truck in the sand, you want a big wide tire, stays on top of the sand, right? Narrower the tire, the more it sinks. So his hypothesis was if we put a really wide webbed toe on a horse and a very narrow heel, we could encourage the toe to stay up in the heel to sink. If we put wide heels versus a narrow toe opposite, and then if we put a wide branch on one side, narrow on the other, we would see a medial-lateral change in a deformable surface. And I was able to test his hypothesis with a veterinarian in Michigan. And what we did was use a 1-inch exercise mat that would allow our X-ray to travel through. And I was convinced he was right. Since then, I think it's been studied a lot more. I think it does work, but then again, you have to think about the surface that the horse is in. So a lot of times we'll have these prescribed for horses with collateral ligament injuries, and they want the wide web on the side with the collateral ligament injury, narrow one on the other side, so that we can provide some relief to that while he's in stall rest. Well, it's not going to work on the shavings. So those horses would have to be in a nice bed of sand where for that shoe to be effective. Otherwise, you would want to look at actually maybe doing a side bone shoe or mechanically changing that if they were going to be on a hard surface. So this is our gold standard then for shooting our laterals is both feet on the block. And like I said, I still have to go back and do some more experimentation with this to see if those horses adjust when we do that. If they go prone or they bring those feet back underneath, that's going to change our interpretation of alignment through the through P1, P2, and P3. So before the X-rays, farriers for a long time now have been trimming feet to try to match the dorsal hoof wall with the pastern. We'd get them as close as we could there. And that just kind of became a standard that I think, again, worked on a large majority of horses, some maybe not so much. When we started getting the X-rays, what I would find is that there was a lot of horses that I thought I had in alignment that didn't really show up as well in alignment radiographically. And this was kind of an eye-opening moment for me too when I was researching this with that veterinarian in Michigan, is when I put a horse in a foam padding barefoot and picked up his other leg, I saw a very drastic change in that pastern hoof wall alignment, not only just visually, but even through radiographs. So our toe sinks every time, toe sinks. The only exception will be if you have a horse that has severe pain in the toe, and then those horses will adjust forward to load their heel. And the only reason I know that is because one of our research horses, I put a hot nail in the toe. So he was not going to load his toe no matter what till I pulled that nail out. But so I didn't see a huge difference with just the 1 foot on the ground. I know we always worried about that. And currently I've got about 6 horses in this research, and I haven't really seen a measurable difference when we're only putting 1 foot on the block and not the other. Look at the difference though when we load that foot. So this is kind of going back to that whole thing with the static versus dynamic, right? So if we were to pick the first X-ray apart, there's a little bit of a broken back axis between P1, P2, and P3 if we're looking at the dorsal surfaces of those 3 bones. And then that coffin bone is sitting at nearly a flat palmar angle. So ideal palmar angles for P3 it's a pretty wide range, but I think it's still considered 3 to 5 degrees. Typically, you'll see a little more on hind feet than front feet. So if we were to really pick that horse apart, we'd say he's got a little bit of a broken back axis, and then we have this flat palmar angle in P3. Well, when I pick his other leg up, I actually create a very nice alignment between P1, P2, and P3. So this again is going back to me trying to guess where this horse is during load. And picking his other leg up is telling me that, okay, during load, he's actually pretty nicely aligned. What we don't know yet, and I would love to get my foot in the door on this research, is how this affects tendon and ligament neutrality. It's kind of a big question that's never been answered, and there's lots of assumptions on. So you can read lots of scientific papers that talk about alignment of P1, P2, and P3, but we still don't know why we align P1, P2, and P3, or whether they should be aligned during movement or a static position. And what I'm specifically interested in is tendon neutrality at that point during load. And then where do I have to get those bones right then? And it's going to be it's a very expensive project because we have to have little needles that go in with that measure basically tension in those soft tissue structures. We can do it on a live horse with IACUC approval, but it's going to be very expensive to get done. So this is the foam pad that we used in our research project. And then look at the difference there between the first image just statically on Q blocks versus this image here. So big difference now. So putting them in the foam pad, picking up his other leg, now we have very nice alignment between P1, P2, and P3, and we also have a normal angle of the coffin bone. So, and the reason I'm talking about this is because we got in the habit of shooing our x-rays, and the farriers were starting to create problems based on shooting the x-rays. So if we looked at this foot, what we would be encouraged to do is wedge up the heels. So we'd say, okay, we got, in order to get our 3 to 5 degree angle on the coffin bone, we got to wedge the heels up, and then wedging the heels up is gonna better align our dorsal surfaces of P1, P2, and P3. But then we didn't think about what that foot actually did during load. And what we found in our research was that when I put a 2 degree wedge pad on these horses, put them in the foam pad and picked up their other leg, I saw as much as a 6 to 8 degree increase in the palmar angle. So that little bitty 2 degree wedge pad that you think is very innocent in the right footing is a lot more than you thought. And so especially at this time, I was working on mostly dressage horses. They were all in Sanderinas, and we were kind of getting pigeonholed into addressing the radiographs, and we were having to go back and fix crushed heels, underrun heels, bruises in the corn, abscesses in the corn, and then worst case scenario, proximal suspensory strain, especially on our hunter jumpers. And I think in hindsight now I'm thinking, okay, it's because it was actually a whole lot more than what we anticipated it would be in the sand. And then first off, the horse probably didn't even need it if he was in pretty nice alignment during movement. So lots of questions, right? But like the whole point of this talk, and I know this is a long way to get around it, is just being very careful in what we decide to do based on our radiographs, because same thing then when we're looking at our laterals is we're only ever getting from fetlock down. So same thing, it doesn't show us angular limb deformities or different things like that. So those we have to appreciate with our eyes as well as the movement, and then taking into consideration what sort of job these horses are doing. So I had to throw this in here because everything that you saw me do on the front end of the horse isn't going to work on the hind end of the horse. It's a completely different animal. Number one, starting at our tarsal crural joint, it's orientated outward. So if you're standing next to the forelimb right at that horse's shoulder, just outside of him, that joint's coming straight to you. And it's a good design. It's how horses have to be. Otherwise, their hind feet keep hitting their front feet, right? So those horses are made to travel outward on the hind end. If they are built like that, they have an amazing athletic possibility because they can use the hind end to its full potential, a big long reach without coming under the hind end. The other thing that I'm seeing, horses that are built very straight through the hocks and are very base narrow, those horses, as those horses come through mid stance, right when they're fully loaded, that tarsal crural joint is forcing that limb outward and then back in. So you see those horses twist the hock, and the hock isn't made to twist. So in and out. So those horses, as soon as farriers see those horses, we know that that's a barn we visit every week to nail front shoes back on, because he's all over his front end all the time. He's never going to run a 16-second barrel pattern, and it's always going to be our fault because he's not shod correctly. And so, I mean, it's just a big headache. So conformationally, and I go through all these different conformational things with my vet students at Iowa State, because I think it's something that farriers have studied for a long time. And it's kind of our wheelhouse. We're looking at these horses and figuring out how they're going to move based on their conformation, and then shoeing them accordingly. And then we also, because we're seeing these horses every 6 weeks for sometimes 20 years, we know where they start to break down. And then we're putting that data together in our head. So when we see those base narrow hind end horses, we know that, by the time they're 5 or 6, they're going to suck us under while we're trying to nail up their hind shoes because they're sore and hock. And then we're going to have the owners call you and start the injections, because and then sooner or later we can't even get them done in the back end. So other big thing, major difference is our reciprocal apparatus. Did I do that?
Nope. I'm not sure who did.
Here, I figured this out, right? So your peroneus tersus, you guys, I'm sure all remember this from school, gastric nemus, and superficial digital flexor tendon. So your peroneus tersus, gastric nemus, and then your attachment at the end of the calcaneus, that's your movement in the hock, right? But then because that superficial flexor tendon extends all the way down, has an attachment at the fetlock, and then at your proximal interphalangeal joint, that's where you see that continued flexion or movement through the pastern as well, right? So if he flexes his stifle, he flexes his hock, he flexes his pastern. And the other big difference then in the hind end is that there's a mechanical attachment at the axial skeleton. So your SI joint basically is attaching your pelvis. Your pelvis has a bony attachment to the limb below it, whereas our forelimb, our scapula, is attached via a thoracic sling. So there's a kinetic lag in energy on the forelimb. The forelimb is really just made to start that directional change and support the front end of the horse. The hind end there is where you have those bursts of energy, and forward motion is coming from the hind end. As soon as he moves a foot, his spine is moving with it. It's moving forward. If I'm buying a horse, the first thing I'm looking at is the hind end of the horse. So when you have the opposite going on, and this is where I think it's handy for veterinarians to understand some of this, is that, like if he's got a really poor hind end, he won't only break down in the hind end because he's going to overuse his forend, right? So in those horses, I'm assuming most of you ride. If you've ever ridden a horse that you can look down and see that he's on the right lead, but you're still standing in the outside stirrup, trying to get yourself back in the middle of him, that's a horse that's using his front end to turn instead of his hind end to turn. So he's pulling and moving his shoulders out from under you every time he takes a stride, instead of having his hind end up underneath him and his whole spine is moving then, and you stay right in the center of him. So those horses are not only going to break down in the hocks, but they're going to start to break down in the forelimbs too, because they're overusing their front end. So that's any other questions on that? Everybody remembered the reciprocal apparatus, I'm sure. And that peroneus tersus is, like the best way to do these, I've made some models for the students, but if you take just a pole like this and then put two opposing rods across it, once you have those two structures way outside, and then you move back and forth, you can really understand how that pivots there. And it's hard to make sense of why that works that way, because the peroneus tersus is attached so high up at the proximal end of the cannon bone, and then your distal row of tarsal bones. But I believe it's called a retinaculum in that situation too, but it's embedded down into that soft tissue of the hock, and it makes a U shape just as it comes in there and attaches. So that made sense to me when I was creating those models. I had to put that little U bend into the peroneus tersus to get that hock to flex correctly. So mechanically, it's all there. So the first thing I noticed that's different on the hind end than the forelimb is horses that hit outside on a hind limb are lower on the coronary band on the hind end. So immediately there's the first thing I noticed that's completely opposite. So this is a hind end of a horse here. It's hard to see in this picture, and I don't think I have this right, but a little lower on the coronary band on the outside. And almost all hind feet land slightly lateral. They can back me up on this. I mean, most of the time when we go out to trim or shoe horses, you'll see farriers take a real small nipper run on the lateral side and then get very deep as they come around to the medial side. So you guys are familiar with Wolff's law, right? In the compression and growth in bone or remodeling of bone. It's the same in the hoof capsule itself. So as these horses load one side more than the other, the side that's not loaded grows more rapidly. Side that's loaded grows less rapidly. And so it's opposite for the front legs to the hind legs, right? So hind feet are loading more laterally. So in order to just address the coronary band, then what this tells me is that I have to raise the lateral side up to make my coronary band level. So then the question was, if I do that, if they're already hitting hard laterally, and then I raise the lateral side, am I not going to just make them hit harder laterally? And so this took a lot of playing. And you know, my own horses, unfortunately, are subject to all my harebrained ideas. They've had every kind of shoe you can imagine nailed on them. But so this is a shoe that I've been playing with on these horses. So the lateral side is thicker, medial side is thinner, and then I fit them long and full. So that'd be called a lateral extension coming around there on the lateral side. This is oftentimes what we see when we sight hind limbs is that they're already indicating that they're low on the medial side. And we still have a lot of work to do as far as putting all these little different pieces of the puzzle together and determining what we need to do. But I still am finding that these horses will do better if I can get them to land flat. The interesting thing about this shoe is that I would see a reduction in the movement of the hock. So this is a horse that I did this horse's left hind foot. So pay attention to that left hind foot. This is the horse moving barefoot. And so watch the flight of that foot too. This is the kind of horse that I was talking about that it kind of comes right from the pelvis to the feet, very base and narrow. And so you see that movement instead of the distal limb really following the tarsal crural joint, you see that they nearly interfere with their fetlock on the other side. So one thing that's true is that all horses in the hind end will widen slightly at speed. So when you take them from a walk to a trot, you'll see them go just a little bit wider. And then it's very hard to read that at a gallop. I can't really appreciate it yet without the right equipment. This is now the horse which is wedged up on the same foot, but now we've done the opposite of the front foot. We've wedged him up on the lateral side. So do you see how he moves his foot laterally right at the last minute? I wish one of you could tell me why. I am wondering if it's proprioception or what is occurring there. The other question would be why can they do it or are willing to do it on the hind end, not the forelimb? Maybe because there's less weight, maybe there's more freedom. I'm not exactly sure. The other thing then, full disclosure, on a forelimb, when I have my shoe forged correctly, I can make 100% of those horses land flat. I can guarantee I can do it eventually. Maybe I won't get it the first time, but I can keep playing with my shoe and I can make them land flat. This treatment on the hind end, I'm getting about 70% of the horses to respond to. And so that does kind of make me start to wonder if it is a proprioception or something different. That's where the foot feels different to him in the air, and so he's moving it slightly laterally. It will be more effective in the soft surface. You guys want to see those again? make sure I'm not full of crap. This horse doesn't have the real excessive hop twist that you see in some. You see a little bit when he's coming through mid stances, when you see those hocks kind of move in or out. So, but you can see that foot the left foot as it comes in, you see that lateral landing. It comes, because it's coming in, it's going outward as it contacts the ground, and he hits just on the lateral side of that foot. So then with our shoe on, so what was disappointing for me is that what I thought I was going to do when I started playing with this is, in my head, I thought, okay, if I'm increasing the outside of the foot, I'm gonna toe him out as he stands. I'm going to force him to toe out. That's how we trim. So the easy way to remember that is if you're trying to correct a foot that's toed out, you trim out. If you have a horse that toes in, you trim the bulk off, and you'll turn that foot straight. So I'm thinking that I need to make his toe marry up or match his tarsal crural joint. And then I'm thinking, okay, if it's aiming that way as he stands, he'll follow that flight as he takes off. And I was wrong. He didn't do that. He still came in very narrow and close to the fetlock on the other side. And then it was just that last little flick before he touches the ground that he comes outward. I'm still finding it beneficial because like I said, if I can reduce the motion in the hock, I'm finding that these horses are much more comfortable for me to shoe. And I think you'll find that farriers are the first ones to start diagnosing hock lameness, even though it's not our job. You know, we're usually out there and we're telling the owner, he's getting hard to do in the back end. You need to get your vet out here maybe and look at this. And we'll notice it long before that horse has taken any lame steps. So, and it's obviously if we're flexing the hock, we're also flexing the stifle. So there's two components you have to look at there when you're coming out to do your evaluation. But a lot of times farriers are the first ones to tell owners that there's something going on here. That's it on that one. You guys want to discuss that any further? Or what'd you think? Am I nuts, or did that make some sense? Or yeah, so the whole moral of the story is just that, like, what I've tried to demonstrate in this talk is how dynamic that movement really is, and really how much we don't know about it. The forelimb, the hind limb, both how they work, how they interact with the ground. But I think that you'll find when you're working with farriers, especially good farriers that are well established with that horse, they already know what's going to work for them. And the best thing I really try to drive this home with my vet students is communication with the farriers. Direct communication with the farriers. If you can leave the owner out, it always works much better. So you guys go out and you make your diagnosis, you take your x-rays, and then you tell the owner. The owner calls us and says, yeah, my vet was here and my horse has binocular disease because you really suck. And so that's the message that eventually comes to us. And it wasn't at all what you said, but that's their mixed words. They didn't really understand your diagnosis. But the other thing is, like, and I try to also train horse owners to this, especially when I was in a private practice. I'm not so privy to it anymore. A lot of the horses I see, I'm coming in blind. I don't know them. But you can get really good history from farriers on these horses. Like I said, we're there every 6 weeks for years, year after year after year. We can also tell you that the owner is really slow to pay. Different things, like very good information that you can use. They won't stay on a schedule. They won't pay. There's a swamp in the back 40. There's woven wire fences. The horse is at the bottom of the pecking order. They're fed on a round bale feeder. All of these things farriers have to understand in order to shoe these horses. And then you guys come in, you don't know any of that right off the bat, right? And so we can help you, I think, if we have that communication up front. I'm working on a deal at Iowa State right now where we're recognizing referral farriers. And the farriers really appreciate it. So just like if you guys were to refer a horse, we're gonna send you those medical records and talk to you on the phone and tell you what we found. We're starting to include farriers in the process too. And what you'll find when you work really good with farriers is that they're gonna send you a ton of work. Like I said, we have very fragile egos. We get our feelings hurt really easily. And we have long memories. So you gotta be very kind to us. It's not uncommon to cry in the shower after a long day. I mean, it's like, so. Anyway, let's take a break. I know that was a long lecture, but I appreciate everybody's attention. And maybe come back in 10-15 minutes and we'll do that other one. All right, everything's great. Yeah. Yeah.
You did a great job of that. It's all physics. It's all physics. And how many of the farriers are thinking through that? The vets are not. I've got one farrier who thinks like you. So we were just talking about a guy that was putting standard red shoes on Arab horses. And he's talking about the length of the back and how they're catching those shoes, you know, because of the way they're carrying. It's like, oh, you understand this. I wish I could have him talk with him. That's so, I'm a cow doctor.
Yeah.
But I work a lot of horses and I work with this fair when it's waiting on me and he comes in and he fixes all my problems, just like you're doing. But the equine vets are just so arrogant. A lot of them won't work.
Yeah.
We
struggle with that. I mean, I think that's been the really good thing about the farrier rotation at Iowa State is like, there's just so much they don't consider, right? And so then when they're with me for 2 weeks and they're seeing things from my side.
That's good that you're I'm there because the old vets, it's too late.
Yeah.
It's too late, you know? And some of the things, if you're putting some of this stuff together with the different shoes. So I teach at a little community college up here in Minnesota.
Okay.
And we're short on farriers. We just need guys that can trim feet. Okay. So we're going to try to put together a little program just to get him out to trim feet. And he's debating if he needs to do forage work or not. You're showing him he does. Up there, very rarely do we get radiographs of anything. Okay. And I'll ask him, do you really need radiographs? No. Because he knows, he sees, and he's looking all the way up these horses. Have you ever thought about like this horse, I'm watching it do this, and you fix it, but it's still doing this? Have you ever thought about looking at a chiropractor to look higher up, like into the hips?
Well, so yeah, I thought about both like musculature and so like, I always forget muscles, but so your gracilis is medial, right? Inside.
Right.
And I wonder if sometimes what we're also seeing isn't just the chiropractic alignment, but also the fact that there might be overdevelopment of muscles
On one side.
lateral. Yeah. And so it's pulling the distal limb inward. But like I said, there's just, it's funny. Farriers have been around 2,000 years as a trade and there's still so much. What's really amazing is how much they knew 200 years ago. I mean, it was pretty advanced.
Think about it. Well, think about that. We didn't have penicillin. We didn't have much of veterinary work. You guys were doing 99% of everything because those things were pulling wagons. They were on the road all the time.
Yeah.
So, a lot more. I think veterinary medicine with horses started with you guys.
Yeah.
And it, and went from the vets get the credit, but I think that's what it was at all. It was you guys.
Well,
and you guys did a lot more.
Yeah,
of
they
the
did.
confirmation stuff than they do today. So today, there's farriers that all they can do is they can trim feet. Do they do a good job or not? I don't know. I mean, everything you're showing just makes sense if you watch the horse move, and it can't be on. It's got to be on that hard surface you're looking at. It just makes sense. But how many of these guys sit and think about that?
Yeah. Yeah.
I don't know. I don't know. You need to do lots more talks. You need to be talking to more vets.
Well,
Do you talk at the American Association of Equine Practitioners?
it's hard to get in there. I'll be honest with you. That group has a little
Yeah.
kind of a clique of farriers that they invite. And
You know?
I'm gonna be
Well,
speaking
but
at the,
they're inviting veterinary barriers,
yeah,
okay? Because you're.
yeah, we
So-
call them veterinarians, but
Oh,
yeah.
okay, so it's just like
Yeah.
us, so
Yeah,
dentists, chiropractors, veterinarians are doctors, but we're not MDs, so we're not real docs. See, so you're not a real farrier because you're,
Yeah.
like you're saying, so yeah, it's that.
we
little
battle
attitude.
with that. I am gonna be speaking at the Northeast Association of Equine Practitioners. They have a big symposium in September.
That'll be a
And
start,
I've
and if
got-
you're good there, they might be able to
Got
let you
quite
get
a few
in.
talks to do
You know,
there, but
and that's the sad part, because you get that veterinarian ego attitude.
I don't know
crap
if you've
that
heard of
comes
Steve
along.
O'Grady, but he's,
I have.
Yeah,
Steve O'Grady.
yeah, he's the worst offender. I mean, and he's, and he's had a leg up in the AAP for a lot of years. So if he wasn't speaking, it was a farrier that he would approve of.
So are they all getting old, so they're gonna be getting out?
They
of
kick
for
the
long,
bucket
maybe?
pretty soon.
Yeah, maybe. I don't know. It's just difficult. I know,
Yeah.
because we have a lot of, well, we're running out of farriers because nobody wants to get into that. In fact, they're running out of equine veterinarians because nobody wants to do that either.
We see that at Iowa State. I mean, the number of students that are tracking large animal or even specifically
Well,
equine.
large animal, equine, anything. I don't know what they're doing for poultry veterinarians. Nobody wants to do that either. They want to do dogs and kitties because of this.
For the money.
Yeah, and you're right, you're talking a limited, so you do 1, 2, 3 injections, it costs money, and it's free. So it's a better situation. So you do the best you can. And like you're talking to these people about looking at how things change when you're doing these radiographs, because yes, there's a purpose for that.
Yeah,
But every time, so why not, instead of just blocking up the 2 front feet, why not block up all 4 feet? So it's flat again.
well, that's why I say I've got a lot more. Like that's the next thing I want to start looking at is.
Well, I
And,
can
and,
see
and
that.
part of the reason I'm really limited on this is because Iowa State, they charge me full price for every x-ray I take, even if it's for research. But
Why wouldn't they work?
they're just-
Because they can get papers out of this themselves,
Yeah.
and they have to publish or they're gonna crash and burn.
Well, so part of it is we have like
Why don't they call the?
our radiologists are union. And so they refuse to let so we did finally just get approved. We're buying our own separate x-ray machine for the large animal hospital that we can use specifically for teaching and research. And so it's
Expensive, because
what,
the processes are like 80 grand just for
Yeah.
a processor.
but we got the money, we got a grant, and when that comes in, I'm gonna really be able to get more, but
Well, that's amazing. I'm so glad you showed those, because just to show how the things change. And now, if you only take one of those, they're gonna think, oh my God, and there's nothing wrong.
yeah.
And you come back and say, maybe you're better not doing the x-ray. Maybe you're better.
I think, and I think that they've got to learn to trust us in that way. Same thing with a lot of times you'll have them, like maybe a real long foot from some separation. And they'll just draw a line there and say, trim it to here. So with my vet students, I say, okay, can you point to where the blood stops? They say, well, no, it doesn't show that. So well, farriers know, they know by the way that keratin looks, how close we're getting to the quick, when we got to stop. We can't always just trim to your lines, because there's a lot, your lines don't show
But
it.
here's what's happening with the new vet students. They can't even run the stethoscope. They have to do everything with the fancy technology.
Yeah,
And the more fancy technology they use, the more they feel like a real car.
yeah,
Okay, and this is a problem. So it's just like the old car mechanics. They could listen to your car. They
Yeah.
can tell you exactly what's wrong with
Put
it.
their ear on the screen.
Okay, not anymore. We got a computer and
Yeah.
they can't figure it out.
Yeah.
So it's changing. It's really, really sad, because the old vets too were the same. They could basically look at the horse and they could tell you what was wrong. And the good farriers, I think, can do that too. Now, I don't know what the new farriers, how they're training them.
There's still some good schools around the US.
Well, it's
Yeah,
good.
we're actually really trying to get them going.
Well, do that. Get a good
yeah.
one going, because I think we send some people down there. Because they need to think beyond, they need to think like you're thinking versus whatever they're training.
you go. There's a difference.
Yeah, we, Dr. Jeff, and then Dr. Shannon. Yeah, you know, it's just me and Dr. Yeah, we went to 4 vets too. Like, no.
That actually has
So, yeah, well, Steve and I are doing. But and I think if you. Then that's fine. Is she just trying to get in now? That's what I heard. I wasn't that.
We didn't get out. 3 minutes. And another 3 minutes.
And he didn't choose them. It did very much. Yeah.
I've been there before with yeah, there's
So if you put it in.
they always say,
Yeah, so we did.
no, I just made the transition. Yeah.
His kids. That was it. We need. I know.
So now you're doing the old thing, you're coming in here. Hopefully it's a good thing. School district.
Yeah. And I know that. But. I didn't have. No, I know, my husband. It's not.
Yeah.
You know, Bristol, yeah.
Yeah.
You recommended them.
Yeah. Yeah, exactly.
Still feeling like.
You can't quite watch your dog run off for 10 miles. Conglomeration.
Well, yeah.
I just try to stay active outside.
And my husband would be like, he's like, she didn't have to leave me. Yeah, and then a week later, they asked me about this. That's taking. Yeah. She had. Baseball.
Yeah.
No, at that age, you know, but yeah. I know. I've done it for years. I'm like, we'll see, I'll go this year. We're not
Yep, I've been married for 4 years. Katie will be around like that. She's on this kind of thing. Her sister and I worked at the time. Her family came down. Katie was out there. So she owns her own marketing. It was nice to move. We could just kind of back up. She does. Stuff right issue, and then we have to help just kind of their accreditation process there. $24 hours. Yeah. Well, it's nice enough, we can just, you know, we're not busy on the weekend and then the month got to be just. We know a couple people in here, the grand spot. Yeah. So, you know, his family pretty well. He's kind of know about it. Yep, whenever you are. Absolutely.
Just start.
Just start going. All right, well, I think they're still trickling in, but we'll go ahead and get started. So I have just in this is a lecture that I use at Iowa State in the clinic, the 2-week clinical rotation that I do there. And I'm more than happy. We have till noon. And so we can get halfway through this and take a break. But I really want, especially this part of it, to be for you guys. So if I'm not addressing something, even if the lameness isn't included in here and you're working on a horse that you want to talk about, that's what I want to do through this one here. So it says talking.
I think that's just,
Is it?
yeah, because I think your label is Russ.
Oh, okay. So is this turned off? There, I think I did it. Yeah, I can't advance the slide. That's on.
Here's the band.
Ron, he broke it.
Okay.
Yeah.
I'll take the ball.
I was just standing here. I don't know what he did.
Yeah, probably my fault. Maybe we got battery issues. Nope. There you go.
There we go. All right. Thanks, Russ. This is my shop there at Iowa State. And one of my favorite parts of the job is the interaction I have with the vet students there. There's a few in here. It's really fun to see the old students that went through, and I love when they reach out to me, you know, like because I've been there nearly 10 years now, and I still hear from students that went through the rotation the first year I was there, and they contact me with questions on horses and different things like that. A lot of times I forget their names. I'm the worst at that, but I enjoy that part. So we round on not only the horses that we've had come in that we work on, but I really try to get reinforce anatomy, because what I found at Iowa State is that they're only getting 1 hour of distal limb anatomy their first year at that school. And when I found that out, I was like, you got to be kidding me. But you guys have to learn about a bunch of different species. So I get it. I mean, you don't have time to go in depth on a lot of that. I'm amazed at how well they still remember their anatomy. But what is not part of the curriculum at all is the biomechanics of the anatomy. And that really is what farriers affect in everything that we do. If we're unloading a tendon, the load goes somewhere. And we got to know where that load goes, and in the circumstances that the horse works in, the ground, all that sort of thing, we have to determine whether or not those other structures can handle it. So the other big thing that I talk about with them is the vet farrier relationship and the communication with that. And I'm sure that you guys have all probably experienced some strained relationships with farriers at some point, and I'm pretty sure that most of the time it always comes back to the communication. And so really try to reinforce that direct contact with the farrier is the best thing you can do. A lot of times you guys have done your lameness workup and the owner is going to be pestering you right away. What are we going to do? What are we going to do? And what you need to say is, I'm going to contact your farrier and we're going to have a discussion. I started to say in my last talk that I really tried to train my owners that if you have a horse that's lame, I need to know about it. I'm the foot guy. I'm not going to diagnose anything. That's not my job. I'll stay in my lane. But if you have a horse that's not going good, I need to know. And part of the reason I need to know is so that I can reach out to the veterinarian that's going out to that to see that horse. Because like I said, I can give you good information. I can tell you that the owner is an awful rider, you know, leaning forward, sucking the head up, spurring the flanks. You know, so some of those, the stumbling and the different things are the result of the rider. And it's never an easy conversation to have with an owner. It's not an easy thing to tell them they're awful. So I've always said that like the ultimate equine facility would be a veterinarian, a farrier, and a human psychologist. And then the owners just go away with the psychologist and we work on the horse and they lay on the couch. But it might be a little ways off before we come to that. I mean, and so part of the reason that interaction between us is important too, is because there is something in the horse owner psyche. And like I said, I see a lot of the gray hair in here, and I know that some of us remember working for horsemen, and that demographic is going away from the industry. We're working for pet owners now, pet owners that often have very unrealistic expectations of the horse they bought. They bought a Yugo and they want it to perform like a Ferrari. And so we're the two that have to have the talk with them. The other thing that I notice with horse owners is they feel really good if they can blame somebody for the lameness. And that usually is the farrier, because we're in there under the feet. So anytime you can throw us a bone in those areas, it's very helpful. And it should be reciprocated by the farriers. The relationship, when I'm talking to the vet students, what I tell them is what I would like from you guys is to be treated like a physical therapist. You're the surgeon, I'm the physical therapist. And I've spent a lot of time in physical therapy, so I know how that relationship works. But the surgeon they send their medical records over and say, treat accordingly. And the assumption is that physical therapist knows what they have to do based on your diagnosis. So, and I think when you have that conversation with farriers, like Jake is a journeyman, and that, are you guys all familiar with the American Farriers Association and the different levels there? So I'm going to talk about it just for a minute because it'll be helpful to you. A certified journeyman farrier is the highest level of certification offered in the United States by a reputable organization. So the American Farriers Association has been around 50 years. It was the first certification in the US. And unfortunately, what happened is it was a very difficult test to pass. And so some associations popped up that dumbed down the written tests. They got rid of time limits and different things like that. The significance to the AFA certification is that we have reciprocity in England. So in England, to be a farrier, it's a 4-year program. It's 4 years spent at a university as well as working under what they call an improved training farrier. And then they have to be licensed. So they take and there's an independent test that they take, just like your boards, in order to become licensed there. And there's always a debate about whether we can do that in the United States. And I mean, I think the biggest limitation for us is that we have a huge geographical area, and we have got 9-something million horses compared to their 400,000 on that island. So it's something that they were able to institute with some success that I'm not sure we could do yet. If we created a standard for, let's say in the US, that you had to be a minimum of a journeyman farrier to be licensed, North Dakota would only have 1 farrier. So that's part of the reason that we can't really entertain that yet. So we have reciprocity there. If you're a journeyman farrier here in the US for 2 years, you can legally shoe horses in the UK. And then it also opens up the possibilities to sit for their higher exams. So there's the Associates of the Worshipful Company of Farriers. I think there's currently 20 or 22 farriers in the US that have that. There's very few even in England. That's 3 days of testing. I went through it, and I think the best way to describe it is being violated by a pineapple. I mean, it was, yeah, hopefully that wasn't too graphic, but it was a tough 3 days of testing. Above that is what they call a fellow of the Worshipful Company of Farriers. There's currently, I believe, 6, 7 maybe in the US. Some of the ones we count here have moved from England. There's a few of us that are in the process, and that is actually more of like a master's level. So you conduct research, you write a dissertation, you defend your dissertation, and you go through another 2 days of testing on top of that. Middle America is tough for finding those farriers to work with. But the reason I think it's good for you to understand those levels is because you can go on the AFA's website, look under Find a Farrier, and you can find those members in your area. And so the entry level is called a certified farrier. So you might see CF behind their name. There is a midpoint, which is certified tradesman. Very few farriers do that, but that would be in between the certified farrier and the certified journeyman farrier. And then there's the CJF, which is the highest level the AFA offers. Those would be the farriers ideally that you could find to help you with the lameness that you're working on with your horses. If you can't find one that has any certification level, if they're a member of the AFA, that's a good indication that they're working on the certification and that they're attending continuing ed. So they might be the best that you get. So then going forward, the question that I get from all my students is, how do I know if I have a good farrier? We have the same question for you. How do we know I got a good veterinarian? And that's just an honest answer. Some of them don't diagnose well, and we really rely on a good diagnosis to treat the horses. But my advice would be to use your big words, because you guys paid a lot of money for big words when you went to vet school. So use those anatomical terms with the farrier. If the farrier doesn't know them, then they're probably not qualified to work on the lameness with you. So proximal, distal, I mean, don't dumb down any of that language for the sake of the farrier. And then at that point, if you're talking about these treatment options with them and you're using your big words and they're just sort of looking off into space and kicking the dirt, then it's fair to say, have you worked on this before? Are you comfortable with it? They'll usually be honest with you and say, no, I haven't. I don't know what to do. And then now you guys have a conversation. Well, I listened to this lecture with Doug Russo, and this is what he thinks will work. Or this is what I've seen other farriers do in the past, and it seems to be effective. The other thing I really try to instill in the vet students that come through is that you're like, in what you're going to see today as we go through this, I try to include all the different treatment options, but you're going to see some of my bias built in. Some of the things that work for me are going to be primarily in these slides. If you force a farrier to use my method rather than theirs, your outcome won't be as good. Prognosis is going to go down. There's a bunch of different ways we skin cats. And so the best thing is, like, if you're dealing with, let's say that mechanically you need to raise the angle of the coffin bone, there's a bunch of different ways to do that. If you pigeonhole the farrier into saying, I want you to use this grand circuit P shoe with this, certain product wedge pad or whatever like that, farriers never used it before, probably not going to get your best prognosis. So that's where that communication is really paramount. And the other thing is that he can give you some history then on what he's seen in the past, and maybe that package isn't going to work anyway. So you guys can work that out, having a discussion together. This is my apprentice. I actually have a new apprentice now that I haven't gotten a picture of, but he got his feelings hurt that I didn't include him in a lot of my talks. So I wanted to give him special recognition. So just a quick review of anatomy, what I was talking about with the biomechanics and how farriers have to understand that. The easiest way to remember it is when we wedge heels up or raise the heels or increase the palmar angle of P3, we put slack or reduce tension on the deep digital flexor tendon. Everything else becomes taut or becomes tighter. And so when you're looking at this structurally, we're taught that, tendons and ligaments, there's always an antagonist, protagonist, or this opposing force. Well, the deep flexor tendon really is kind of working on its own in the backside of the limb. The reason that our superficial flexor tendon and suspensory ligaments don't react the same way is because they both bifurcate and attach on the dorsal surface. So that's why those become tighter as we decrease the tension on the deep. And if you've had an opportunity to dissect limbs, the deep digital flexor tendon is massive. It's a structure that we can usually safely transfer load to. So if we need to take the load off the suspensory, I'm not so worried about putting it on the deep. Whereas if I need to take the load off the deep, I will worry about the suspensory. So that's where I say farriers then have to kind of juggle based on what the horse does for a living, the kind of the ground that he's working in, what kind of shoe and how much we can load those other structures. So I think I don't need to go all through these. I will add that this is another one of my research projects for down the road. We don't know a lot about the sesamoidian ligaments. And you're probably all familiar with those. So below your proximal sesamoids, there's a series of overlaid ligaments, superficial or straight, abaxial, deep, or cruciate, and then short sesamoidian ligaments. We are diagnosing more and more desmitis or strains in those than we had in the past because we have better ultrasound and MRI. So it's like years ago, I don't think we even knew that they could injure those ligaments, but they do. The straight sesamoidian ligament, I don't have a picture of it, but so your sesamoids here, it's the only one of those sesamoidian ligaments that bridges a joint. So it attaches at the proximal end of P2. And I know from models that when I wedge up horses, because the deep does supply some rigidity to the fetlock, when you wedge up a horse, you'll see the fetlock descend slightly lower than normal. And that's what's increasing the tension on the superficial. But when I do that, what I see is the pastern joint comes forward slightly, the fetlock descends, and I can make an argument in my mind that it might take some of this, it might relieve some tension of the straight sesamoidian ligament if I wedge. That's another thing that, like as we get more and more information back from ultrasound and MRI, we're realizing that we don't know what to do for a lot of things. Another one is the impar ligament, where we're having horses diagnosed with tears to the impar ligament. And I don't know what to do for that. I don't know if I wedge those horses or lower them, or like what I've done so far is just stayed in the middle and protected the foot from pain. But a lot of information, like the more diagnostic tools that we have for diagnosing these things that we didn't even know could be injured. Now the farriers have got that little lag in trying to figure out what we do for them mechanically to unload them. So that's kind of our wheelhouse. So then front and hind feet, just like the thoracic and pelvic limb of the horse, they're very different in shape. So front feet are real round. They lack some of the concavity, which farriers will usually refer to as vertical depth, where the hind feet are pointy and spade shaped, and they have lots of concavity or vertical depth. And what's interesting is that newborn foals are born with 4 identical feet. So when they're born, they have 4 hind feet. And those hind feet, this is where Wolff's Law and that bony modification come into play. They become round and they lose that depth as they're bearing more and more of that foal's weight over time. So because occasionally you'll see horses that have not lost a lot of that pointiness in their front end, but our shoes should always reflect the shape of the bone, and that's why I throw this in there. What farriers need to visualize in their everyday work is the shape of the coffin bone, and then that's what we need to fit, with the exception then of the conformational defects above it. And what the conformational defects above it are going to do is start to cause the coffin bone to demineralize or absorb on the side that loads first. And so that's where we got to be proactive then in our extensions and getting them to land flat and different things like that, is to try to avoid those changes. And I'll go ahead and talk about this now because it's going to affect some of the pathologies that we talk about. But the coffin bone is really unique in that there is no medullary cavity and there's no periosteum. So there's a debate on that. They say, some people say there is a bone, skin, or periosteum, but it doesn't function like a periosteum. So it might just come down to semantics. But what occurs if you have a coffin bone fracture is it isn't that periosteum that creates a calcified knit. It's those are healed by a fibrous union. So same thing goes then when you have areas of the coffin bone that maybe are lytic or taken away, or have just absorbed or demineralized. Those are gone for good. And then it's the farrier's job to try to maintain those horses going forward, which in some cases can be pretty difficult. But, and I don't know a lot about the other bones in the horse. It's the only one I know of that's like that. And it makes sense. I mean, if you ever have had the chance to hold one in your hand, they're really light and porous. And that makes sense because that's where your blood supply, your capillaries are traveling through all those pores, bringing nutrients into your sensitive lamina. And so it's kind of made to do the job it does, which is it provides, the more rough and porous it is, that's more surface attachment for lamina as well as the blood supply. So it kind of makes sense that it is the way it is, but it does create some limitations for us going forward when we have things that affect it. So balance and hoof mapping, this was actually a farrier from England that used this work for his PhD. And that's one of the things that we're a little bit jealous about those English farriers is when they graduate, they have a 4-year degree in farrier science and can go on to do masters and PhDs where, in the US, we don't have any opportunities like that for farriers. But what he looked at was a way to look at feet from the bottom, pre-trimmed, and determine the center of rotation of the coffin joint. And so this is a very complicated process that I won't explain it completely, but just a couple of really quick references to look at is when we've got a well-trimmed foot from the point of the frog to the very distal dorsal tip should be about 1/3 of what it is from the point of the frog to the trimmed heel. And then from the widest part of the foot straight across, if you were to take a ruler and find the widest part, then you should have 50% front, 50% behind. And what Mark Caldwell found with the process, there we go, is that if he could really find that center of the foot in his trim, when he went straight up from that perpendicular to the ground, he would intersect the center rotation of the coffin joint. And then his hypothesis is that if we can do that, we're leading towards that tendon neutrality, which would be ideal. So that's further work he has to do. But what we found is that most of us were already trimming to these standards. We just didn't have a way to describe them. But I did realize that a lot of the vet students didn't really have a way to look at feet and understand whether they were long or short, or whether toes were long or heels were long, or vice versa. So that 1/3 to 2/3, as well as the 50 at the widest point, kind of helps you get in the ballpark with those. Is there a question? So, excuse me. Not every foot can be trimmed into that model. And then that's where our shoes come in. So if you have a foot that you can't bring the toe back far enough, you could put a rocker toe on. So mechanically you've moved the leading edge back to that 2/3. If the heels are too far forward, you could fit your heels longer and then obtain that 50-50 or 1 to 2/3 ratio with the application of your shoe. So traditionally when you ask people why you shoe horses, most of them will say when the rate of growth exceeds the rate of wear. That is probably one of the primary reasons we shoe horses. But I think what it doesn't take into consideration are those proactive things that we could shoot horses for. There's a lot of horses that I would really love to put into shoes because I think I can make their career last longer. But you have owners that, you know, as long as they're staying sound at the moment barefoot, that's how they'll want to keep them. So. This is just a really cool view. So this foot is cut sideways, and when they did it, they were able to incorporate the nail. And so you can really see where farriers are in relation to the quick when we're shoeing horses. And this is when we fit up shoes, our nail holes should be fit to the white line of the foot. And that white line, it should be the inside of the white line. Okay, so the outside of the white line can develop flares, it can move, it can change, but the inside of the white line is the true shape of your coffin bone. And the white line is not a reflection of the lamina above it. It has its own terminal papillae. Its job is just attaching, it's a junction between the sole and the hoof wall. But farriers, long before we even probably understood anatomy, figured out that that was a safe place to nail. And it's a strong place to nail. If you have farriers that routinely nail into the hoof wall out here, they end up with those broken up, flaky feet, and that's kind of created sometimes by poor fit in the nail holes. But I think this is kind of a, you know, like if you've ever owned a horse and fired a farrier for quicking it, I mean, it happens. I mean, it's no matter how long we've been in it, it occurs. And as farriers progress in their career, you get much better at, like, you can actually hear by the sound of the tap on the nail where you are in the foot. And you can tell by the way the nail moves if you're close to the quick. And so as we progress in our career, a lot of times we can pull them before there's any blood. If we happen to quick them, we just leave the nail out. And as long as we don't put a nail back in, that'll be fine. So it's not the end of the world. It happens to lots of farriers. So I start with the big thing that we're all seeing right now is the laminitis. How many of you guys are working on these cases pretty frequently? It's like I said, this really is sort of an epidemic that has followed that pen owner demographic into the industry, right? And it goes back even like if you watch the Disney movies, if you look at the horses in the Disney movies, they're all obese. You know, and then there's they're Beauty and the Beast. I feel bad for that horse. He's going to founder. So that, you know, they're getting a ton of grain every day. They're never ridden or exercised. And farriers are usually they're the first boots on the ground because we see these horses all the time, and we'll be telling those owners his feet are changing, you know, and you need to get a vet out here. You need to start talking about diet and exercise, or and we need to get this under control. A lot of them really don't want to have that conversation, unfortunately.
So when you say the feet are changing, what? Describe that a little bit, can you?
Yeah, I'm going to get into those
Okay.
external markers. Good question. But and so types of laminitis where traditionally what we saw, right, was the grain overloads, metabolic, then systemic episodes where you like Potomac horse fever, things like that, retained placenta. Those are probably our two main causes. Their old timers used to describe what they called road founder, which actually should be called road laminitis. And that's when these horses are galloped down a really hard panned road. And it's just that concussion that's caused that laminitic episode to come on. But now in recent times, we actually have a term called chronic laminitis, which is really just associated with the obesity epidemic. And Dr. Scott Pleasant, was at Virginia Tech for years, did a lot of research in looking at those feet. And those are the ones I'm about to describe to you. The failure in those feet is actually happening at the basal cell level. So you have your primary and secondary interdigitation, right? So the primary one is the one you can see when you dissect and you rip the hoof wall off, and you can see those linear ridges, right? That's your primary attachment. In between those then is your secondary interdigitation. And then at the very core of that would be your basement membrane or basal cells. And so there has to be a mechanism built into feet that allow them to grow, because the bulk of your growth is coming from the coronary band down. So this lamina has to be able to release and and reattach to allow that hoof wall to grow downward. That Dr. Pleasant associated as the job or the main function of the basal cells contained in the basement membrane. And what he found is that when he looked at those under microscope, there were fewer of them and they were damaged. So there was a slow process of those there. They were not reattaching. And then what the farrier started to see was those changes that would follow in the hoof capsule. So that chronic laminitis will eventually always lead to an acute case. And that's what, a lot of the farriers are really trying to get these owners to call you and get you out so that we can avoid that. Treatment of laminitis, I have a very simple approach to everything. In my mind, the horse, the part of the horse that I work on, I can look at as a machine. It's a series of levers and pulleys and cables. And then the same thing with the way the horse responds to the pain in the position that he puts himself in. I have to make a mechanical case for my treatment. That's got to make sense in my head. And if I can't do that, I'm going to be very apprehensive to try it until I see some really good research and good data that's going to support it. So what is this pony trying to do when he assumes this position?
Pressure on the off.
He's taking the load off his toe, right? Yeah, exactly. He's moving it to his heels. So I don't need to get any more complicated than that. If I want to help him, what I have to do is I got to help him load the back half and protect the front half. It's that simple to me. And then there's lots of different ways you can do it. I'll throw this in there because this happens more frequently than we think. It's not very often that they found her or have an acute laminitic episode on all 4 feet, but they do occasionally. And it's oftentimes mistaken for colic by the owners because those horses will usually lay down. If their hind feet are just as painful, they won't put them up underneath in order to extend their forelimbs. And so those horses will either stand square and then intermittently pick up a foot, and they'll just kind of keep going around in a circle, or they'll lay down. Anytime that I have a laminitic horse that will lay down, that's the best place for me to have them, because if they're laying down, they're not doing the damage to their feet. And so I know that, like the NSAID part, that's your job. Sometimes I worry if we give them enough NSAID, then they get up and then we're doing the damage to the feet again. So a lot of people worry about them laying down. They won't get bed sores or things like that in a 1 week period, so if I can keep them there, I've got a better chance at handling the effects of the laminitis. So I want to talk real quick about rotation. Because I think that we need to make a distinction between hoof capsule rotation and coffin bone rotation. And the reason that I like to make that distinction is because you can have hoof capsule rotation or thickening like this on a healthy foot that's been neglected. And so prognosis is pretty good because I can take a lot of this dorsal hoof wall off in a trim and get everything kind of realigned and reorientated with inside of that hoof capsule. Whereas when we have true rotation of the coffin bone, meaning it's rotated downward out of relation between P1 and P2, the only way we can put that back is if you do a tenotomy of the deep digital flexor tendon and that to derotate the coffin bone. So I would work in support of you then in doing a reverse wedge shoe to help that occur. That, if you're familiar with that procedure, then that's selvage. So that would be pasture soundness at best. And then it's really paramount if we do a tenotomy that those owners are committed to regular hoof care, because if they let the toes get away from those horses, then you end up with a subluxation of the distal interphalangeal joint. Same thing, then we can't put that back once it comes apart. So I just like, and the other thing I was talking to, I didn't catch your name, but after the last talk, we were kind of talking about those x-rays and, it's another thing I have taken issue with in the past where when I have veterinarians like just are kind of arbitrarily drawing lines and say, this is ideally where we put the foot. The x-rays don't show us the quick. So we can't point to that and say, okay, this is where the blood starts. This is a sensitive lamina versus this insensitive lamina. So it's not always as simple for a farrier just to lop things off to that line, because we also have to worry about integrity of the foot. We got to leave enough hoof wall maybe to get a shoe attached to, or maintain some sole depth for the comfort of the horse. So we can't always just trim to ideal lines drawn on the radiograph, or we'll have horses that will not walk away in some instances. So here's what you were asking, man. First indication would be changes in your growth rings. So those horses, even if they don't have a true rotation of P3, there's going to start to develop there will be a mild impingement of the circumflex artery through the toe, and then you're going to see the heels start to grow more rapidly, and that'll be indicated in your growth rings right here. So you can see the growth ring here is wider at the heel than it is at the toe. That's one of the first things farriers will start to see on these chronic laminitic horses. And a lot of times the owners at this point have never reported a lameness, but we're starting to see that change. The other thing that we see is we start to lose the vertical depth in sole thickness. And that's going away. We recognize that as we knife out the foot, and we get to know these feet pretty well over 10, 15 years and seeing them every week. So we're pretty sensitive to those real little changes that we see. So then we'll start to see white lines that are starting to stretch and pull apart. When we see that, then we know that our lamina above it is becoming affected. And then the other thing would be like a lot of this chronic subsolar bruising. That lends to the myth of the white feet thing. That drives me crazy, what the fads that we see coming in and out of the industry. But you guys have probably all heard that white feet are not as good as black feet. It's been proven, it's pigment. But I think what makes us biased to the white feet is that we can appreciate bruising in white feet where we can't really appreciate it in black feet. Those would all be so mild changes to the feet that the farriers might notice going forward. So like we said, I have a pretty simple approach to these things, and I'm going to work at whatever I can do mechanically to help him load the back half of his foot. We're going to talk a lot in this lecture about a lot of other acute, like pretty serious injuries, street nails and severed tendons, those types of things. What I found that's been consistently true through all types of acute pain is that horses appreciate stability. And I can relate to it a little bit too, having been kicked in the knee or different things like that. I don't want to stand on a bubble while I'm healing. I want to have these affected areas kind of in a rigid position where I'm not working a bunch of soft tissue and muscle around it to try to maintain an equilibrium. And I find this to be true with our laminetic horses too, because there's been a lot of focus on breakover. And are you guys familiar with the whole horse lameness locators? Anybody used that? I wouldn't buy it. But it shows veterinarians asymmetry in gait. So there's a sensor on the pole between the ears, one on the withers, there's a sensor on the hip, and then there's a cuff on each foot. And where it was very useful, I think that the reason that there's some limitations to it is if you have a horse that's bilaterally lame, it's not going to show you any asymmetry. Unilateral, it will. But it gave us some really good retrospective data to look at through the company. because it would show you where the spike of lameness was during, in which part of the stride, right? So we break the stride into 3 phases. There's the swing phase, the strike phase, mid stance, and breakover. So what it does is it kind of tells you where that lameness is occurring. So obviously we don't see hardly any lameness ever in the swing phase. 60+% of it was during strike phase, 80+% during mid stance, 2% during breakover. And we've kind of put all of our eggs in the breakover basket for a long time now. If you had any kind of lameness, if it was navicular, if it was laminitis, didn't matter what it was, the answer was give it more breakover. Well, farriers are starting to discover that that becomes a detriment at some point. We keep taking the toe away, and we're taking away that horse's purchase and his ability to do jobs. So there's a balance there into where we can take that breakover to. The clogs I find very useful, but I don't whittle the bottom of the clog down to nothing. And so the theory behind that is that you have a horse with a size 2 foot, and then you whittle the bottom side of that clog down to about a little triple lot area that he's standing on. And I would ask, why are we doing that? And they say, well, then we put him in the shavings and he can move around and find a place he's comfortable. Well, on a laminitic horse, it's always here until you start to relieve that acute phase, right? So what I've learned is that horse didn't care about the bubble under his foot. What he actually wanted was some stability. He just wanted me to help him load the back after his foot. And so the clogs are really effective in that it's difficult to nail up an acutely lame horse, especially if we don't have you guys there to block feet for us. It's cruel and unusual punishment for the horse and the farrier. They're usually non-weight bearing on one foot or the other, and then the farrier's having to hold up the whole front end of the horse. So whenever we can work together as a team on these laminitic cases, I think it's a really good outcome for everybody, including our backs. The pads are a good option that a lot of farriers use. And then the heart bar shoe, you're going to see that through this talk that I use that a lot. I like that heart bar shoe, and that is a shoe that you can find farrier books that that have published 150 years ago. You'll find the heart bar in there, and they used them mainly for laminitis as well as compromised heels and different things like that. My choice in using the heart bar over the pad is that, remember we talked about the 2 separate loads of the horse, right? So you have the load of the horse coming down, you have the ground force reaction coming up. The rigid frog plate gives me complete control over both forces. So with the rigid plate, I've completely removed the ground force reaction. I've eliminated that completely. And then depending on how much space I leave between the frog and the frog plate, I can control how much load I provide the frog. Because some horses don't like an incredible amount of load on their frog. The only part of a horse's foot that we can really nail to with contact is the hoof wall. So if we've nailed up a shoe that contacts anything inside of the white line, that's called sole pressure. Horses will react poorly to that. Abscess sometimes after about a week's time or get very sore. And it's the same thing with the frog. Some horses will tolerate more frog pressure than others. And because I have a lot of horses coming to me from 2-3 hours away, I'm very conservative on the amount of frog pressure that I provide. And then what you can also do with the rigid frog plate is you could fill it with a downward pressure material too to take up that space so there's nothing wedging in between it. Where the clogs are really useful is that you're casting that on. So this one isn't finished, and I don't even do the 3 screws. I just do 1 screw either side just to hold it in place till I cast it. And if you have a horse that's extremely painful, you can stand them just on a little bit of a shim and cast it on the ground so that you're not asking him to load his other foot. So they're really good in a pinch, those clogs. When they first came out, I'll admit I was arrogant and biased, and I said, I'm not a carpenter, I'm a blacksmith, and I'm not putting wood on feet. And since then, I've put a lot of wood on feet. So it works. I had to eat some crow. The problem with this, and I've seen a lot of farriers do this, their reasoning is that they're giving the horse a lot of breakover because they move this back to here. The problem with using this for laminitis is that this is the most painful part of the foot right there. And now we've exposed it to the ground force reactions. It's no longer protected by our shoe. And the other problem with reversing this then is this shoe is mainly hanging out behind the frog. It doesn't adequately load the back half of the horse's foot. This goes back to, I can't make sense of this mechanically. If the toe of the horse is the most painful area and I wedge him up that drastically, I'm pushing everything distally and dorsally right into the circumflex artery. And remember, we talked about horses being pretty smart about where they place their feet. So if a horse was laminetic and painful and a wedge was going to relieve it, I would see those horses bring their feet underneath and stick them in a hole. And I just am not observing that. So, you know, what we have found is that these are sometimes beneficial in some cases, but if you really look at the research behind them with the fine-tooth comb, they don't have a power analysis that's statistically significant. There's also no control. So they're always placed on both front feet of the horse. And then they'll look at venograms, usually within a couple of hours later, that indicate they've increased blood supply. This first came out about 20 years ago and was presented to a lot of the farriers at convention, and most of us all went and tried it. And you'll find that most of the farriers have gotten away from doing it because it's not been effective for them. So there's more research that's needed. A lot of the problem with research right now in the equine industry is that we're not including enough farriers. And so you'll read a lot of research that's, you know, talking about different shoes and the effects that they have on the feet. But in the research paper, they never describe the trim or the fit. Those would be the only things that make those shoes effective in a consistent manner. So if you gave that shoe to 5 different farriers, you'd have 5 different fits and 5 different trims, and you would not have the same results that the study is talking about. So there are some areas that we've really got to catch up on the research and the things. I think part of the reasons that we see those horses improve sometimes with this method and even that method is that we've just given them some space from the ground. And that's where the control is so important, right? Because the question always is, how do you know he wouldn't have gotten more better with a different process, or even had gotten better on his own with no intervention? Those are always the questions that we are left to ask. So needless to say, I'm not a big fan of the wedge. So, yes, sir.
There's finding benefit by putting the pad underneath that shoe
Under the wedge shoe?
or the hard part shoe.
Oh, the hard bar. Yes, I do. Yeah. Yeah. And so that, you know, like you can do any combination of things. And it's a good question. So a lot of times we will add a pad underneath that shoe, put some packing material under it. A lot of times I'll cast my hard bars on, so I'm not having to nail into an acutely lame foot. And the other thing that I can do with my cast, because this is another reason I think the clogs are so effective, is they eliminate any ground force reaction through the toe where those horses are so sore. A lot of times we were putting these laminitic horses into sand stalls, and I've noticed on occasion that they do better on a hard surface if you've loaded the back half of their foot. And the reason is because they don't have any sand or shavings coming up and hitting the area of the toe. So the clog is effective that way in eliminating the ground force. I can achieve the same thing if I cast my heart bar on, and what I'll do is I'll roll my cast out maybe 3 feet and then just fold it back on itself so that I have maybe 6 layers of a square about that big. And then I lay that over that area of toe that's exposed and then start casting around the base and up the hoof wall. And so you can kind of achieve the same thing. Lots of different ways. And I think we just have to pay attention to what the horse is like. I never commit to any of these things until I look at the horse's reaction. So I'm not gonna just stick 6 nails in my heart bar and clinch the foot and put it down. I'm gonna put 2 nails in my heart bar, give it back, and I wanna see him bring it back underneath him and lick his lips. And then he's saying, okay, that feels better. If I get nailed up and he's still out here, then I have to revisit that and try to figure out something different. So, and then there's always the outlier, right? So there is a Tennessee Walker stud that's come to me for 4 years now. He is so badly foundered on the 1 foot that most of P3 is gone. He still has the coffin joint intact, and I don't know how he gets around. That horse, I did the same process, putting shoes on, watching his reaction, putting shoes on, walking his reaction. That horse made a liar out of me when he reacted to the wedge. I put a 2-degree wedge pad on him and he put his foot underneath and stood on it. So there's always those outliers or exceptions to rules and different things like that. And that's where we can't really get too hyper focused on the one thing with these horses. So this is the farrier end of it. And then really, you know, the prognosis for these horses then comes back to you guys and owner compliance. So equine metabolic syndrome, Cushing's, those things like that. If we can't get those under control or get those managed, then it's kind of a dead end road for the farriers. We're just going to keep battling the frequent episodes and different things like that. So any other questions on the? So I told you we'd talk about quarter cracks. How many of you have dealt with these? Too many, but so quarter cracks are usually associated with medial lateral imbalance, or that imbalances strike phase, or like we looked at that horse earlier that was overloading the medial heel. They can also be created by farriers that are doing what we call short shoeing horses. So they're fitting the shoes, the heels of the shoes too far under the horse, or leaving too much length of heel. And that can cause that to happen. So the thing is, and it's like I was telling you, quarter cracks don't happen to good farriers with horses that stay on schedule, unless you have the catastrophic deal where he kicks a stall wall, right? And so that's a near avulsion, but that's different. So these don't occur to farriers who are proactive in their process, right? Because we're looking at the coronary band, and so you can see this is pushed up proximally here. That's going to happen long before the crack results. So if the farrier is actually there every 6 weeks, they should be able to see that and address it in either the application of the shoe or their trim before that occurs. This one here, this is just something I found on the internet, but remember I told you those heels modify. See how these heels are bent like this? This horse should have his heels trimmed back all the way to here. So there's a lot of length in those heels, and it could be that he's way past his regular shoeing, or it could be that they were left too long in the trim to begin with. But you see that this crack corresponds with where that shoe ends. And the reason that's occurring is because you have those heels, and this is another thing that's hit the horse industry in more recent time is we have owners telling us don't touch the heels, don't touch the heels, don't touch the heels. Can't get any heel on this horse. Well, heels don't grow, they don't grow straight down, they grow forward at roughly the same angle as the dorsal hoof wall. So if we let those heels get too long, they grow out in front of the load of the horse coming down the cannon bone. And so that will result in this too. So now you have the heels are clear up here, you have the load coming down here, you have the ground pushing up here, and then you see that rise in the coronary band. So I'm very simple in most all of my approaches. And this is the simplest way that I can fix these cracks. The first thing that I have to do is address the unnatural position of the coronary band. So I have to give this heel a place to settle. so that I can get this to come back to normal. And then anytime that there's a crack in a foot, and you'll see this throughout a lot of these slides, if I have a deep crack or a fissure in the foot, I always open those up, whether it's a horizontal crack or a vertical crack. And you'll find lots of dirt, debris, and bacteria way down deep in those cracks. And they don't heal well until we get them opened and get rid of that. I think it almost is, there's some abrasiveness down in there that keeps it from really knitting or healing at the level of the sensitive lamina. And those quarter cracks, true quarter cracks are usually bleeding. And those horses are usually, they're typically packing that limb. So you're looking at a 4 out of 5 really on the AP scale. If we can keep this heel from touching the shoe when we're all done getting it nailed up, if we can keep that from touching during mid stance, those horses will trot out completely sound, even with that bleeding quarter crack. It's one of those things that I like working on these, because I usually get to always look like a rock star. They go away looking really good, and I get a hug and the owner cries and everybody's happy. Whereas with the navicular laminitis, it's a crapshoot, whether or not we're going to help them. So these are always good ones to get for me. So what we're doing with the hard bar here is just taking the load off of the affected heel and moving it over to a healthy frog. So the frog is something that we often overlook when we need to redistribute weight, but it bears weight well. And it can handle that job when we need to heal other parts of the hoof wall. So the tough one though is if you have asymmetry in landing and things like that result in sheared heels, as opposed to the quarter crack, because then this is affected all the way through your digital cushion. And we don't have a healthy frog to transfer load to, and we don't have a healthy heel to transfer load to. So these horses usually go into a straight bar shoe, and we just try to get them to land as flat as we possibly can, and they take much longer to heal and get sound than quarter cracks do. And this is all in jest with this stupid treatment options, even though I really think they're stupid. Part of the thing is here, like I see this a lot, and it's a good attempt by somebody to stabilize the crack, but the problem is that the cause of the crack hasn't been addressed yet. So we put a Band-Aid on a pretty severe wound, and we've got to address the cause of the wound before we can get the wound to heal. So putting a plate on there isn't going to cut it. We've got to get the load off of the heel, and then resect that crack. They heal much faster when they're opened up. This is effective, but it's very expensive. It's very difficult for farriers to glue shoes, especially in the field. I work in an environment where I've got a climate controlled shop. I have veterinarians that can block feet for me, sedate horses, all that kind of stuff. So even with all of that, I look like a monkey humping a football when I glue a shoe on. I'm not good at it. There are farriers that are very good at doing that. They do it like Travis Burns is at Virginia Tech. He's like watching a ballerina glue a shoe on. He's incredible. And that's where I talk about, we all have our different strengths and weaknesses, and he's good at that. He should do it. I'm not good at it. The other thing is that, like I was saying, he has a client base that's very close to that university and is really high end. I have horses coming in from Missouri, Nebraska, South Dakota, North Dakota, Minnesota, and Illinois. And I never know who's going to do the follow-up care on these horses. So putting a glue job on like this, and then expecting a farrier to do the same thing in a run-in shed full of manure when it's 105 degrees and the horse is covered with flies would be pretty unfair to that farrier. It's never going to get it done. So that's where I say I try to communicate even with my farriers that are referring animals, and I try to, like, what are you comfortable? What have you used? And then I try to send those horses home in a package that they are pretty comfortable resetting. And it actually has resulted in more referrals coming in from farriers because they're not really threatened by me taking the work or bad mouthing them in any way. But so that can be effective. And the thing is that once this is done, the piano wire and the drain tube, this is all covered with the glue. And the glue they use it was called Equilox. It's a polymethyl methacrylate 2-part deal. It gets pretty hot when it sets up. And then once that sets up, they pull this drain tube out. And then theoretically, they do not have a anaerobic environment, right? Because they have a little hole at the top and the bottom. And the problem with those sometimes is that those horses are standing in their own manure and urine, and those holes become plugged and then trap your bacteria behind it. And then they develop abscesses behind the patch. So I am very apprehensive to patch feet. Usually the only time owners can get me to patch feet is if they have to show in hand the next day or something, and they need to look like they've got a full foot there. But then I'm usually pretty insistent we get it off, because especially with these, like a bleeding quarter crack, you're down to your sensitive structures. And I like to be able to monitor those and see, do they look good? Are they healing? And if I patch them, I can't see them anymore. And so then you're just kind of guessing on your 6-week cycle if you're doing good or you're doing bad. The problem with this shoe, this is a very effective shoe. A lot of times you'll see a little bar coming over here, and they call it a G bar. Farriers are not very creative in their names. If it looks like a heart, we call it a heart. If it looks like an egg, we call it an egg. This shoe would actually be very effective if that horse did its job on concrete. Then it would effectively float the heel. But if this is a barrel horse that I need to run the next day, as soon as that barrel horse hits the sand is going to contact that affected heel, and then that horse will have that head bob lameness. So that's why I use the heart bar, so that I've eliminated the ground force reaction into the affected heel. Any questions on the quarter cracks? Those certain conformations that, like I was saying, those toed out horses in the wrong circumstances, a lot of times those horses end up just living in a heart bar with a floated heel. I can't do enough to get rid of the conformational defects to keep the quarter crack from reoccurring. So I just perpetually treat the quarter crack. As long as I keep it off the shoe, I can get it to heal, and I can keep the horse sound. So there are certain therapeutic shoes that these horses just live in. And I don't know if you guys remember, it was 3 years ago, the horse that won the Kentucky Derby, that horse ran in heart bars. So there's, they can do any level of athleticism that they had prior, with the heart bar on, as long as it's doing its job and alleviating the pain. Toe cracks are kind of a different breed. They're not usually associated with the medial-lateral imbalance in feet. And most oftentimes I see these as a result of either a scar to the coronary band. And so remember, our coronary corum is where the bulk of our growth is coming from. So if we disrupt that, that's going to result in a scar. And if you manage them well, it'll usually be what farriers would call a false quarter, where if you run your finger along the footwall, you'll just feel a little indentation when you get to that area where the scar of the coronary band is. And if as long as you're resecting it frequently, keeping maybe some clips on it, maybe a bar shoe, you can keep it from going all the way to the coronary band and making the horse lame. But it's always going to have some defect there. This right here, you guys probably call CD toe. A lot of farriers call it CD toe. And when you pick those horses up, you see this right there at the distal tip. So remember, the coffin bone is the true shape of the coffin bone is the inside of the white line. So if you follow that white line, this horse has a divot there in the distal tip of the coffin bone. So that is common in 80-something% of front feet. 60% of hind feet have a little divot that we call a crenna. Some horses have a huge crenna, And the reason that we would determine whether it's a crenna versus an old lytic episode that ate away the coffin bone, or a sequestrum or a keratoma, is that the crennas are typically bilateral. So if you're questioning those, that would be one diagnostic tool to use, is maybe shoot a quick skyline of the other foot. If you can't really get a good picture of the white line. But you see, with anytime that the hoof wall is forced to fill in this bigger area than it naturally usually does, I find that they become weak. And then you see like these linear striations, and they start to pack with debris. And then the more they pack with debris, the more you see this toe crack start to generate from the ground and start to go upward. And those are really simple to fix. I just resect them. It's just the same thing as the quarter crack. What's causing these is the debris in the bottom of the foot. And as long as it's there, we won't get that to heal or grow down. So we got to get it opened up and get it back to a good lamina attachment, and then start to let it grow down. And I have had horses that live with a small resection right at the very distal tip. As long as every 6 weeks, I just resect that 1 inch, I can keep a crack from going all the way to the coronary band. If I stop that little 1 inch resection, then I can tell you in probably about two cycles or 2 6-week periods that we'll have a crack all the way to the coronary band. And then depending on how deep those are, they can become unstable and move, like that picture in the middle. So this is kind of the process of resection, and you could use a Dremel to do that. I have a pair of half-round nippers that I do most of my resections with, in a very sharp knife. So I do most of the resections with that, but Dremel would be appropriate too. And you want to just get rid of everything that's undermined, everything that looks dirty or affected. It just needs to go away, and you start getting those to grow back. Now, then, depending on how far they go up, and if there is instability of the hoof, then we would add the clips here. So you guys are familiar with clips, hopefully. They're the farrier's best friend. The old saying is that a clip is as good as 2 nails. And like I have a lot of horses with small feet. If I have a toe clip on them, I'll just put 4 nails in those and keep shoes on for 6 weeks. When the clip is properly applied, it's angled to the foot, and then it's burned right into the dorsal surface of the hoof wall. So it makes that shoe become one unit with the hoof. And so when they're stomping flies all summer long, instead of working our nails loose, that clip is kind of keeping the shoe with the foot. Very good things to put on feet. If they're done properly, they've kind of got a bad name because a lot of our pre-clip shoes come as side clips. So side clips would be between the 2nd and 3rd nail hole. And if you have a horse with a long, narrow foot, by the time you shape that shoe, a lot of times those clips are behind the widest point, which could be detrimental to the foot. The other thing that started happening is the farriers that didn't own forges would nail those shoes on with the clip sticking straight up in the air, and then bend the clip over with their hammer, and it would result in creating like a fish hook. They were just driving the very tip of the clip in, and then if the horse pulled the shoe off, they would pull a chunk of hoof wall out underneath the clip, and then that owner is ruined forever. I don't want any clips on this horse, never. So if they're applied right, they work really well. So those would help stabilize or remove a lot of that instability in the very distal part of the foot as it's moving in and out if we put clips on those cracks. And the reason I draw every clip by hand out of the fire, and it's because I can put them where I want them on the shoe. I can make them tall, wide, short, thin, whatever I think that horse needs. I have control over that, as opposed to the manufactured ones I don't have as much control over. This is like the definition of insanity right here. So like trying the same process over and over and expecting a different result. So there's like a whole year's worth of horizontal rasp marks in the foot. And the sad thing is that this crack's actually coming from the coronary band downward. So the horizontal rasp marks do not work. It's the same thing. We have to be dealing with the cause of the crack, and I don't know where those came from. I'm not sure how that got started, but this is like, this farrier here did what this horse needed. The side clips resected the crack. But this idea of burning in the half moon is sort of the same as the horizontal rasp marks. It's the crack doesn't know it's supposed to stop there. So until we can communicate that to the crack, we have some limitations with both of those. How many of you seen white line disease? And how many of you saw it on neglected horses? Yeah, so it's pretty common when we have pretty severely neglected feet where the white line and lamina has been stretched apart and become very compromised. A lot of times when I see it in healthy feet, it's on the side where the horse lands and maybe has a kind of a perpetual flare. And then those flares end up with a mild detachment of the lamina. And then that anaerobic bacteria that's associated with white line disease is opportunistic. So if there's a part of that white line that is stretched, pulled, or it's lost some integrity, it's easier for that anaerobic bacteria to enter those areas. So like on hind feet, I often see it on the lateral quarter of the hind feet where that horse kind of lands and pulls and develops a flare. This foot was kind of disappointing for me because this is a really well-trimmed foot that is on a regular schedule. And so that's on that farrier for not finding that. Because this is what that foot looked like after I resected it. So that had been going on for a long time. And so that's where the farriers really need to be on top of looking at the integrity of the white line, the position of the coronary band, all of those things we should be monitoring every 6 weeks. And then, like if they had discovered that there was a little bit started right here, and may have only been just a tiny little resection and that horse would have been back to work. It takes roughly a year to grow a foot from the coronary band to the distal tip of the toe. So this horse is looking at a good 8-10 months to get that hoof wall down. The thing with white line disease is there's no lameness associated with it until enough of the hoof wall becomes undermined that it flexes. And so this horse, as soon as she would go to break over, that dorsal hoof wall would flex and then push into her extensive process, and she would snap it straight up in the air and then put it back down again. So it's that the hoof wall flexion that is actually causing the lameness. So until you have that, you don't usually have lameness with it. And then once you get the hoof wall off, they're usually sound. So this mare had a long walk down a gravel road to get to a paddock, and I was all for just leaving her barefoot, or even have you guys seen the soft ride boots? Well, if you don't have those in your truck yet as an equine veterinarian there, I wish I had invented them. I could have retired before my back was shot. But those are great in a pinch like that. So that owner could have put a soft ride on that foot, walked it down to the pasture, and then took the soft ride out once that horse was in the grass. But they're a really good temporary Band-Aid for a lot of lame horses, especially I should include that in the laminetic part of this, because that's definitely an option, as well as the foam boards. So if you guys have ever cut rigid insulation out to 2-inch rigid insulation is another really quick fix in a lot of different scenarios. So anyway, what you see on there is a heart bar shoe with the toe cut out. Because if I left the toe in, I would have been pushing right on the sole and the circumflex artery. I didn't want any pressure there. And it did what I expected it to. It fell off in about 2 weeks. And then the owner went and bought soft ride boots, and that was how we got that horse out to pasture after that. As this grows back in, it needs to be monitored, because the growth coming at your coronary corum, well, it'll start to develop like a little shelf or a cavity. So anytime I've got a resection, whether it's a quarter crack or anything else in the foot, let's say it grows down 1 inch, I might have to resect a quarter, and then it grows another inch, resect another quarter. But I want to keep any kind of cavity or tract from developing as it's growing back in. Try to maintain it all and keep it good as it grows downward. So this was talking about being kind of affected in that area, and this is a hindfoot. And so you see that there's some purple stuff poured in here. Thrush buster or something like that. Every year there's a company that calls me and wants me to try a product that is guaranteed to kill white line disease without resecting the hoof wall. And I tell them honestly, even if it did kill the white line disease, I'm still going to resect the hoof wall, because any cavity that's in there results in movement, and the movement constantly tears the lamina above it. And so it's really hard to get them to grow out until we just get rid of the affected stuff. And that's the rule for me, whether it's the frog, the sole, the hoof wall, anything that no longer has a viable attachment, I'm getting it out of the picture. So we're not dealing with the consequences from it. So I'm needless to say, I don't use the products. And, you know, once you've resected it, the owners will say, should I put something on it? And I say, if it makes you feel better. But I mean, really, once the air's there, then that's basically our biggest component to killing an anaerobic bacteria. So navicular disease. So this is the other thing that probably, I'm guessing, a bunch of you are dealing with in the heart of quarter horse country. We did have one of our equine surgeons that was in the process of looking at genetic components to navicular disease. Were you around when Casson was working on that? I don't know that she ever finished the research, but I think it's kind of a no-brainer that there's a genetic component. I mean, we see it primarily only in quarter horses, some thoroughbreds, rarely ever in warm bloods, never in Arabians, draft horses, we don't see it. And then traditionally, it seemed like we would most of these horses we would diagnose with navicular changes around the ages of 10, 12. And then what's been happening more recently is we have horses coming in younger. So some of them coming into Iowa State where we're seeing pretty significant changes in the bone at the ages of 5 and 6. And so I oftentimes wonder if it's, you know, so a lot of times these horses are barrel horses, they happen to be mares. We have to retire them at the age of 12 because they can no longer run barrels, and then they become brood mares. And so I think we've probably kind of perpetuated the genetic component. Part of it made it a little bit worse through poor breeding. But these are all different radiographic changes you'd see, and I'm sure I don't need to tell you guys about these. The thing though with these, it's like we always talk about getting away from calling it navicular disease or navicular syndrome, because then we only ever focus on the bone. And probably it would be better to call it caudal heel pain, but I don't know that we've been doing this too long to really probably change what we call it. But a lot of times we have horses that are blocking to the PD. We can obviously see that they have heel pain, but they have no real changes in the bone itself. Well, there's a lot of soft tissue components there. So your impar ligament, your suspensory ligament of the navicular bone, your deep digital flexor tendon. There's a bunch of tiny little collateral cartilages coming off either side of it. So any of those things could also be affected, and then really could only be diagnosed through an MRI, which is, like I said, still pretty rare that we get horses to go through the tube for this. So typically what the surgeons at Iowa State are looking for is a distinction still in the medullary cavity. So you want the real bright white cortical bone around the outside. The inside should still look black, and there should be a nice defining line. So if you're starting to lose that, if it's starting to lay down bone in that medullary cavity, that would be an indication that there's changes there to the bone. The synovial invaginations, which the farriers traditionally call lollipops. Do you guys call them lollipops too? Yeah, and then usually when we see these hooks, that would be a mineralization of the suspensory ligament of the navicular bone. So that now you have a soft tissue structure that's starting to lay down bone.
And then this was one of the coolest things I've learned working at Iowa State. Because you guys always called those cysts. And then not having a medical background, I always assumed a cyst was a bump. And so I'm thinking these horses have a bump on the navicular bone. It's actually an erosion. And so you can call that a cyst as well. And so that's one, I get access to a lot of legs, and then being in quarter horse country, a lot of the horses that we put down are on account of this navicular disease. And so it's really interesting to get in, for me to get in there and see these bones and actually get eyes on them. And so here's one with that erosion. So what's directly associated with that erosion would be your deep digital flexor tendon. So that navicular bone would be the third scutum below the fetlock. So you have a distal, middle, and proximal scutum. And so your top one would be your proximal sesamoids. So that navicular bone has a big job to do in acting as a fulcrum for the deep flexor tendon. And so that's where we see that involvement with the deep. And if they have erosions this severe, then they'll develop, or oftentimes develop, adhesions to those. And then a lot of times, especially when you shoot your lateral, you'll start to see where that deep is starting to mineralize or lay down bone, where it's associated with those adhesions. And I've had the opportunity to dissect a couple in now that had the adhesions to the deep, and I could not pull the deep flexor tendon away from that bone. When I did, it took a great amount of effort, and I actually pulled strands off of the deep flexor tendon that were still adhered to that bone. So it's got to be really painful for the horses. So the tough thing for farriers with navicular disease is that it's a crapshoot for us, because we never know exactly what could be affected besides the bone itself. And so wedge them, don't wedge them, protect them. I mean, we have pretty much what I try to prepare the owners for is I'm going to have to play with the shoeing and see what works best for your horse. And if I can get it going sound, I don't know for how long it'll be. It's progressive, it's degenerative, and I try to prep them for that up front. We still usually get fired. Like when we get to that point, we can no longer keep the horse sound. They don't want to quit, so they'll go find another farrier that can maybe try something different, but so I usually try to lead with that. Prognosis is not good here. I'm going to do my best, and if we can get them sound, I don't know if it'll be for 2 years or 6 months, or if I'll ever be able to get them sound. So the one thing though that I'll add is that I have gotten to the point where when I see these erosions that are on the flexor surface, when I know the deep digital flexor tendon is involved, those are the ones that I'll usually go ahead and wedge. Because there's no doubt in my mind that I have a deep flexor tendon component to that pain. And so otherwise I'm usually conservative in wedging those horses up. So lots of different ways it can be accomplished. Same thing. So when you have these horses come on and it's still pretty mild, a lot of them will do good just with a pad. The shoe with a pad will be enough. If they're barefoot, a lot of times just adding the shoe will get them some relief. And then from there you have, all your different options. That's just a shoe. That's a handmade shoe that has the wedge built right into it. So double-edged swords then is that's kind of what we start getting our stuck in, right? So we have a horse that we know already avoids his heel because his heel's hurt. He gets relief during mid stance because we've put some slack into the deep or taken some tension off of it. But now we've created a heel in the shoe that he hits first. So now it's harder for him to protect the heel in his landing when he's trying to stab his toe into the ground. And so we can get creative in those areas. This is a hand forged shoe called a navicular relief bar shoe. And so the front of this shoe has the wedge built into it, but then the whole back 2 inches is pretty much just cantilevered off the ground. So you're eliminating or drastically reducing the ground force reaction or concussion through the heel with that shoe. And then this is the same thing. This is this is a wedged bar shoe, and then I just hammer in a chamfer to the back of it. And I can move that chamfer pretty far forward in the shoe. I always stay about a ½ inch behind the widest part because I don't want to risk those horses rocking backwards, especially if they're moving at speed. So I try to maintain the stability in the front half during load. The purpose of that chamfer or that forged down bar is to really just get them through the strike phase of the stride. And I have figured out how to do this with when I started at Iowa State, there was a whole rack of aluminum wedged egg bars, and I don't use egg bars for hardly anything. If I do, it's usually transitioning a horse out of a patent bar shoe. We'll talk about those in a minute. But I figured out that in one heat, because aluminum is, a lot of farriers are kind of scared to forge aluminum because it'll melt at about 1200 degrees and our forges are about 2000. And so if they just spent 30 or 40 bucks on a pair of shoes, they're not going to risk melting it in the forge. It doesn't show any color, so it always looks the same. You got to get used to timing it. And then I bring it out and just run my hammer handle across it. And if it leaves a nice black smudge with no smoke, I'm ready to work. If it slides across there and smokes, I got to let it cool for a second, because if I hit it, it'll just break into a bunch of pieces. But once you get over your fear of forging aluminum, it holds its heat forever, and it's actually kind of fun. So in one heat, I can take that wedged egg bar and square up the back and put in my chamfer deal. And it's kind of a nice, quick, easy way for me to see if the shoe's actually going to work before I go through all the time and effort of forging the shoe. So once I figured out those aluminum shoes will work, that's the quick, easy part. Then I can write down that horse's dimensions of his foot and have him a steel pair all forged up when he comes back. And then the advantage to the steel is that I can reset it for a year. Well, a lot of those horses, it'll last forever. Whereas the aluminums, you're going to be redoing it every time they come back in. So there's I think probably the only real advantage to aluminum is the reduction in weight, and how much horses really can tell, I think, is debatable. I mean, we talked about the peanut rollers earlier, and those people, I'm almost sure it's it's in their head, because if you hold those shoes in your hand, you can barely tell a difference in weight, especially a light steel shoe compared to the aluminum. But they're trying to avoid the knee action on some of the disciplines that a heavy steel shoe would give. One of the things that can be detrimental with aluminum is that it's sticky. So it's going to increase traction on a foot. And we've learned, especially in the racetrack industry, as they've gone away from sand and started introducing the synthetic tracks, that was the biggest thing that was detrimental to those horses, is that the feet no longer came down and slid. Those tracks were made out of rubber and the shoes were made out of aluminum. And when those feet came down and hit, they came to a hard stop. And so then they saw this increase in soft tissue injury as opposed to catastrophic injury. So we took for granted that they need that little bit of slide. So too much traction can hurt these horses, and so that's where you'd have to maybe take some of that aluminum factor into consideration. How are we doing on time? You guys ready for another break? Or? Yeah.
Right at 11 o'clock.
Yeah, this young lady back here just went like this. And yeah, let's do another 10-minute break and then we'll get through the rest of this. Well, I gotta go down to keep I figured they just.
Yeah, you just about did.
Yeah.
How you doing?
Same thing as these 3D beds. Only difference is the 3D beds. The casting pad. $15 a pair. My issue is I have 3D pads. We're using impression material. And then you have them for like first two. Or I can just use the castle. Red or black. Fill with that impression material.
Yeah, I think.
People like clients like shiny.
Yeah, so they were.
What they just put on. In the 70s and 80s, you know, it was the Myron plane that you opened up West. I think it all.
Right. Oh. Okay.
Correct. Well, so I think. If you're careful. So you're already sitting at 57. Now. Maybe that's why we're seeing. Maybe that's why we're seeing damage from the. Hiring.
Yeah.
I don't know. Probably. Center of location. I think.
Stated that.
Showing the scene. Never.
Yeah.
The problem is. Not even necessarily. And I don't know how anything else. But that's not what we decided, but they're just basically finding and shoot back. Yeah, because now this is really short shooting. Because there's no way to get a deal out of it. It doesn't work. There's not enough shoots. If you go to where he's having a line and you start forging them, I think it was taking your. If you need something, I think there's still open doors. Because the way it's designed, so you're not just doing. Have you ever seen a horse after about 5 weeks in the field? The toe is just shredded and just broke over with.
Yeah.
Oh, yeah, it's pretty much related. Well, it's what they're doing is they're taking
The hell all they did.
actually, people look back at black skin bugs. Recall, so they've been doing that for years. Where we're taking and we're knocking the inner room out. So we're actually getting a foot inside the shoe with no sole. Taking leading everything, all that kind of stuff. It just in that there again, I think like everything, that presentation of shiny new, how many directions shoe. But you then watch it. Guys put on everything.
Okay.
You're not getting your house. Everybody likes to put a fancy. And you could take your every direction. And make it on direction. Keep sealing the inside out. Take it around the grinder, take all the leading edges away. So, what they're trying to say is,
No.
perfect. How are you today?
How are you? That part is.
Stocking shoes and everything else. I actually was after raining.
Yeah.
Like how you brought up, make sure you don't keep that. Almost last week.
It's amazing. How,
Yeah.
That is my only.
Yeah, it's like.
When you base it off what I just said. My problem was it just.
Yeah, that was very sad.
I can't get. So what happens when, like, this is not a water. Going forward, when you finally no longer have everything going this way. As the fields go forward. Well, they can make their case that that unsupported rocker is okay. As long as everything's going this. But then in a matter of milliseconds, all of a sudden, that rocker is too far forward now, that noise, and now it's gonna be. Oh, yes, so I kind of. You can block those hills. I haven't found one person water should do. They come down. Oh. And then, they put a giant belly. Make sure. But it's kind of same, so.
No, I haven't paid anything.
Yeah, there are. You know, that's where I don't agree. I guess I understand it if you think you can keep a bear alive for the duration of lactation. Take a pregnant bear and get her to bowling to save an investment. But like if you're chewing sounds. Because there's no pathology change. Pathology is so.
Yeah, yeah.
Why don't we shoot? Yeah, it's one of those.
I think they're fantastic. How like today's.
The bigger they get, the harder they are.
Okay, okay.
So, I don't.
Well, my words, one disease. But he's. So my question is.
Yes, me too. Pretty sick.
Starting out. Oh.
Where do you?
Yeah, the little interlocking ones, they're anti-fatigue is what they call them.
Years ago.
Yeah.
Maybe that's. They do treat for the little.
Then you try. The foam is not going to be.
And repeat.
Oh, I saw we're talking about here.
But they are nice.
If I really. It's not a lot of time. Yeah.
So there's a few that say. I usually try to see. That interesting.
Very few will hear whatever. Family.
All right, we'll get going again. Is this on now? Yeah.
Yeah, and we drove the boat.
So we're about 20 after, and I'll try to get you guys out of here at noon, and I don't have a watch, so when we're getting, like, when I'm about 5 minutes to noon, somebody, you can tell me again, you would give me the middle finger. If I see you give me the middle finger, I know we're like at the end of my talk. Just real quick on the navicular, heart bars are effective for that. And so if you're hoof testing a lot of these horses, this is where you'll get your reaction, is not the very back of the frog, but midway up the frog, those horses will react to the hoof testers. And then if you draw a line up from there, it makes sense. You know, you ask a lot of farriers to look at the outside of a hoof wall and point to the navicular bone, and they'll point way back, like back here towards the back, and then way down low. It's actually right at the level of the coronary band, about 2/3 of the way forward in the foot. So the heart bar makes sense then, because we have a bigger frog plate that covers the area that those horses are reacting to. So, and then there's the pour-in pads, so Equipack, the dental impression material underneath the pads, all those would be effective. And like I said, whatever your farrier is used to using, just let them do it. If there's not getting results, or we have to make changes, then you can always visit that down the road. This is something that can happen. It's pretty unusual that they fracture the navicular bone. I can't figure out how they do it, but I've only worked on 3 in 10 years at a big referral center. So I think it's not something that you're likely to see, but it can occur, and prognosis is not good for those. It's a sesamoid and a scutum under a lot of tension, and so they usually don't heal well. If we're going to promote healing in that fractured navicular bone, we wedge those horses way up into what we call patent bar shoe, and I have some pictures of it in here later. And then as that's starting to heal and they start to improve, we start to lower them down. And the reason to go really high is to get the tension of the deep flexor tendon off of that fracture. And then bipartides are, that's when we have a bone that's, I'm sure you're familiar with that from vet school, but that navicular bone is formed in 2 separate pieces, and they have documented tripartites as well. So these are typically, we diagnose these usually when they're weanlings, foals, and prognosis is really bad for those. They're not going to be athletic animals. Laceration of the deep digital flexor tendon. Have you guys ever dealt with this yet? I mean, it's when you look at the makeup of the leg and how close these tendons are to the hide, and then the fact that we have most of them in barbed wire fences and wire deals like that. So it's a fairly common thing. If you only have the deep digital flexor tendon involved, then those are usually a laceration that would be below the fetlock, because you get above there, and then you also have your superficial flexor tendon running. And then usually if they've done that, they've transected both of those. So that's called a fishtail bar shoe. Like I said, we're not very creative. It looks like a fish, so we call it a fishtail bar shoe. What that is enough caudal extension that it plants the toe on the ground.
So those horses with a completely transected deep digital flexor tendon will present with the toe rolling up. Just even a minimal amount of load, you'll see the toe come right off the ground because the deep is the only thing attaching on that portion of the coffin bone, keeping it in that position. So that shoe then, the tendons don't heal well, especially that tendon. Our surgeons never attempt to suture those or to repair them. And so the fishtail bar shoe is just to keep the foot in the proper position until you scar down and start to develop some scar tissue that will stabilize the region. And then once that occurs, the horse will be okay like that. There's going to be an asymmetry to gait, even if there's not a lameness. So your walk and trot, you'll really notice it. This particular horse, this was a hind leg on a horse that was a really sweet mare, and her job was really just packing kids around. And she would lope around the arena. You could barely tell anything was wrong with her. You could, like I said, though, you could see it at that walk because it's no longer going to flex backwards when they go through the swing phase. So if you had one that was partially severed, then if we're going to try to keep it intact, what we have left, then I would use this patent bar shoe. And some farriers will put a patent bar shoe on one that's even completely severed. I just never understood why we would build scar tissue and have to slowly lower it to the position we want it anyway, if we're not going to preserve the function of the deep. So I just put them where they need to be and go from there. But if it's halfway severed, if there's some of it that's still functional, then this patent bar would be what we use. And with both of these shoes, notice how wide this is. So these are going to be rest shoes. And especially with the patent bar, then the goal with that is to unload the deep and then put them in a position to rest. But the reason that bar is so wide, and as a rule, we make it as wide as the widest part of the foot. So you can have very narrow heels, but then that comes out really wide. That's for medial lateral stability. So what we have to worry about with any of these horses with an acute injury like this is they could potentially be non-weight bearing and then develop compensatory or load-bearing laminitis on their good foot. So a big part of trying to get them to use this foot, make them comfortable enough and confident enough to load it, is to preserve the other foot. And I forgot to talk about that with laminitis, but that compensatory laminitis is something we have to worry about with a lot of our catastrophic injuries. So a lot of times then these horses, I've only got an opportunity to work on that other foot when they're on the OR table. And so I'll get my heart bar or a pour-in pad on the load-bearing foot. But most of the time, if I've got them halfway comfortable in the patent bar or I've got them in a good position, they'll load it, and they only need to load it long enough to pick that other foot up just for a second. As long as they're doing that, they're moving blood away and they have the function of the foot. So sometimes I've had veterinarians or coworkers worry that they're still not using the heel when they walk, or they're still predominantly loading it, the other foot. Well, it's okay. As long as they're still giving that foot a break periodically, we'll be okay on the compensatory foot. With horses with street nail injuries or other things to the bottom of the foot, infected bursas that are the deep flexor tendon is associated with, a lot of times I'll actually just get down on the ground and use my ruler to see where they're holding their heel. That's the spot that's comfortable. And so then I make my patent bar to that level where they want to be and start there. These are both hand forged ones, and I've gotten away from using those because the only way I can lower them is to remove the shoe, put it in the forge it down, and nail it back on. It's a hard shoe to forge to fit a foot. So you take a lot of pride in being able to forge one, but then you're having to pull it off 2 weeks later and forge it back down, and the leg's all wrapped up, and then the vets have to sedate it, and it's a big thing. And so what I've done now is I kind of trailer some heels out the back, and I make aluminum blocks that bolt to it. And then I don't even have to be there. The owner, if the 2 weeks goes by, you can tell the owner, pull the bolts out, remove one plate, put the others back on, and we don't have to sedate the horse, block things, do anything else. So it's real simple. So that's how I do most of the patent bars now is with those and then they're not finding me to do it. We talked about the coffin bone fractures, the different makeup of the coffin bone. Anything that's involving the joint that's articular, prognosis is not good for those. But most commonly, I think we see those type 6 and the full fractures. Our surgeons never repair them. Reason being the makeup of the coffin bone is fragile. And so a lot of times the hardware actually causes more damage than just trying to get them healed. So this, remember then I said these will heal by a fibrous union. So if you go back and look and re-x-ray these bones 2-3 years down the road, you're still going to have a lucent line where the fracture was. It'll be filled with that fibrous union. So this, if I had an articular fracture, this is what I would use. This is a rim shoe, and this is glued on. So we put the foot down into the shoe, and then I fill the top of that, and the holes are there to accept the glue to give us some more surface area. And then I would fill the bottom of it with Equipack, because what we want to do is remove any displacement of the bone itself. So that's why that goes all the way around to the heel. So it's allowing no movement in that distal portion of the hoof wall. And then the next thing that I need to remove is that sole drop down in the center. So that's where we would put a dental impression material in the bottom to kind of keep the sole from descending as they load. They're remarkably more comfortable as soon as you get these shoes on. And if you can get them on before there's a displacement of that joint surface, then your prognosis would probably be better. A lot of the horses, even with articular fractures, have returned to trail riding and things like that. So it's not the end of the world. This is something that I show the vet students to do. You know, we're Laney's here and Bronk, and there's other vet students that I've had that are from North and South Dakota, where there's very few farriers for them to work with. And so casting would help those feet. So the cast will fatigue, and I think there's actually some research going on now to measure the difference. So there will be some movement within the cast, but it's better than nothing. So if you don't have a farrier that you can work with on a coffin bone fracture, most of you probably have cast material in your trucks. If you're casting a foot, the rules to follow are stay away from the coronary band. Any pressure on there will result in sores or potential scars. And then some horses that have very underrun heels are going to force you to cast up over the heel bulbs. So with those, you want to use adequate cast padding in the back. And then when I come around behind those, I don't pull super tight. I'll go a little looser around the heel bulbs, pull real tight through the toe. And then you want to wrap, if you're using 4-inch cast, you'll want to have 2 inches under and 2 inches on your dorsal surface. So yeah.
How long do you leave it on?
We're usually looking at 6 months on fractures before we would return to work. And it would depend too. So our articular, you'd probably want to be more conservative with than the chip fractures or things like that. But so those are pretty simple. Angular limb deformities. So this is another thing that's hard to get breeders to spend money on, but a lot of those horses that I'm spending a lot of time now trying to get to land flat and trying to shoe to complement conformation could have been corrected as youngsters if we had done proper full extensions on them before epiphyseal growth plates closed. So going from distally up, coffin bone would be closed at birth, then you're looking at roughly 3 months intervals going up, you know, so proximal interphalangeal joint, carpal metacarpal on up to there, you're about that 6 month cutoff for those. And what it's doing, so what we would do on these horses, if we had a valgus knee, we put a medial extension on. The medial extension, what's happening with your valgus knee is your epiphyseal growth plate is growing more rapidly on the medial side. It's what's causing that limb to go that way. So if we load it, it stunts the amount of growth, and then we allow that to catch up. So, and I've been doing it just long enough now that I'm getting pretty comfortable in knowing my limitations. So, and the surgeons and I work on those together, and we'll look at them and evaluate them, and I'll usually say, I don't think I can help this one at all. And then that's where they would do surgery with some sort of fixation of the epiphyseal growth plate. So Iowa State mostly uses the staple method. Some of the surgeons will go with a screw. And then if it's a real severe limb deviation, they would use 2 screws with the wire. And so they actually can put tension on that wire. And then this requires owner compliance, because if these overcorrect, then we're just dealing with the other problem in the other direction. And the other thing is, when I'm gluing, because these are direct glue on the whole bottom of the foot when I do my extensions, we're gluing to a foot that's growing very rapidly. And so I don't want those on longer than 3 or 4 weeks, because when they come back in beyond that, you'll see this big balloon or growth at the corner band where the foot is pushed out and the bottom is really contracted and trapped. And so I'd had a lot of problems with that. They make a lot of really nice full cups that you can buy. I used to make them out of aluminum and drill holes to accept the glue and to keep it on. And they were actually too good and stayed on too long. And so I had owners that as long as they stayed on, they wouldn't bring the horse back. So I've gone to using 1/4-inch Luan that they use for door skins. And I can almost guarantee they'll fall off in 3 to 4 weeks. And as soon as they fall off, the owner will bring the full back. So we actually had to kind of dumb down our process, because we were doing more damage if they stayed on too long. So you have the greatest effect at the level of the carpus with your valgus and varus fulls. It's not quite as effective below the fetlock, but you will see some results there with the extensions. So, and those are also things that you could creatively do with the cast if you were on your own without a farrier. The cool thing about cast is that once it's set, you can cut it away in certain areas, or even build to it with glue. Like if you put it on the whole foot, you could go back and then remove the cast from the bottom and the side of whichever side you don't want your extension. So there's lots of possibilities for you guys if you don't have access to a farrier. That's just a nailed one. And then a lot of times you don't even, if it's a real mild deviation, you can just put a little glue on the side of the foot and call it good. Laxity, this is something that owners oftentimes panic about. And if we have 2-3 day old foals, we just need to turn them out and let them run. And that laxity usually just resolve pretty, like within a week's time. Unfortunately, a lot of owners that have not bred a lot of babies or exposed to this before, as soon as they see the laxity, they put in a stall and restrict movement. So most oftentimes when we see this at Iowa State, we have mares that maybe have had complications birthing that are in ICU or in the stall, and then the foal is limited exercise or turnout because it's stuck with the mare. And so we have to try to hand walk them as best we can. And then if it isn't resolving and the fetlocks are right on the ground, then we would do our heel extensions to try to get them up off of the ground. Contractions are another thing that I think a lot of times will resolve with some exercise too, if they're mild. But you can see foals with contractions of the deep that are so severe that even within hours of being born, they're walking on the back of their hoof capsule. So those are beyond my ability to fix with toe extensions. Those would have to be, they would have to do cut the inferior check, the deep digital flexor tendon for those. These are just examples of toe extensions. Same thing, you could do that with the cast if you wanted to get creative. Have you guys ever dealt with canker? Hopefully none of you have to work with draft horses. You know, most farriers we try really hard to price ourselves out of the draft horse industry. But canker is nasty. It requires owner compliance, and most of the time, the reason these horses have canker so bad is because there has been no farrier out there to work on the horse for a year or two. And then it's so prolific by the time we find it. It's very invasive. So it's typically only the frog, but it will invade the sole. And I've seen it start to even go up the hoof wall towards the coronary band. So I have heard of different topical treatments. I still cut it away. So we have the foot blocked, and then I just keep cutting until I'm down to healthy tissue underneath it, and then put a hospital plate on and have to keep it clean. And then oftentimes recheck in 2 weeks and remove more of the infected tissue. We don't know a lot about canker. If you find it, you'll know what it is, because it stinks. It looks like broccoli. It feels really weird and it smells bad. Like I said, I try to stay out of the draft horses, and so is it the SMZs is your topical antibiotic. So I have heard now of vets that are not resecting the affected tissue and just putting those SMZs right directly on the bottom of the foot. And so I have yet to see any data on the results, but it might be worth a shot. Hoof wall avulsions. Sooner or later, you'll see these. These are another thing that I don't patch. What I do is try to find the healthy part of the foot that I can work with. And then if we're dealing with it in the heels, which most of the time we're dealing with avulsions in the heels, then I most of the time I can move that load over to the frog. You have to have, when you do these, you want to have a shoe where your foot needs to end up growing to. So that's the downside. Like a lot of these horses would be okay if they were just wrapped and you could get them to grow back or keratinize and grow in without the shoe on. But what happens when that's routinely loaded is I notice that it grows under distorted and under the foot. So if I put my shoe out there where the foot should be, I see that new hoof wall growth will grow to my shoe and not have a tendency to roll under. That's why I'll usually try to get these horses shod. And then, so this horse was fortunate in that coronary band was pretty well intact. We'll have a lot of them come in where the hoof is hanging from the coronary band, and the owners don't want to cut it off. They think if we push it back in, it won't reattach. It's hard to explain that to them, but yeah, once that laminus tore, we're not going to reattach it again. So we got to get that off as soon as we can so that we don't risk damaging the coronary band any further. So should be resected immediately. And then sometimes if it is involved, the surgeons will suture that area there. And then you may have that permanent indentation or kind of a weak spot on those feet, which isn't the end of the world. They can still do their job with that. And we may just end up shoeing these horses with a heart bar for the rest of their life or a bar shoe. Abscessing. So this is the one thing I really wanted to get covered before how are we doing on time?
15 minutes.
All right, we're gonna make it. So especially so the students I work with, because they see us work on a lot of these abscesses at the hospital. Usually anytime the surgeons suspect an abscess, they come and get me. And part of the reason is because my knives are sharp and I know how to use them. I use them every day. You know, most farriers do. The other thing that farriers get really good at is reading that keratin in the foot and knowing how close they are in relation to the quick. Because the goal is not to drain blood, it's to drain pus. And so you want to be very careful and methodical in avoiding getting into the quick on those horses if you can. If you cut them, it's not the end of the world. I've had it happen where I'm coming up with my knife just as they shove their foot down or something like that. So it isn't the end of the world, but once you have a bloodbath and when you get into that circumflex on the bottom of the foot, you'll see the pulse coming out. And then you have that big mess that you're trying to work through and still look for the abscess. So that's why I really try to avoid the blood. But the process that I use is I always start with a frog. And this really drove, Dr. Kirsch, it used to drive him crazy. He would come and say, I got a horse with an abscess. I'm pretty sure it's in the toe. And then I would start knifing the frog. And he'd say, it's not in the frog. I'm pretty sure it's in the toe. Well, the reason I do that is because hoof testers are not always completely accurate with abscesses. In fact, they can be very inaccurate sometimes. In 3 different times now, I've found foreign bodies in the frog. So that's why I still go to the frog first. 2 of them were nails, one of them was a piece of glass. So, and just to throw that out there too, that's another reason that you should all look at the bottom of feet before you trot horses for lameness, because rule out that they have a nail in their frog before you have the owner trot them up and down the driveway. So that's why I start with the frog. Abscesses typically don't occur underneath it, but I still want to rule out that. And then common spots to find them are on the seat of the corn. So I'll usually knife out my bars, seat of the corn, and then just slowly work my way all the way around the foot. Bruises are always suspect if you find those. Sometimes, like if you have these little black spots, that's just unexfoliated sole. Most of the time that'll go away. Occasionally it won't. You'll have this little black striation, and then you could chase that for a little ways. If it goes away, then I would quit doing that. It's always better for me to handle a foot post abscess if it's come out the coronary band. I just have a little horizontal cleft I can manage as it grows down, as opposed to digging 6 or 7 big holes in the bottom of the foot and really not finding anything. So I think if we've ruled out a fracture and anything else that's majorly catastrophic, then I would be all for, let's give this horse another 24 hours and see if this just won't present on its own, rather than keep whittling away on the feet. Another thing I look for are any deviations anywhere in the coffin bone, because like I said, those are weak spots. This one happens to be here in the toe, but you could have a lytic episode or a sequestrum where you'd have a spot similar to this over here. So if I find this, I'm going to chase those areas. And then this is just an example of what I was saying. This horse, you can see there was a referring vet that had drained an abscess twice right in this spot, kept reoccurring, kept coming back. Usually as soon as you get the pressure off, we're good, right? Occasionally, if they keep reoccurring, this is what I find is that they no longer have a viable attachment of the sole anymore. And they're very painful. And I think what happens is you're basically looking at the sensitive sole corum there that has a real thin layer of keratinization over the top of it. But that sole becomes a foreign body that's pushing into it. And it's very painful. And then when you do get in to start resecting that, it's just full of garbage. It stinks, it's black. And so I think that's why they just keep re-abscessing. So with those, like I said, if it's not attached, I'm getting rid of it. I'm gonna cut it off. That's how we get those to resolve. And they're usually much more sound once we do that. Keratomas, those are one of those not so common things. And I think there's probably a lot of horses that have them they've never presented a problem. There's no pain associated with them. Usually the first indication that we have of keratomas is these frequent abscesses right above where the keratoma is. They're more common in the distal tip, and they're mostly like cylindrical in shape, but you can have them anywhere on the foot. This one here was right on the wing of the coffin bone. And then radiographically, so let's say you want to differentiate between a crena and a keratoma, that's where I'd say x-ray your other foot. So the keratoma is very unlikely to be bilateral. It's going to be a unilateral thing. So if you're thinking it could be a crena, the other foot's going to have it. The other thing is that compared to an infection of the coffin bone, the keratomas, what's happening is the coffin bone is remodeling around the pressure of the cyst. And so it's very smooth and punched out in appearance, as opposed to if you had a sequestrum or a lytic episode, it'd be real jagged and rough around there. All of that considered, you won't know for sure it's a keratoma until you actually see the keratoma. And I have had some where it's really satisfying when you get in there and it's just a big mass and you pull it out with your forceps and you can save it and put it on the windowsill. It's fun to show the students. But sometimes you get in there and it's not a true mass as it is like a lot of disorganized keratin or lamina. So we should see like linear tubules that grow down from the coronary band. And occasionally I'll get in on those frequent abscesses. And when I get down there, there's like these linear tubules and lamina going in all different directions. And so that I remove. until we're down to something good underneath. So typically that would not be the job of the farrier. And what we would do, like in a team effort, is we're good at the hoof wall part of it. So I don't need you, unless this horse just is a jerk and won't hold still. I don't need sedation. I don't need his foot blocked, even though I got a little bit of blood. He hasn't felt anything yet. And then I can find the perimeter of that keratoma for you. And then at that point, you can sedate him. You can block his foot, put a tourniquet on it if you want. And then it's mostly associated with the hoof wall. So once we've opened it up, you can usually get in there with some forceps and start to pull and pry and just take it out. And then go in there and you can scrape the bone down to make sure you've gotten it all out. So then it's my job again to come in and figure out how I'm going to shoe this horse to keep him off that area or protect it until we go back. They say they can come back. I personally haven't had any return yet, but and it is actually keratin. So when you get those out, it feels like hoof wall. It's hard. It's a keratin mass that for some reason starts growing in between the hoof wall and your coffin bone. I'm going to finish this up and then we'll call it good. I wanted to throw this out there because this is another thing that we kind of deal with a lot radiographically, and Laney was just talking to me about this. So we do see a lot of negative palmar angles, especially on hind feet. And there is some research that indicates it's postural because these horses are moving their hind limbs either behind them or under them to relieve pain in the hocks. And then that develops secondary to their posture. But we oftentimes will see it in forelimbs. Let me keep going here. Right here. So we'll see a foot like this that has a broken back axis in the forelimb and maybe has a flat or a negative palmar angle. And those are the ones that a lot of times we get some pressure to wedge those heels up to line up that deal. And the reason that I put this together with a contracted deep flexor tendon and a club foot is because we oftentimes don't always think about our soft tissue effects through all of these different things that we might see, right? So we look at a club foot and we go, it's a contracted deep flexor tendon. And then we look at a negative palmar angle and a broken back axis and say, he needs more heel. Well, my thought is, why is that occurring? And the only thing that I can think of is that there's a laxity of the deep flexor tendon in those horses that have a negative palmar angle. I don't think that, like when you look at the size and during a dissection, I'm not sure that an extensor tendon would really ever overpower the deep flexor tendon. And so I think a lot of times these horses have changed posture, especially in the front end, and that results in that negative palmar angle. If it is actually laxity of the deep, and then I wedge it up, I've put more laxity in the deep, creating a worse palmar angle during load. And then that would explain why so many farriers have struggled with this. We think we've only put this 2-degree wedge pad on, and then all of a sudden our heels are just crumbling, they're falling apart, the horse is lame, and we're back out there to pull this package off. I think it's because we didn't take into consideration the causes of it. So it's never an ideal thing to have that. And the reason I put this in here is because most of the time we see that in the forelimbs of horses. And what we do with this is we call it a high-low syndrome. So we have a horse that doesn't have a true club foot, but he has an upright foot compared to his other foot. And then he also has an upright pastern. And if you look higher up the horse, he has 2 scapulas that are at different angles as well. We don't see this in the hind end unless there is a true contraction, because the hind end is controlled by your reciprocal apparatus and a bony attachment, right? But the forelimb, thoracic limb, you're attached by a muscular sling, your trapezius muscle. And so as those muscles develop, based on a horse's propensity to be a right or a left-handed horse, he's going to start to change the angle of his scapula. As he changes the angle of the scapula, he's going to change the angle of his pastern and his hoof wall. So we were getting into a lot of pressure with our dressage trainers. They wanted us to wedge that low foot up to match the high foot. And those are the ones I was saying we just opened a bunch of can of worms when we did that. And then as I started really looking at horses, it's amazing that you can watch a lot of things without ever being observant. And so there's two different things, right? Like we actually stand back and look at things. So these horses, if you stand back and look over their hip, that low foot will always have that overdeveloped trapezius muscle. And then that's going to be that horse's preferred direction. Horses are opposite than humans in that most forelimbs are left-handed. And I'm not sure they're completely opposite when we think about the fact that the hind feet actually do more of the job. And if they're a left-handed forelimb, they would be a right-handed hind limb because they're always working on that diagonal. And this is something that I go through with the vet students because horses will typically break down on their preferred limbs. They use them. So if you were to watch this horse graze, he's going to always put his low foot forward and his high foot behind him. If he picks the lead up on his own going across the pasture, it'll always be the low foot. And there is research that substantiated this that came out of Holland, the Netherlands. And so then on the hind end, if you pull their tail out of the way, you're going to see that they're more developed through the inside there, through the gracilis muscle. And that's going to be on the diagonal of that forelimb. So I think it's important to note these sort of things, right? So like if I know he's primarily a right or left-footed horse, that might be where we focus some of our attention on a lameness evaluation. I think it's also good to counsel owners on these sort of things, right? So if you're looking for a head horse, you want a left-handed horse, right? He's already made to go that way. You don't have to teach him to do it. So if I was looking for a head horse and he had a really big trapezius muscle on the right-hand side, and I know I'm going to have some work to get that horse to set and turn, because it's not going to be natural to him. But yeah, well, interesting facts. What they did in the Netherlands, they were looking at warm bloods because it's very prevalent in warm bloods. Those horses grow really rapidly, really legged, real leggy foals with short necks and big heads, and they really spread out to get down to the grass. So it was Mieke van Hielsen that conducted the research, and she took half of this breeding farm foals at the weaning period and put them in a dry lot and kept their hay up high. And she drastically reduced the amount of that high-low syndrome between the group that was turned out onto pasture that was allowed to. And then they did a follow-up where they just put them all out. And the ones that had been fed up high immediately developed it as soon as they were out on the pasture again. How are we doing on time? You guys want to quit? 3 minutes. 2 or 3 minutes? Street nail procedures are something we do pretty commonly at Iowa State. So a lot of times they're associated with a puncture wound, which is why they're called a street nail. The scary thing with any of those puncture wounds is what's affected, right? And so a lot of times you'll get calls that there is a nail in the foot, and the first thing that you'll want to advise the owner of is don't pull it out, because you can radiographically, then you can assess, is the bursa involved? Is the navicular bone involved, or coffin bone? You can see it. Those holes close up pretty quickly, and it's hard to evaluate them once they've pulled the nail out. So if they're worried about it, they can cut it off with bolt cutters or something like that to keep it from being pushed in any further. But it's nice if they'll leave it. So in the event that it's involved the bursa and there's an infection in the bursa, the surgeons will create a window here through the frog, through the deep digital flexor tendon, and then go in and lavage and clean out the navicular bursa. And then my job then is following up with the patent bar shoe and hospital plate. So we manage those. We've got a big hole in the deep flexor tendon now that has to heal. So we would unload that and then slowly bring it back down to proper position. That's just a hospital plate. These are just a couple little things. This was a cool case that kind of demonstrated how effective these medial or lateral extensions could be in different situations. So this was a broodmare that was obviously very neglected. That's a collateral ligament rupture. And she was non-weight bearing on that foot. As soon as she went to load it, it would cave in underneath her. With that extension on, she was sound enough without any sedation for me to trim her other foot. So it was very effective in getting that limb back underneath her. The blood right there, that's mine. So, you know, some people worry about that, but it's owners are the worst when they come back and see blood on the floor. Did you cut my horse? And you say, no, it was my finger. And they go, oh, good. They're worried about their horse, but so yeah, those are effective. This is just another kind of a cool case where you can have fractures of the extensive process. This horse came in from a referring vet that had had a draining abscess at the coronary band for about 2 months that was not resolving. When they brought it to me, I pared the part of the sole out directly underneath it and couldn't find any association with it, which I should have been able to find. And then when we looked at radiographs, we could see this there, which we weren't sure what that was. So I just dremeled the window for them. And this is a piece of bone from another animal. So we don't know how that got, it probably went in at the coronary band and lodged between the hoof wall and the coffin bone itself. But that's not coffin bone. That's cortical bone with the periosteum on it. So yeah, it's amazing what horses can do to themselves with very little effort most of the time. This would be a rupture of the strabismoidian ligament. Remember I was saying we have an attachment here, and that strabismoidian ligament attaches there. This horse came in with the toe rolling up. And so right away I was thinking, okay, this is a deep flexor tendon rupture. And ultrasound indicated that we had a viable deep digital flexor tendon. And then radiographs showed us this subluxation then of the proximal interphalangeal joint. And so this was a unique case where this horse was donated. She was due to foal. The goal was to keep her sound enough to get the foal on the ground and possibly raise it before euthanasia. So what I did was treat the symptoms that I saw. Her toe was rolling up, her frog was really compressed, and her heel bulbs were raw from walking like that. So I put a shoe on her that with the heart bar insert to protect the frog and their heel bulbs, caudal extension to keep her toe on the ground. And it actually did have some effect on the joint, which surprised me. But the main goal was to increase comfort. And this is her walking. Because I think it's pretty remarkable how, and this was another one too, where when I got that shoe on, I could address her other foot. So she's not sound, but when you look at the x-rays, it's surprising to see her go that good. She was non-weight bearing on it when she came in. So those shoes they're pretty effective when you get the leverage and the mechanics in the right areas. So this, I won't bore you with this. I somehow got involved with trimming giraffes and working on giraffes at the Blank Park Zoo and doing the zebras there. This one though, you just have to see that horse, but it's just amazing what you see come into referral centers. And that horse, it missed everything it had to miss. And they took her into surgery and removed the pipe. And were you there then, Lainey, when she came in? Yeah, so she had a trach tube due to some swelling. She was in the hospital for 2 or 3 days and then went home and full. So yeah. We joked that worst case scenario, you could just attach her split rings to the pipe and steer her that way. Yeah. Is there any questions? I know we went long and I appreciate everybody's attention. Good crowd today.
Lunch is served in the Washington.
To me, right, most of everybody in here is veterinarian,
We're all used to dealing with emergencies and disasters, but our lives overlap between our personal lives, our families, our businesses, and our community. So when I talk about these things, we're gonna see a little bit of overlap. I get really excited about disaster management because, we all face disasters, right? So I got here yesterday with a nightmare. So I thought, oh, I can either take a 6:30 flight out of Memphis, which means I get up at 3 a.m. Or I can take a 5 o'clock, which means I can feed my cows, play with my dog, and get here. Of course, I got here at like 2:30 a.m. As it is, right? Y'all have storms yesterday? Rain. Yeah, we had 20, I think we had storms go through Memphis. So I'm driving down all the power lines. But anyways, I've been here for less than 12 hours, and I've probably had maybe 3 people already ask me, hey, you ever been to South Dakota? Right? So I thought I'd tell you about South Dakota. I've been here a couple times. The last time I teach FEMA and Homeland Security classes too, and we were here. But my mom decided she wanted to go see the mountains. From Ohio, mom's never seen the mountains. She actually, I have to find out later, she had this idea that the mountains are, I'm gonna drive up to the mountains today, then I'm gonna come back down. But the other thing about my mom, she doesn't fly. So we embarked on this journey last year, actually it's for about May. We embarked on this journey, and y'all see that? It was a little bit of a long journey. And I said, Mom, it's gonna be great. I'm gonna pick you up right here where she lives. And I said, but here's the worst thing. I said, South Dakota. South Dakota, we're gonna stop at my nieces and Wisconsin. It's really boring, right? Farmland. I think it's really cool. I can point out every barn and everything. But I said, Mom, you're probably not gonna enjoy this, so we're gonna find some things to do. I mean, I was ready to go to Corn Palace. I've never been to Corn Palace. Well, so we stop, right, Havasu Falls, and we get this. You know, ma'am, you might not want to get the car right now. So the most boring part of the trip. 10 minutes later, you guys know where that's at, don't you? So I've been doing disaster management since 2001. My first experience in a tornado, derecho, and hence the title of my talk. Crashed the rental car. So my mom's funny. She likes to gamble too. She kept seeing all these casino signs. She's like, casinos and gas stations. So when she's panicked, right? My mom, just let's go gamble for a little while. And this thing hit like that, right? You know what I'm talking about? And the first thing she does is I get her crawled out from under the table. She said, they took my $5. Anyways, it's all about how you look at things. We were fortunate. Our rental car was trashed. I'm gonna give kudos to the Sioux Falls Enterprise desk because within 20 minutes I was in a new ride. Well, by the time and we were pretty fortunate that day. But if those of you who hadn't seen that, I didn't know what a derecho was. I had to look it up. This is what we're standing there looking at from the gas station on my birthday. All right. Cool. That's a real time thing. That's pretty amazing, wasn't it? Sky turned green. Yeah. Isn't that amazing? How do you, and my mom says, Carl, how do you stay so calm? I'm like, yeah. What happens in a disaster? What's your response in a disaster? I'll tell you 3 things I want you to remember, and I'll bring them up again. Denial, liberation, decision. That's a response. First, whoa, did that really happen? Right? I don't know how many people stood and walked around that gas station for about 5 minutes. Go, whoa, that really happened. Did you see that? Right? It happens. Whether it's a disease outbreak, whether it's lightning striking 20 head of cattle around a hay ring, whether it's an active shooter in school. Denial, the quicker you get out of denial into deliberation, what do I need to do? To make a decision, the quicker we recover from any kind of disaster. So, there's my story. And if you've seen the pictures, you guys have lived this, right? Do you think there are cows out there? Do you think poultry houses were affected? Do you think there are, I know there were because we passed them on our way out of town, right? Do you think we had effects? How many of you had clients affected? Anybody? All right. What'd you see when your clients were affected? grain bins, flying debris. Yeah, absolutely. So is that a disaster? Absolutely. It's just a different kind of disaster. So when we talk about disasters, we made it, by the way. We didn't get to Corn Palace, but we made it. We did make it. We all have different kinds of disasters we face, right? So we'll talk about all hazards, but this is a map of, this is NOAA. They keep track of billion-dollar disasters, and already this year there have been $13 billion disasters in the United States. Talk about the big freeze that we had in January, February. We've had flooding, we've had tornadoes, but we all face different hazards wherever we're at, right? So if you were to come up here and say, hey, we got a hurricane coming in South Dakota, I'm probably like, no, not something I need to worry about. But tornadoes, yeah, floodings, yeah, dust storms, yeah, derechos, yeah. We've got to think about all hazards. Russ Daly is talking. There we go. Right? All hazards. Because we can't plan for every single thing that may or may not happen. We talk about things in terms of all hazards. And, you know, we hear the term man-made, technological, man-made, natural, technological, but either it happens naturally, like a disease, or it could be intentional, like a disease. And we'll talk a little bit about ag security and ag terrorism and bioterrorism, or it could be something like a cyber attack, or something like a bomb, or a nuclear issue. We've got to be prepared for all hazards. Right? There's 3 phases that I'll kind of talk about over the next rest of the hour or so in disaster management. I always say it's preparedness, response, and recovery. Okay, and this is the technical, and I will throw some. All right, let me give you a little on my background, just as a disclaimer. I do not work for the federal government. I do contract with FEMA, Homeland Security, USDA. I do have cows. I'm an extension veterinarian. I'm not a pathologist when we get to the diseases, so don't ask me pathology things. And a lot of times I try to think outside the textbook. So when we talk about the preparedness cycle, if you want to read some things like FAD prep, some of the things, you ever hear FAD prep? One of these preparedness for practitioners, they're nice long booklets, right? But oftentimes in a disaster, do we have time to read the booklet? No. And that's where this whole denial, deliberation, decision. The better job we do before an event occurs, i.e. preparedness, the better job we're going to respond. The other thing I'll say is when does a disaster response start? As soon as an event happens, right? You gotta do or recovery. Recovery starts as soon as something happens. We've got to think of recovery. All right. Why do we need veterinarians? Why are you sitting in here in a disaster talk? Somebody tell me. Any reason? Why do we need veterinarians, young man? Why do we need veterinarians in a disaster?
They have.
You agree? Here said he likes that 3 answers, right? They have a wealth of knowledge and experience in what? What are you veterinarians? Zoonosis. Okay, I like it. Zoonosis. What else? You know, we know more about zoonosis than you. What else? What are you veterinarians? What did you do when they had that ratio company?
Dugout. And then.
Tell me about it. Welcome to South Dakota.
Yeah, I mean, triage.
Triage. Yeah. And you said we know how to recover, right? So that's going to be skills. Right? This is what my students usually tell me, first thing veterinary care. And I can tell you now, most of the disasters that I've been to, hurricanes, tornadoes, disease outbreaks, the veterinary care, the actual, I'm gonna lay my hands on you, I'm gonna sew you up, I'm gonna give you fluid, it's just a real small part of it. Right? Animal handling, right? Public health skills, leadership. Are we leaders? You think we're leaders? You guys are just like sleeping already, that Mexican food. I'm gonna walk up this aisle, I can tell, right? Leadership, are we leaders? Yeah. Are we followers? We can be, right? We can be. We need to know when. We're organized. Like you said, we know how to sort things out and organize things in our head, keep that cool head, and our communication skills. Because, right, we all went to vet school because we don't like to deal with people. We know better, right? We're dealing with people every single day because we have to have communication skills. But the one thing I do want to say, though, is while this little leader is important, we got to know when to follow also. And we'll look at some examples on when it is sometimes. The other thing, again, how many vet students do I have in here besides you? Oh, we got several. Okay. We build you up. You're great. Congratulations for being here. But there are people smarter than you. Okay. And that's something that's really hard for veterinarians sometimes to understand, that they're not the smartest person in the room. Is it hot in here? Y'all have this year? I was so happy to go from 100 degrees to 80 yesterday. But we also know that we have issues. And I'll put up a bunch of examples and stories just to kind of put some things out of the textbook. That's probably where my cows are right now. We see that all the time. We have cooling systems. But whenever we have problems with people, we also deal with animals. You know, about heat index, your humidity probably gets no more than 20. Okay. I think ours was like 98 yesterday and 101 degrees. So these are things that veterinarians understand. I'll show you a picture later about, does this always work? Veterinarians? What happens when you have 100 degrees and 98% humidity and you do this? Right? It makes things worse, doesn't it? Okay. So understanding that is something that veterinarians need to do. You all had Winter Storm Atlas. Is that right? That was devastating. So I don't need to talk to y'all about Goliath. So we know that weather extremes, and it's not because, and you hear them all the time, and any of these that I'm going to show you, I'm not armchair quarterbacking, but I think it's always better to learn from somebody else's experiences before you have to go through it your own. So, you know, you hear people say, you know, oh, you're used to snow. But it's different, right? People don't understand the time of the year, where our cows are going, whether or not they're being transported anywhere at the time. But there are things we need to deal with. There's all hazards. Can I get rid of that? It's just going to have to say it. So disaster management's changed a lot since 9/11. Right now, some of you probably might have been really small at 9/11. And then the Hurricane Katrina in 2005. But I can tell you the biggest, and I look around the room, probably there's some of you in here, biggest event that changed my life for disaster management as a large animal veterinarian. I was still practicing in Ohio back then. Actually, I was just leaving Ohio for Mississippi in 2001. What event happened in 2001? ESC and what else? Katrina was 2005. Close. I know it was a long time ago. You know, old things we talked about, right? 2001. 9/11. When was FMD outbreak in the UK? Forgot about that already, right? See, we tend to forget things when it doesn't happen for a while. And that's one of the problems with disaster management. But that's also one of the reasons we practice all hazards, because if we sit there and plan for FMD and it was back in 2001, we're going to say, yeah, it's not happening yet. Same thing we're seeing with things like 9/11 World Trade Center attack. Those happened so long ago that sometimes we're seeing a little bit of lax in our preparedness. So anyways, so yeah, that was my turning point. So when I was leaving Ohio State coming to Mississippi, I thought I'd go on a little adventure, and they said, hey, Carla, why don't you spend 30 days in Scotland? I'm like, okay. So 9/11, really 9/11 following the FMD outbreak really kind of changed, I think, the history of how we do emergency management in the United States. So a lot of the things that we base our FMD plans on and our emergency response plans on that we're going to talk about later this afternoon are based on some of the experiences in the UK and some of the other countries. Uh-oh. I broke it. Now I broke it. Sorry. It's frozen in time. Let's see if we can't move it. How many extension vets does it take to
I
fix
know.
this brain? So we're gonna talk about all hazards. All right.
We're gonna try this, and we're gonna try that again.
You have a online option?
Yes.
Try that. But anyway, so we're gonna talk about all hazards. Like I've got examples from every little where that I've stolen, just to give us a little bit of a tidbit, because a lot of you are gonna sit there and think, I never thought of that. Okay, I never thought about putting water on top of a tin roof in a coliseum that's gonna burn dogs. It's 90% humidity. We've actually learned that during Hurricane Katrina. And but we also see that when we deal with cattle. It's not moving. No. Sorry.
I'll mess with it. You keep talking.
Okay. So we have some of the things that we think about with preparedness, right? So I've already said we have disaster preparedness, we have disaster preparedness, disaster response, and disaster recovery. And how we matriculate through those things is more important. So I'm going to talk about a few things. How many people, we have any federal or state employees here? Retired. Okay. That's no, nothing from you. Okay. So I'm going to give you kind of the layman's extension, your cattle idea of what happens when a disaster happens. So there's a couple different layers, right? How many of you heard of Homeland Security presidential directives, right? So some of the things that changed since 9/11. So one of the first things came out since 9/11 is they came out with number one, the Agency of Homeland Security, right? Know that the Department of Homeland Security did not exist before 9/11. So Department of Homeland Security came out. Did you also know, young lady, that veterinarians were part of the original Homeland Security team? Okay, so they had a team of veterinarians called VMATs and NVERS, and they actually got folded into Homeland Security. So all the people who are members of the VMATs got a little plaque that says, thank you for being a founding member of Homeland Security. So veterinarians have been in there since day one and trying to fight the fight to protect food and agriculture. Okay, so we're going to respond to anything. One of the things that we have to realize is Homeland Security was created to organize an event. Okay, so they came out with something, and like I said, this is kind of the boring part of disaster response, but I'll try not to make it too bad. They came out with something called Homeland Security Presidential Directives, or now they're called PPD or Presidential Directives. Basically, they said, hey, we just had this really bad thing happen in the United States, and we didn't do so well, right? We didn't communicate so well, we didn't organize so well, it was organized chaos. So we're going to come up with this structure that says anytime there's a disaster event in the United States, if you want federal money, you're going to follow something called the National Incident Management System, NIMS, right? Under NIMS, it says, hey, if you're going to organize an event, this NIMS, you're going to follow a structure called the Incident Command Structure. How many of you heard of that? Many of you guys haven't come in. If you haven't yet, it's coming into school, right? We're going to follow ICS. So we're going to have this National Incident Management System that kind of helps to guide us. Not an operations plan, it's just like a framework to help us organize and respond to an event. And then we're all going to follow something called ICS, the Incident Command Structure. Okay. They also have things called HSPDs, Homeland Security Presidential Directives, are now PPDs. And in those, there's one called HSPD 11. HSPD 5 says, hey, we're all going to follow this structure, this NIM structure, this ICS structure. HSPD, I think it's 9, says we're going to account for animals in agriculture. Cool, we're written in there. So we are the food supply, and we are a critical infrastructure for food and ag. So this is all written in thanks to, you hate to say, what came after 9/11 in the Department of Homeland Security. We'll try it again. All right, so that's kind of where we fit in from the federal standpoint. See, I got it right. Out of HSPD 9 also came things like the National Veterinary Stockpile, which is similar to the human veterinary stockpile and so forth. But basically that's what all this says. This is NIMS. They had a rewrite in 2017 and they named a couple of things differently, but basically it says in the event of a national problem, we're all going to follow the same type of system and the guidance system there. Okay, any questions? ICS in a nutshell. We're good, they're not sleeping. But HSPD 9 has been there. So, you know, you've heard a lot, like when COVID, I hate to say COVID happened a couple of years ago, people came out and said, hey, this is a great thing. The U.S. has declared veterinarian structure and food net. No, it's been there since then. Okay. Under the incident command system, okay, the incident command system is actually very handy. The incident command system helps give us guidance and a little bit of structure so we all know where to go and who to go to when we have an event happen. So let me ask, where's my private practitioner? Private practitioner, right? Okay. So do you have someone in your office that pays for things? Do you have someone in your office that makes the schedule? Tells you how many doctors you need this week? How many interns, how many summer interns you can pay? Where we're gonna put them, right? Who does the work? You do the work, you go out on your farm calls, right? So that's kind of the incident. How do you communicate? Cell phone, radio?
Not a cell phone, not a message,
Cell phone, messages,
not a Gmail phone number.
Gmail account. So the incident command system is actually kind of cool because it can apply, you know, we hear it always used for things like disasters, but it can apply to any event. The incident command system is used for the Super Bowl. Cool, huh? Incident command system, if you look at the incident commands, the ICS structure, the COVID response in the state of Mississippi, it's got like 300 people on it. Because it's putting people into the boxes for their job so that we can better communicate and know who to go to when we need something. That makes sense? So this is your basic incident command structure. You have a incident commander for the event, which may be your practice owner or maybe the practice manager. Public information officer, the only person who can post on Facebook, right? Safety officer, liaisons, planning, logistics, finance, or ops. I call it IFLOPS. There's an intelligence. If there's a foreign animal disease or a potential criminal event, there's something called investigative unit. But for day-to-day operations or common events, we use finance, logistics, operations, and planning. Now, see all of you right there. I didn't ask you to do anything you don't normally do. It's just organizing it, and this is how it works. Okay, so in a national scale disaster, we follow the incident command system. So that's just a term to be familiar with if by chance we're going to be working at any level above our community level into a disaster response. So I just kind of want to make sure everyone's aware of kind of the terminology here. This is the command post and the incident commander for Hurricane Katrina. It's a firefighter out of Florida. It's a firefighter or fire chief out of Florida, but he worked in emergency management, had nothing to do with animals, but his job was to make sure that each section stayed in their lane and did their job. This was the command post. Planning section tells us how many people we need. Logistics, where do we get it? Finance, who pays for it? Operations, who does it? Okay. So I wanted to give you this background because most of the examples I'm going to use over the next couple hours all in some way use the incident command system. And that's why it's important that veterinarians understand a little bit of the incident command system. And even if for veterinary students or for recent graduates, I believe the ICS is in part of your USDA accreditation modules, that you understand a little bit about the ICS. Because if that derecho hit again, right, and then you needed a large response and you wanted to volunteer your services as a veterinarian, they're going to put you in one of these little areas and say, okay, I need you to work on horses. You're going to be under the operations section for animal evacuation. And you're going to say, huh? Then you're going to say, but wait, I need this. And you're going to say, you know what? If I can find, you need the logistics. So kind of gives everybody, instead of mass chaos, it gives a little structure to chaos. So it's important to understand. Like I said, they use this for the Super Bowl. They use it for all sorts of events. This is a cool one. The North Valley Animal Disaster Group, with all those California wildfires, this group has been going on for about 20 years. Actually, 1990s, they formed a veterinary disaster group because a bunch of people wouldn't evacuate from the wildfires because of their pets. Sound familiar? You probably don't get that as much here, but we do a lot at home where we have hurricanes, but they wouldn't evacuate the wildfires because of their pets. So this group was formed. And they've got an excellent example of an incident command system used for a veterinary group. And what it has: animal evacuation, animal communication, how do we talk, animal shelter, animal housing, veterinary services, feed specialists, sanitation. who walks the dogs, who feeds the dogs, who calls the owner, who gives them their shots. All things we normally do, but putting them in a structure so they can be understood. This is our ICS for the state of Mississippi natural disasters. We also have one for animal diseases. Okay, so whatever agency you might end up assisting with, Gulf Coast oil spill. Anybody help with that? They took volunteers from all across the country to work for the EPA. The same thing, you went in and sent me. So there's a lot of different agencies where you can help. EPA, USDA, Homeland Security, FEMA, military, NGOs, non-governmental organizations. Those are going to be your agencies like ASPCA, IFAW, International Foundation for Animal Welfare, I think it is. But there's a lot of NGOs up there that are stepping up to take care of pets. Federal response team. Anybody part of the federal response team? Nobody? Okay. These are pretty much really, I think something that else that's happened since Hurricane Katrina is that a lot of our counties and communities have stepped up to take care of themselves, which is great, which means we don't need all these federal people coming in and taking care of it. Because we always want to manage something at the lowest local level possible. So if we can manage an event in our city, in our county, our community, and not have to bring in the state, nothing personal, and not have to bring in the feds, we're going to be much better in recovery, right? Because those people all go home. Some of the federal agencies that have gone on, when we first started with foot and mouth, it was radio, USDA radio, then it became NAHERC, National Health Emergency Response Corps. That's disbanded now because they've written in emergency response responsibilities, most of the federal employees in something like a USDA, APHIS, and so forth. Does anybody know any different? If they're coming back in my state workers, you know, it's gone. It's pretty much handled by USDA. Veterinary medical assistance teams, VMATs were big for a while, and those were the original members in Homeland Security. Those are currently now inactive. And then the NVERTs, the National Veterinary Response Team, they kind of come and go. They're still present. Trying to think who I know what might be an NVERT here. They're not accepting new members, but they do things like the mounted police unit at the Capitol when they have the RNC or the DNC conventions, or they actually went and helped bring in cruise ships and vaccinate passengers during COVID. So it's a team of veterinarians. I've got some really good friends on there that actually do that stuff at the NVERT. I don't know. There's a lot of legal issues right now whether or not they're going to pull up another national. Anything else I missed? Your time, guys. Ask any questions if you have any. I'd appreciate it. All right. But I always get asked about the national scale, but I can say over the last 10 years, they're just really not wanting to bring national people in when the local level can handle issues. All right, multi-state partnerships. I won't talk a whole lot about that except to say they exist. These are where states are getting together and having regional partnerships, basically so that they can help each other out instead of having to come in the federal government or they can work with the federal government, but say I'd rather work with Arkansas, Tennessee than have to call the USDA. That makes sense? So I don't know, are you part of a regional partnership? I don't think you are. There's a Midwest partnership, which is Colorado. You might be part of Midwest right now. Do you know if you were? Are you part of Midwest?
Yes.
Okay, thanks. Yeah, and these are mostly going to be your government agencies with your government agencies with your universities, your state, your extension, and all those types of resources that come together. SADRA, you know, the one we're in, it's Texas, Mississippi, Alabama, Louisiana. So if we have a hurricane come in, we all kind of band together. You all have Midwest floodings and things, right? Floodings or blizzards, you can all come together. Oregon, Washington, and California, I think, are now creating one. And then there's a Northeast one. Mississippi, we have a state response. I didn't see where South Dakota had a state. Used to tell us about it, Dr. Daly.
Oh, for several years we had a lot of veterinarians were in this room were working with the veterinary response.
Really?
I think the state people will tell you much more about.
What happened? They're hard to maintain, aren't they? And actually, we were just talking with Dr. Elkos, our assistant state veterinarian, about disbanding our response team, because again, this goes back to think about 9/11 or Katrina or foot and mouth in the UK. Out of sight, out of mind, we're dealing with HPAI. Okay, so yes, a lot of the states, ours is not real active because the funding's going elsewhere. But it just depends. New Mexico's really active in their practitioners. So I would encourage you all, if it gets back activated, to join that. It is a good resource if you don't need it. That's my question right there. There's my question. All right. So community preparedness, getting involved with all those others, has to include education and training, right? I don't know if you do this is your emergency preparedness training for the year, right? I'll try to make it worthwhile. Come on. But we try to do everything every year. I know it's challenging because things change. And we also like our veterinarians to have continuity of business. Have you heard of this term? Continuity of business. And again, I'll give some examples and things. So real world example. Continuity of business. The term itself means making sure, just for example, I'll give you an example. So I might even have some slide. There was a tornado in Smithville, Mississippi about 5 years ago. And actually I'll show pictures from the one that just happened the last 2 months ago. Entire town of Smithville was wiped out, right? And from all across the country, we get people calling in to help. I mean, veterinarians, hey, I'm on a response team. Federal government, industry, every pharmaceutical company under the sun, all come up. And we've got this veterinary mobile unit, as you know, we've got a little veterinary team, and I call up the local veterinarian that I know, and I said, hey, you need anything? Can I do anything for you? We got a mobile unit on standby. And he just started hollering and screaming because evidently one of our spay neuter clinics were seen at the Humane Society. He said, Carl, I just lost 60% of my clients. Why would I want another veterinarian to come in here and do their work? Okay. And that kind of hits that whole continuity of business thing, because you know what? You guys are veterinarians that make a living, right? We do our best. We give away services when we can. We try to support our communities. But at the end of the day, you've got kids to feed. You've got bills to pay, right? So continuity of business is bringing a community together to get back all these services and infrastructure that we need to get that community going. We also know that what happens now is, you know, if you get too many handouts and too many free things and too many volunteers, what I tell you, what happens in a month? They all go home and you're not prepared, right? So the goal of a community is resilience. Right? What's resilience mean? What's resilience mean? What's resiliency? Surely somebody knows that. Resiliency. What is it? Bounce back. Absolutely, right? And that's continuity of business. We've got to get our businesses up and running again. In some of the technical senses with some of the emergency preparedness docs out of USDA, continuity of business, they say, is to keep us up and running in the event of a foreign animal disease. Is that important? Yeah. It's just like I tell my extension clients, if people stop eating beef, I'm out of a job. I like my job. So we need to keep those going. All right, I've already mentioned there's FAD prep manuals. There's a lot of USDA resources at that level up here, right, that help us work with our clients in terms of what about a response to disease and continuity of business. There's things called the SMSs. If you stick around, if you hang with me till 4 o'clock, we're going to talk about biosecurity plans and how to actually bring these federal documents that are this big and live up here down to our farmers. How to actually help our farmers and ranchers use them on a daily basis. Secure milk supply, secure beef supply, secure egg supply. There's a secure pork supply that all help our clients plan for continuity of business. And again, they're geared towards foreign animal diseases, but it can also be used for a tornado, for a derecho, for flooding, for any type of event, a mass explosion. They can all be used for just basically disaster planning documents to help that support that continuity of business. Right? Have the proper training. Get in the system. Know what ICS is. Okay. Know what ICS is before before something happens. This is a HPAI outbreak where we actually brought in University Medical Center, we brought in the ambulances, we brought in the FBI, we brought everybody in for potential outbreak. But make those, you've all heard that before. It's better to swap business cards before an event occurs than trying to figure out who everybody is when chaos is happening. Okay, so get to know everybody. Small towns, go talk to your sheriff. You guys know what an LEPC is? How many of you live in a small rural town? 90% of you? LEPC, Local Emergency Planning Committee. That's every county, you're in counties here, right? County, each county has a little board that they were created out of the old Superfund money where toxic waste was built out of toxic waste money, Superfund money, EPA money. But each county should have an LEPC that keeps track of where the hazards are in your community and usually meets on a monthly or quarterly basis to try to talk about certain hazards. For example, they know how many people go up I-29. That's a major one, right? They know how many trucks go up I-29. They know how many hazardous waste sites there are. They know how many railroad cars go through. They know how many have toxic substances in. They know all this stuff. They know where the hospitals are. They know where the fertilizer plants are. Do they know where the veterinarians are? And do you think it's important that they do? So you might think about in your community asking them, hey, where's the LEPC? It's usually out of your emergency management agency. And hey, I'm a veterinarian. Can I help? Can I help you look at the toxins? Can I help you look at the railroad traffic? Can I help work with the co-op? On our LEPC, we have the small animal veterinarian, a large animal veterinarian, an extension agent, the hospital director, the school director. Railroad goes right down the middle of our town next to the co-op. But it's things like that that help us, because do you think the firefighters know what chemicals you keep in your veterinary clinic? What about that? Okay, so kind of get with them. Be familiar with, I've already said this, as I kind of get ahead of things. And we'll talk more specific about planning as veterinary clinics for the next one. I do want to mention the Pets Act. Have I heard that? Pets Act. Okay, and I'm bold, does not apply to livestock. So this is a very big misconception when it comes to veterinarians and emergency management. So out of Hurricane Katrina and the Stafford Act, and the Stafford Act is that act that deals with disaster reimbursements and things like that. It came out of that whole no pets left alone type thing. And again, this does not apply to livestock. But the Pets Act means if your community gets any federal funding, i.e. FEMA money, Homeland Security money, any kind of federal funding, you have to follow along with the Pets Act. Okay, it basically says that your state or community has to account for the welfare of pets during a disaster, i.e. evacuation for a tornado or evacuation for flooding, evacuation for a hurricane or anything like that. I like to put this up here because there's a lot of misinformation when it says, oh, that new Pets Act takes care of means you have to take care of my family, which means you have to house my horses, which means you have to let my dogs go in your hotel. Not at all. Okay, there's a lot of misinformation. Basically, the Pets Act says that your community has to take care of pets in an evacuation or disaster and cover their basic needs of shelter, food, and water. Okay. It does not, it only includes service animals, I think. It authorizes FEMA to provide funding, and this funding can go back to your community for rescue care, shelter, and essential needs. So if you're in a small community and you're working with your local emergency managers, this is something that is reimbursable back to you if you're in the plan. Okay. And we've worked a lot with veterinarians in our rural communities that say, hey, if you're the veterinarian for the local shelter, you get that shelter written into the emergency plan. So if you have an evacuation for a flooding or anything like that, you can get paid back for your services, and the shelter can get paid back for your services. Okay. But I just wanted to mention that because, again, a lot of times in a rural practice or mixed animal practice, we're dealing with the shelters and things like that. And this is just a resource to help get in the system. Any questions on that? All right. So, Russ, I think one of the things you said you wanted me to talk about is what happens when something occurs. You don't remember that kind of, what happens when an event occurs? So let's say an event occurs, right? All events happen locally. an event occurs, and people always ask, when does the state come in? When does the federal government come in, and how does all this happen? So first of all, if it's a local event, okay, if the local resources, your local emergency management gets overwhelmed, whether it's a tornado, flooding, a disease, okay, so some could be a mass outbreak, COVID, it's the word. So when your local resources get overwhelmed, they go up into either regional or state. Okay. When the state gets overwhelmed, they have to ask for help from the federal government. So why I put this on here is it's a stepwise process. So you always get people that want to help. You'll hear something in disaster management that says, hey, don't self-deploy. Okay, that often means to a local area. So one of the things when we had a Smithville tornado we just had another one, is we ask people not to deploy, self-deploy. You want the local, right, handle it to the smallest level. You want the local people to handle it. Because what happens if, you want to volunteer, go help with a tornado? You gotta show up, bring your family, bring your trailer, right? Because your brother-in-law is a carpenter. Bring your family, bring your brother-in-law, and ask the SDVMA to provide donations of dog food and medical supplies. We're gonna put all in this trailer, and we're gonna go to Smithville, Mississippi, and help them out. And you know what's gonna happen? You're gonna get there, and you're gonna be hungry, and you're gonna be tired. We don't have anywhere for you to eat. We don't have anywhere for you to sleep. We have dog food to eat, right? So that's why we always say with disasters, to let things be handled at the most local level before we keep asking for help. That makes sense, because again, they're gonna go home. So, and we hear often a lot of times too, where's FEMA? Where's FEMA? Why aren't they helping us? You know what? Maybe the state didn't ask FEMA to come in. Okay, so this is going to be similar. We're going to talk about foreign animal disease and things. I got a little bit of that, right? We've got a disease outbreak here in South Dakota, right? Is USDA coming? Only if they're asked. Only if they're invited and only if they're asked, right? So there's kind of a hierarchy that is followed there. We appreciate it. Right? This is how the federal response goes from that kind of technical standpoint. Right, the local level, we have local ICS. So all of our counties and communities will have an ICS. National Incident Management System kicks in, right? Those Homeland Security presidential directives. State asks for help, and it kicks in this local, the NIMS, National Preparedness Guide to the presidential directive. It all kind of has a process. But most are managed locally, right? That's how we like it. I'm gonna keep pounding that in here because you guys are the responders. You all are the first responders. This is where I used to take my cows. This is where I took my students. This is where I hung out on Monday afternoons. Okay. All disasters happen locally and they have different scales. Okay. Here's another one. This was 21 people died in this one. Right. Again, you guys get your share of weather. I kind of feel like I'm preaching to the choir, especially after flying in last night. But y'all get your share of weather. Think about the community and how you can better prepare. This one hopped. Funny thing, I live like right here. I think it hopped over Carla's house. So I got lucky. This is the town of Rolling Fork, Mississippi. Gone. Gone. You guys have seen this, right? Gone. Okay. This is the town of, I believe this is Amory, Mississippi, 5 miles from the other place. Gone. Gone. Okay. See this all over? You guys see this. We saw this with your duration. We see this all over. Okay, think about how we can best help our clients. Right? I'm going to look at this and I'm going to think, what about ventilation? We got to evacuate these cattle. What are we going to put them in for ventilation, for protection from the snow here? Things like that. This is my friend. His cattle trailer was still there. He lost his son and his grandbaby. Okay. Disasters happen locally. And the better job we are in preparing and having that cool head, denial, deliberation, decision. The better we prepare and know what's gonna happen, the quicker we're gonna get ourselves out of situations, or the quicker we can help our neighbors. Local Humane Society. Right? Build your team, be part of the team. And I know sometimes it's hard to work with other agencies, other veterinarians, but have a plan. In the next hour, we're gonna talk a little bit more specifics on what you as a large animal veterinarian or mixed animal veterinarian can do and what your role is gonna be. But have a plan, get to know these people. Be prepared to do whatever job's needed. Okay, like I said, in my experience, you know, in 25 years of disaster management, veterinary care, actually sewing something up, giving it fluid, is just a small part of what needs to be done. This is that's a vet clinic after Katrina. The water line was to here. All animals in the clinic died. Right? Sometimes we have to do evacuations, capture, euthanasia. Think about reunification. We'll go into more detail on that. Reunification, not only of you and your family, and you know what? You guys are most important. Okay. Sorry, you are more important than your clients. We need you. Reunification, continuity of business, and continuity of operations. We need you back up and running. This is a Katrina. Ohio checked it. If you guys have seen those, Ohio checked it. 0 people, dead animals. Understanding what that means, if you're a practice owner and you come to your clinic and see that, or if you're going to help your neighbor and say, hey, what does that mean? That's kind of important. That can be very helpful. Right? Recovery can be long-term. I told you I'd throw some really odd ones in here. Fukushima, Japan, right? They shut down the reactors because of a big flooding and a tsunami. And in turn, it caused a chain of events and a meltdown, right? Do you think that woman's gonna let go of that dog? No, she's not gonna let go of that dog. You think they tried to get her to let go of that dog? Yeah. Okay. So sometimes we deal with long-term things. Right now, they're dealing with Fukushima and they want people to go back to the town. But the problem is they don't know that it's safe for livestock. They don't know if we can drink the milk from cows that graze that land. They're having all sorts of problems with wild animals, wild boars, deer, and hogs. So. Disease affect humans, animals, the environment. It's all about One Health. I had to throw that word in there because Dr. Daly's here. I think about One Health and how everything's interrelated. Protecting and saving human lives is always first. I don't negotiate with that. Hopefully you don't either. But the other thing to think about, your emergency managers, your federal government, your military are all going to go off the premise that protecting human lives is always first. All of your clients believe that. Right? I know you probably all have clients who are going to put that dog in front of the life of their kids, right? Or their other kids. But sometimes we need a veterinarian here calming this woman down and saying, lady, you're going to get burned if you go back in that house. Because law enforcement, military, they all have a job to do, right? Is protect lives. So sometimes that veterinarian's got to be in there to help smooth the situation. All right. So the first hour, I wanted to give you all an idea of what happens in disaster management, right? Disaster preparedness, disaster response, disaster recovery. I wanted to give you all a look at what happens up here at the federal level. Lots of stuff happens at the federal level, right? We've got all this ICS stuff, this FEMA stuff, this USDA stuff. It's all really important. But at the same time, we also need to look at what we do day to day. So there's state resources we can look at, and then we're going to look at local resources and explore your role as a veterinarian a little bit more in the next hour. Think about community preparedness. Think about your skills. One of the most important things is realizing you're not the smartest one in the room and you need help. That's my favorite. Okay, questions? No questions on the hierarchy of response or anything like that? Okay. Do you guys want a break or keep going? Let's keep going. You said a bigger break in between, right? Is everybody awake? All right, more pictures, more questions or something. I know ICS after lunch is brutal, so I try to minimize ICS a little bit. All right, we're gonna talk a little bit about more specifics. Uh-oh, Russ, I quit sharing.
I can.
Fix it, Russ. I'm like a kid learning a new word, derecho. I had to call my mom. Mom, you know what that's called? Derecho. It's kind of fun. You are welcome to come down and experience a hurricane anytime you want. Mm-mm. But you know, they're very similar. You know, if you think about the ICS, the hierarchy, the structure, they're actually very similar. Except usually hurricanes, we got about 5 days to prepare, but nobody does, but we can. And they tend to last a little bit longer. So I do have a lot of hurricane examples. Apologize about that in advance. Oh man, you did it again, Russ. You locked me out. So we talked about disaster preparedness, response, and recovery. We didn't go too much into that. But now we're going to talk about the levels of disaster preparedness, right? The main levels are going to be personal preparedness, family preparedness, business preparedness, and community preparedness. Okay, and like I said, I've got a lot more examples. We're just going to kind of show some things that happen and some ideas that we can come up with that hopefully they'll go home and say, no, I wish I had a plan. Okay. That top one right there, that's up, there you go.
Okay.
That should be familiar to you right there. That was the day I think we went through. All right, here you go. F3 tornado hits your community while you're out making farm calls. Your clinic and many of your clients are within the affected zone. Possible? All right. This is Dr. Mark Holland's place. He was an hour from the coast of Mississippi. Hurricane Katrina wiped out his clinic. Total loss. I'll show you more pictures of his later. Police barricades are up and the National Guard is being brought in. Why does that matter? Have you seen that happen before? Has that happened yet? Why does that matter? Doc, do you know your local law enforcement, if you gotta drive to work, they gonna let you in?
Oh, not really.
They're not gonna let you in? Know your local law enforcement resources. There's an emergency, you're gonna go down the road and they're gonna say, National Guard. National Guard's out there, they're like, no, sorry, you're not going anywhere.
Not unless you have. We had a tornado in Westman Springs, and I'm the local vet there, and I had to get the local law enforcement.
Yeah, exactly, right? It's National Guard, they're not gonna let you in. I got a panic call from a student that last tornado, and Dr. Houston, they won't let me in. Like, what are you talking about? Because that tornado hit my family. I said, well, but I listened. You're not emergency management. You're not part of the system. You know what you are? I do. Okay. So yeah, so if you don't know who they are, you might want to make those connections. Okay, so even in your community, like an LEPC, having some kind of identification that says this person's allowed into the area where they can be, where they can help, can be a big help. Okay, police barricades are up and National Guard is brought in. You have several animals boarding at your clinic and you're unable to reach your staff. What's that called for? Communication plan, right? Remember I said something having a reunification plan? Do you have a reunification plan for your family, for your coworkers, for your staff? Local sheriff's office is sending rescued animals to your clinic. Overwhelming. And you know what day it is?
Sunday.
There you go. It's always Sunday, isn't it? It's always Sunday before a Memorial Day holiday or a Labor Day holiday. Nobody's around. Okay. What are our concerns here? Again, we'll just look at some examples and do some brainstorming. I always bring something new when I show pictures. What are some concerns here? Injured animals, absolutely. What else?
Safety of responders.
Safety of responders, absolutely. Nails, things like that. You know, there's some real neat, I thank you for bringing that up. Safety of responders. There's several cases written up by the CDC. There's my public health vet right there. where first responders, firefighters, police have come down with crypto, Giardia, and salmonella, right? In one case, I think they were using water from a pond or a lagoon to try to help put out a fire. Like, we know better than that, right? We know better than that, don't we? They're gonna go eat their lunch and have their coffee and not wash their hands. Anyway, thank you for that. Safety of responders, not only from physical agents, but biological agents. Okay? Those cows gonna get milk. Yeah. So veterinarians, you're doing more than just sewing things up, right? You're troubleshooting. You're using that public health knowledge. You're using that leadership. You're using your communication skills. This is all right. So this is an aerial view of Prestige Farm. They got hit. And I got quite a few. Anybody work on hogs here? What's our concerns here? Not what you think. All right, veterinarians. We don't have any swine specialists here, and Dr. Dusty walked out the room. Thank goodness we can talk about him. Am I going to help them? Am I going to help them? No. You know what they're going to say? They're going to go, no thanks. Stay away. How about if this is a poultry operation? Same thing, right? Most of these bigger operations have people who can do things. Okay. So oftentimes, instead of us responding, it's going to be a phone call where a neighbor saying, hey, you okay? You okay? They're going to say, no, yeah, company sent you, we have this. The other thing I will caution you that we found out after, so every hurricane that comes, we will have volunteers show up from PETA, ASPCA, all sorts of welfare groups who just show up at farms and want to help. Okay, just to say. So this was kind of interesting. They said actually the fact that we were still in farrowing crates saved a lot of the animals because the roof came down and the animals were in the crate, so it saved them. They brought in their contract people who hold them all up. They lost very few animals. But the one thing that we did have to deal with from a state standpoint, from a state veterinary services standpoint, they wanted to know, how's the levy? Public health. The state from that standpoint, yeah, those hog people, leave them alone, they're fine, they got this covered. But we want to know if the water supply is good. That's all we wanted to know. So we had to send veterinarians out for inspection on water supply. Some of you all may have probably seen this presented at ABC a couple of years ago where 2 tornadoes came together in Pilger, Nebraska, hit a feed yard. And some of the issues, the veterinarian that spoke about that at ABC gave a really interesting perspective on this because the majority of the animals were either railed or condemned. I think he said, or sent to slaughter because they couldn't harvest them. So they sent them to slaughter, they sent them early, they lost money on that. 40 of those that had to go to slaughter early were condemned at slaughter. About 20 were actually missing, they never found them. But a lot of impalements. If you think about how a feed yard can be set up, the metal, a lot of impalements on animals, a lot of injuries. So that was another interesting one there. The moral of the story, one of his points was when you're working with feed yards or working with large operations, is that the yard was insured, but the cattle were not. Okay. So, and that was a really good talk over lunch and financial planning, but that may be something also to consider. All right, questions on tornadoes? Your county's received over 31 inches of rain in the past 5 days. That's pretty common up here, isn't it? Pretty. I can remember last time I was here. The clients are frantically trying to move animals on higher ground, and sometimes this means out of state. What issues are we going to deal with? Anybody? Interstate movement and CVIs, yeah. Right, and I would imagine if, your state veterinarians, right, are probably going to get together and say, hey, we're going to waive the requirements for this or that when something happens, right? Do they send something out to you all? No? You do? You did? Right? Yeah. I know in the southern states, when there's a hurricane, it's See, but that's one of those agreements that's already in place. You know, our guys, Dr. Frazier, Dr. Watson, they're just always like, yeah, okay, let's send the email. They've already got it. They've already got it written. They're planned for it. Hey, yeah, we're just gonna have to reduce the requirements for CBIs from these states for a while. You know, not require call-ins or whatever other type of interstate movement. So that's already in place. So what other things we worry about?
Is some not gonna be catch up? They don't have the whole paper when they move them, but you want a record of it.
You want a record of movement? Absolutely. You know how many animals get lost and stolen during evacuation? You have no idea. Probably not, yeah. Yeah, a lot of people offer their services to help movement. Oh yeah, we'll come hire horses. And a lot of people are desperate. So yeah, keeping track of movements, documentation. What? Dead animal disposal is an issue. Absolutely. Where are we gonna put them? Yep, dead animal disposal. What else? Man, it's flooding. Where are you gonna put these animals? Where are you gonna feed them? Okay, we'll move them out, but we're not gonna think about what happens when we move them. Containment. Take them. Where are we gonna feed them? Are they gonna be commingled with somebody else? Did that cause an issue? I'm the only CBD free. I'm not going with your cow. Right? Are there issues? Are you gonna take them to the stock? Are you gonna take your prize cow calf, top seed stock clients, animals and evacuate them into the stockyards? Commingle with the Mississippi soccer cattle? Do what?
You don't want to.
Yeah, sometimes you have to, right? So planning, right? This had to be Texas. All the cool pictures come out of Texas. I grab these, this guy's going, no, wait a minute. All right, what's under that water? That's obviously a road. Right? Wires, fences, gates. One of the most common things that we see when we have the storm surges down south, because we have a lot of cattle on levees, we do temporary fencing, getting tangled in fences. Very common. Right. Some of the most common injuries that we see. This is a little calf that treaded. I mean, imagine sticking your legs in salt water for about 3 days straight. Okay, leg's gonna slough off. Skull, that's kind of hard to see in this picture. You've got water scald up through here, all up through here. The skin's sloughing off, the skull's sloughing off. A lot of times the horn of the hoof sloughs off. You're dealing with mastitis. One of the bigger things that we see with cattle, with both dairy and beef cattle, is mastitis long-term, chronic mastitis. Oil will dry up, things like that. Everybody wants to help. Okay, everybody wants to help. Knowing the health of those animals and the disposition of those animals, and like you said, where are they going and who's got them, right? So, plug for National Guard. This picture, I like this one. Why do I like this? There's actually 2 reasons I like this picture.
Person with a fence post.
Yeah, I like it. They're holding that hole, aren't they? Okay, there's 3 things I like about this picture. What else do I like about this picture? Is she prepared? Better prepared, yeah. Better prepared. How many of you go on a down horse call and wear a helmet? You don't have to reach your hand. Okay. They got their PFDs on. Got their helmets on. She's a fence post covering that hole. The other thing I like is those look like Gilby cap. Right? We're prepared. We are prepared to help. All right. Let's see if this works. Actually, kind of got to watch this one to the end. I like it. They're prepared. trucks are lined up. The only bad thing I would say about this, they probably waited a little too long. Yeah. See, they've got their panels set up. They got the crew there. Obviously, the cattle know how to load. But this happens several times a year down on the coast where we're pulling them out. You've got your law enforcement there to clear the road. Okay, so contraflow is a big deal. And I don't know if you would have to contraflow with I-29 here in Iowa, probably not much. But if you're anywhere south of I-20, whether it's Texas, Louisiana, Mississippi, Alabama, if there's a hurricane coming, the contraflow, they're not gonna let you in. You can only go out. And that's something to plan for, especially if it's 100 degrees and you're trying to haul livestock or get out of there. So I show this to kind of remind ourselves to make sure our trailers are in good working order. Our lights are working. We have teams together. We know what, we have a plan, because you may get that call about that overturned trailer and need to know what you have to bring to help. But also to think about things like contraflow, having fuel supplies, and not waiting until the last minute. Let's see. I've already mentioned this was Clemson, where they'll actually release CBIs. All right, you'll keep seeing me say this. All right, I like this other one. Sometimes we got to get out of the way. All right, Mick Colvin, founder of Certified Angus Beef. Anybody know Mick? They got ranches all over. You know Mick. I took one of his classes, and the one thing that always stuck is surround yourself by people smarter than you. And that's how we get things done. Right? Oregon wildfires. Can you see what? Keep going. Oregon wildfires. What's going on in these pictures? Again, I'm not armchair quarterbacking, but I'm trying to show where some veterinarians can help. What's going on? First time I ever tried to round up a sheep, I had a black eye for my vet school interview because they'll jump right over you, won't they? So rounding up sheep. So if you think about, so this is Oregon, Washington, California, like I said, are starting to get some animal response teams. But some things going on here. Animal handling skills. Whoa. Animal handling skills. Do you think, we talk about volunteers. So volunteers are going to show up. Right? Volunteers are going to show up. And you can do one of two things. You can send them away. They're not going to go away. You get a tornado in your community, it's big, or flooding. You can send the volunteers away, but they're not going to go away. They're going to go about 5 miles down the road and show up somewhere else. Or you can work with them and put them to work. Okay. Maybe we can teach them how to use a hog panel. Maybe we can teach them how to, what about a flight zone? Maybe we can teach them how to herd up sheep. I don't know about this, and that could be a pet, but did you know cows won't walk through grass? I'm kind of poking fun because I think about the mentality of some of our, and I don't know the story behind this, but we get a lot of time, I'm just going to get a bucket and they're going to follow me. Or I'm going to get a handful of grass and they're going to follow me. Or I'm just going to put the panel across this lane right here and they're going to not be able to get through there. Okay.
Surprising, it's not trying to solve it, but why speed?
Right. I'm going to get a selfie with this thing coming at me, right? Well, then, you know, I've got so many volunteer stories I can tell you about that. Yeah, so if you work with volunteers, like I said, you can try to send them away, just like whether it's ASPCA has been such a big help to us in our state. We had HSUS come in and help us on some things. So their volunteers are going to come, and you got to work with them and give them something to do. But yeah, I don't know, my cows will come with a bucket, but that's a wildfire. A lot of issues with wildfires. A lot of people show up, but are you as a veterinarian prepared to help? Right? And I kind of like to go back to, again, being a people person, dealing with humans and being able to communicate, because we're calm and we're cool-headed and we can deal with people of all different types of opinions and thoughts, right? Yes. All right. So to veterinary oath. Again, think all hazards as we're going through these. Right? Protecting and saving lives is always going to be first. Protecting animal property is always gonna be second. And that may mean that you've got to pull off the neighbor from trying to save, his cat. Trying to save something. You guys have to be the cool head about it. Okay, I'm gonna show you an example if we have time on, about that. Know where you fit in the system and be prepared to do whatever job is needed. Okay, it could be logistics. They could need, your community may need someone to run the human pharmacy for COVID, right? Anybody here work with COVID as a veterinarian? State workers, federal people? I don't know if Russ did either. You have lots of roles as a practitioner on things that you can do, right? Our brains are geared to help animals, right? We're geared to jump in, help animals. We face emergencies and disasters every day. But these are just kind of a list of things that we're going to go over with some examples on how you can help in a disaster. All right, someone's already told me triage. Right, I think you mentioned triage. Reduce morbidity and mortality. Isn't that what we're trying to do? Right? Humans first, but we want to make sure that animals make it out alive. And again, food animals are very important. It's people's livelihoods, but we're probably also likely going to have to deal with pets. Make sure we have the proper equipment. Where's our helmets? All right, helmets. Who in here has a storm shelter? Oh, come on, you're in South Dakota. No storm shelters? Helmets? No helmets? All right. A football helmet? From high school? Did you get tornadoes here?
Nobody can help.
Yes, it will help you. Come on. Well, I just ordered my storm shelter yesterday. We get these programs. I just ordered my storm shelter, but probably every closet in Mississippi, you've got helmets. So having the proper equipment as a veterinarian, are you going to be working alone? Probably not. You're going to have people help you. Are you going to be liable for what those people are helping you doing? Probably so. So having helmets would be very helpful in a situation. All your firefighters are going to have helmets. We actually, veterinary students, we actually had an electric company donate a bunch of helmets to us when we do our large animal rescue classes. You have some awesome large animal training in North through the BERT program. I'll talk about having the proper equipment so people don't get hurt. Okay. You guys know where to find that. Recovery, live, dead, identification, and documentation. Right. So one of the things when we come across an emergency, reducing morbidity, mortality, is we need to have ID, some type of animal ID, some type of documentation, so that nobody claims, hey, you stole my prized thoroughbred, and you said, no, it's in a hole because it drowned. Okay. Documentation. Triage is prioritizing. We all know how to do that. And that's a big challenge when you're talking about a disaster where other people are involved, because sometimes other people just want to save everything they can. Okay. So sometimes we have to make those difficult decisions to triage and possibly perform euthanasia. You're all large animal vets. You ever get your boot stuck in muck and you can't get it out? Right? We've all been there. Right? How would you like to be that horse? And then trying to pull you out of that mud. Right? Think about it. It's not much different, right? So what do you do to get that boot stuck out of the mud? You move it around. You take your foot out and pull on it, right? You get some air around it so it'll come out. If you're a horse or an animal and they're just trying to suck that out, think about the pressure it puts on your limbs, on your skin, on your muscles. It's the same thing. Pump some air in there so it'll come out. So it's things like that that we can help. Those fire trucks have air compressors on them? Yeah. You think the firefighters would have thought of that? No. Okay. Work with our communities to come up with solutions. Perform animal decontamination. All right. Again, I've done this enough in communities where we think we can save the animal. We think the animals are worth saving. Our firefighters, our first responders, our military, our law enforcement, they're going, we don't care what you do, we'll want people out of here. Okay? So we've got to work together to make sure that we can come up with a good solution. And I'm not saying they don't care, but their priorities are human lives. So sometimes we've got to step in. How long do you think that horse is gonna stand there? Is he gonna stand there? Probably not, right? So if you think about a decon line, getting a decon line for an animal that you're gonna either have to walk through or a herd of animals. I mean, we've had to put 2 trucks together in a lane with water coming through them and running cattle through a lane before just to get them washed off, kind of an emergency decon. But think about things like that. They're not gonna walk there. He's probably not gonna stand there, but that's a really, really well-trained horse. Okay. Sometimes as veterinarians, and this could be, again, I'm thinking all hazards, even if it's a disease outbreak, maybe a potential foreign animal disease, a potential anthrax outbreak, any type, we might have to establish hot, warm, and cold zones. We know how to do that because y'all are veterinarians. We know about agents. I had on my slide the last hour, CBRN, you know what a CBRN is, right? Chemical, biological, radiological, nuclear, and explosive. Okay, those are hazards that we need to protect against. As veterinarians, we tend to tune into those biological agents, but we always have to remember there's other things, radiological, chemical, so forth. Knowing how to, especially with decon, knowing how to read placards. You read placards on the trucks that go by. You see that little number on that placard? Do you know how to find out what that is? Okay. But now if that truck spills, there's a bunch of animals involved, you're going to want to know what that little number means, right? There's something called ERG, Emergency Response Guidebook. It's published every year. You can get it online, you can get it on your phone, it's a little app. I like the yellow copies because I'm a paper girl. It's called ERG, Emergency Response Guide. It's published every year, and it tells you all the chemicals and all the hazards along with the number. Okay. That's something else you can do. So if you're working with any type of chemical, like the placards on the truck, you got a chemical, it's going to have a number on it. It's going to have a little triangle, whether it's corrosive, whether it's flammable, and it's going to have a number. If you're working with, let's see, we work with a bunch of police dogs, and they kept hitting on an air conditioner at a hotel one day. And kept hitting on this air conditioner at the National Governor's Conference. We couldn't figure it out why, right? So they're like, well, we're gonna call off the Governor's Conference because the dog's hitting on it. Pulled out the ERG guide, and there's a little number at the back of the chemical, and evidently there's some chemical in the coolant, these modern air conditioners that hit off the dog, hit off a explosive. But knowing where to find that kind of information can help you as a veterinarian if you have to treat or prevent some type of injury during this disaster. ERG. Important for things like this. I know it's a dog, not a cow. But this is important because this is a historical event. This was the first time the Washington State deployed their Reserve Corps, their Veterinary Reserve Corps. And I think they had said too, oh, we've been training for 10 years. No one's ever called us. Well, they got called. But think about the toxic chemicals that you may be exposed to. Okay. Prevention of further harm. Okay, one of the funniest, and I don't have a video of this. What happens when cows get loose on the interstate? We've all seen the videos, haven't we? What happens when cows get loose on the interstate? I heard giggles. What happens? Who goes after them? Everybody, right? Everybody stops and takes pictures and their phones, right? There's a perfect video if I'd have thought I've done it, right? What do the police do? Like, I work with the law enforcement all the time. What do the police do? Call the cowboys after they chase them. We're going to chase them for a little bit. And there's a perfect video out there. If you look in Jackson, Mississippi, 2020 or something. All right, one, do you chase them? Do you contain them? Do you stop traffic? All right, that's why I have a plan. Everybody knows what flight zone is? Everybody knows what a flight zone is? It is the perfect, it's a herd of cattle that just rolled over off the interstate. Or probably 10 cattle. And then there's a police car with a siren going. It is the perfect flight zone. The car's going. He's at the point of the shoulder of the group. Groups truck along. All of a sudden, they decide they're going to get in front of them. what happens when you get in front of them when you're trying to move out? They stop, they turn around and go the other way. It was just, it is perfect flight zone training, right? Can you guys help with that? Call the Cowboys, right? But being prepared and practicing something or having training ahead of time might be a little helpful. Prevention of further harm. So that's something that we need to think about. Capture, containment, decontamination, right? We all want to chase the cows and put it on TV. This was an emu. Yeah, we all had to chase them. Once we catch them, what do we do with them? Where do we catch them? Provide support. Excuse me, food and water. Do we want to give them food? If it's a horse, want to give them grain? Probably not want to give them grain, right? If it's cattle, we may not need to give them grain. And that's another thing with volunteers, is working with volunteers. If you get a massive tornado that overwhelms your community, I promise you will not be the only one providing animal care. You're going to need help. Right? So if you think about providing food and water, the other thing, what about water? What is so important about water? I know you guys don't have salt water here, right? About salt toxicity. Okay. Animals that are lost, penned up without water, are subject to salt toxicity. This was, I think this was a Dr. Martha Littlefield picture. This was after Hurricane Katrina, all the cattle on the levees. We have a lot of people will graze the levees. It's a good source of grass. It's usually free. They'll graze the levees, but during flooding, they'll get caught on the levees and you can't get them off the levees. First thing they learned, they have water out there. National Guard drops this water. Where's that water trough go? Bloop, right over the side of the levee. So they first learned that they had to secure those. Okay. And then what? Who's the first one to get water? Boss girl right there. Who's the one that's going to go down with salt toxicity? That first one right there. Right. So we learned a lot there, or we learned that a lot of volunteers like, hey, we got to give them all the food and water they can have. They've been stranded, they've been evacuated, and we also have to make sure that we prepare them physiologically. Preserve the human-animal bond. It's not just for pets, can also apply to livestock. You know, there's a lot of research out there on evacuation, failure to evacuate people without the pets. I mean, that's why they made that Pets Act to begin with, is people failed to evacuate without their pets. How many farmers and ranchers do you think will fail to evacuate a flooding or a hurricane because of their livestock? Most of them. I'm not going anywhere, right? So same thing. There is a human-animal bond there that we need to consider. But the other thing I wanted to mention in a disaster, sometimes we have to, this kind of goes along with triage. We have to think that we can't fix everything, especially things that have probably been happening before the disaster occurred. And I can't tell you how many requests we get every time there's a tornado. We have a disaster fund. Every time there's a tornado or an event, we get so many requests for fencing. My fencing got destroyed. My fencing's torn up. Probably not fencing. Or, I'm sorry, but that didn't happen overnight. I put this on here to remind her about the humidity and the water and the humidity. And then theft. If you have a large scale event, if you're working with your state, you have a large scale event, even if your clinic takes in dogs or animals for the shelter and are working with the shelter, think about security and safety, because unfortunately people steal things. People steal dogs, fighting dogs. I can't tell you how many, we had 50 of those come in fighting dogs. We had armed guards around the clock. So think about your safety and security if you ever have to work in a large scale event. Sometimes we have to perform euthanasia. We've already mentioned, what do we do with the carcasses, right? Where do we put them? Y'all probably bury here. We've got our highest point in the state, 700 feet. So we have a little bit more of an issue in burial, but we can do things like composting, burial, and so forth, depending on whether we're dealing with a disease, a chemical hazard, a biological hazard, or whatnot. But veterinarians, you're important about that. You know about euthanasia. Okay. We've already talked about public health. Let's see, communicable diseases, right? If you think about any disaster, you know, we like to think in our little animal agriculture world, but there's also things like public health, and usually our public health infrastructure is affected as well. This is actually this is Pakistani floods. They had a lot of cholera and dengue because this was it. This is what people lived on. This was their homes. It was common around the country, and I believe right now they're still having some flood events this year. But if you're going to respond, and I don't have this anywhere, if you're ever going to help with responding, making sure you've got your tetanus shots, please. Hurricane Maria 2017, at least 67 cases of leptospirosis. There's no documentation of animal leptospirosis, but you know what happened as well. So when we talk about preparing our clients, we want to make sure that our animals and livestock have all of their vaccinations and so forth. So this is Hurricane Charlie, Wildlife Park. All their wild animals were out. Can you catch them and bring them back? Right. You may have to deal with those kind of situations. Deal with things like rabies status, distemper status. How do you know which ones were in a wildlife park and which ones are wild? This was the litter of puppies that was on the news all over the place in South Florida because they were so cute and they were rescued by an animal rescue group. And it turned out they all had mange. So we had to deal with some other issues, mange and ringworm, that had to deal with as well. Think about food safety and your volunteers. This Acadia Market, we were here. This is actually my first hurricane. The stockyards were destroyed, but luckily, which we have that you don't, we knew the hurricane was coming, so they were able to get everything out of there. So, but they destroyed the stockyards, had to eat, right? Couldn't go to McDonald's. And then we had to deal with this little thing, and the volunteers brought us this little pig and said, yeah, we gave them some fly control and some gentamicin. And actually they had, the rescue group had gone around and all the they had a bunch of dairy cattle and they gave them fly spray, all the dairy cattle, like, right? So they just kind of, there's no withdrawal on that. It's a legal product. So understanding that. I mentioned donations. Again, a bigger scale. You might have to deal with donations. These were all things donated after a week, including every controlled substance that had been for the last 20 years. Everybody cleans out their medicine cabinets. Don't do it. But in a disaster, you may be asked to help with your community because people will clean out their cabinets and give donations. So again, this is a role that a veterinarian can play at a local level or a state level with a disaster. I don't know this. You remember my 3Ds? How are we best prepared? How do we get through an event? What are they? What happens first? Denial. Oh my gosh, this is not happening, right? This is not happening here. What's the next? Deliberation. What do I do? If we know what our options are ahead of time, if we know about getting trailers together, bringing together the cowboys, and making sure everybody's on vaccinations, that's going to make the last stage better, which is decision. All right, denial, deliberation, decision. Prepare your family. All right, don't go looking for your hard hat right before the tornado happens. Okay, y'all can make fun of me about this hard hat thing, but I can tell you, a lot of people with head trauma get tossed in hurricanes and tornadoes, or they get swept in the water and hit their head. I did that too. That looks funny too when I go around. I also have one of those little lights. What happens? How many have you been in a tornado? Or a tornado or a derecho? I mean, what's the first thing you do, right? I'm getting under the table. Who's going to protect my head? All right. I'm going to put my helmet on, so as soon as that thing passes, I'm going to get out and go to my neighbors and help them. Okay. I've got my light, shoes. All right. Prepare your family. How many of you have a disaster kit? I'm not a prepper, I swear. How do you have a disaster? Remember, denial, deliberation, decision. I'm gonna go help Pastor Dustin, because he needs help with veterinary volunteer. Go bring a copy of your license. Where's your license at? Banks are down, I need gas. Where's your cash? Because I'll tell you, no ATMs anymore. Nobody takes cash either. You were right. Nobody takes cash either. Right? Where's my helmet? Where are my lights? Where's the other thing? What I tell you, do not show up if I have to feed you and give you somewhere to sleep. Where's my emergency food stash so I can go help for 24 hours? Okay, how long is it gonna take me to get this together and this together and this together? And oh, I forgot something. Okay. This is my list. I have 3 little bins here. There's a checklist on the front. Got my batteries, my granola bars, a copy of my license, another helmet. A little light for my head. It's got my working gloves on there, right? It's got my face mask. I actually do have one in there, right? Because if something happens and tornado hits my house, I got a family that's raising the little grandbaby. He's 7 years old. First place I'm gonna go is go to their house and make sure they're okay. So I'm gonna want sturdy shoes, I'm gonna want a helmet, and I'm gonna want a light, because it's probably gonna be dark for us, right? And I wanna make sure that we can help, so. Right, the quicker we can go from what do I do, right? Deliberation to decision, the quicker we can overcome things. Have an evacuation plan. Have that reunification plan, because your cell phones aren't gonna work. Maybe you need to call somebody out of state because your phones will work out of state, but they're not gonna work locally. Right, have a point of contact, call me, have your family call me, say, hey, Carla, we're fine. You know? Have that communication and think how communications work, having that extra battery supply. And these are all things, again, you're first. I know this is supposed to be talking about animals, but you can't help animals if you're not prepared yourself. And we've sent people home for that very reason. Don't you dare show up if you're gonna need to be calling home every 10 minutes, worrying about your family. Okay, take care of yourself first. Know who to contact in the community if your family needs help. Okay. Business readiness. Recognize your professional limitations. How many solo practitioners? You're probably going to need a little more help, right? And you're probably not going to be the first one to volunteer when an event happens in your community, because you've got to take care of your own self and your own business, and that's okay. Right? Recognize personal limitations. Have a clinic plan. Right? AVMA has a really good resource for a clinic plan. But having a clinic plan and even, dare I say it, an ICS structure might be very helpful. You know, who makes sure all the fire extinguishers are okay? You've already got people to do it. Put it in a disaster plan so that when something happens, it's not chaotic. Have a sister clinic. I don't know if I've got that on there yet. Have a sister clinic. If something happens to your clinic, is there another practice within 5 miles, 10 miles, 20 miles that you can send your most critical patients to? Okay. For something long-term, do you have a practice clinic or a buddy system farm where, hey, my employees are going to go work for you for a week because my place is not business? You have a plan for your employees as well. That goes back to business continuity. Do you have computer backups outside of your clinic? Right, most have computer backups in the clinic. You have one off-site as well. Practice your plan. Have your business continuity plan to know who to contact. Business operations. This is, I told you, Dr. Mark Holland, large animal, mixed animal practice about an hour out of the coast. This is what happened. It actually just laid his roof right open. Just laid it right open. And according to his plan, within 2 days, this is where it was, set up and running. Because he had that plan ahead of time. Do you know how many people were trying to get those units? You know how many people were trying to get those? If he had waited, looked at all of his options and waited a day before he could do that, they'd all been out. He was able to get that in there right away, and he had a plan for that. That's pretty neat. I've already mentioned, be familiar with your local emergency planning committee, local law enforcement. I know you're getting you have a veterinary college here. Do you work with them? Where are your students at? So you're here. Where are you at? Here? Great. You have emergency management training? The man to see is sitting right there. Here's your future guys right here. Involve them. Involve them. We do plans. I don't know if I got pictures. We do anthrax exercises. We invite the FBI. We invite the health department. We invite the veterinarian. You know, the only people that wouldn't come to our anthrax exercise? Campus emergency management. What do we have to do? Like, a lot, right? Public health, it's zoonotic, it's bioterrorism. We even got the FBI there, our own campus emergency management, and it was put on by our vet students. Host a meet and greet in your clinic. I've already kind of mentioned, you know, do they, emergency first responders, know what you have in your clinic? They know. Do you guys know what ricin is? You know what castor beans are? So I get a call from the FBI one day, like, hey Carl, I just saw this news article about Mississippi State University doing all this research on castor beans. Do you know anything about it? I'm like, yeah. How come the FBI doesn't know anything about it? Right? Rice is one of those bioterrorism movements. Okay, host a meet and greet. He's like, you know where it's at? I'm like, yeah, it's right here. Do they know where your oxygen tanks are? Do they know where your chemicals are? Do they know where your ionizing radiation is or your radioactive iodine? Have a meet and greet. The other thing, if you have chemicals, let them know where your chemical storage plants are or how to get in. Okay? How to get in your clinic. Host the meet and greet. Help your clients prepare themselves, their pets, their livestock. They have a premise identification. A PIN, is that required here? A PIN is required for livestock? Not required, okay. Having a premise identification is helpful. How do you think the National Guard knew where to drop that water after Katrina? Or how do you think, I think we talked about this before after, was it the Atlas storm? Wasn't that helpful that they had a prem ID that you could drop water to the client unit and a prem ID? So encouraging animal ID. Animal ID is gonna come. It's coming. Whether we like it or not. It is coming. And that's really the only way with the foot and mouth outbreak in the UK that they really got through it, was having that required animal ID. So it's gonna come. So we need to help our clients be compliant to that, but it also it's there to protect. We'll talk at the last hour about secure supply plans and getting our clients prepared. Provide advice on things such as flying debris and down fences. What do they say? Good fences make the best neighbors. Some of the things that we can prepare them to do that people just don't think about, like putting a hard hat in your disaster kit, filling all your water troughs with water before an event happens, making sure all of our fences are in good working repair, which isn't always easy to do. Making sure that our gates are latched instead of leaving them open. Latching doors, windows, storing our chemicals properly. So if you're in a flood prone area or an area that's prone for tornadoes, like everywhere, make sure that we have our things stored properly, maybe having a bungee cord around our chemical stores or our pails and things, so that if we do have a flood, they don't go traveling down and hurting somebody. Keeping equipment in working order, and I think I've already said our trailers. So keeping our stock trailers in good working order with good floors, good lighting, and everything's working. Animals should be kept current on vaccinations. And this is kind of I know we all do this for our clients all the time, but when we're talking about disaster preparedness, if you've got to evacuate and commingle with other herds, this is really important. Some of the most common things that we've seen after evacuations are going to be reproductive, especially with hurricanes. They're either going to be mastitis or getting them bred back because of the stress. Provide permanent animal ID, I've already mentioned. Temporary ID, we use lots of things for temporary ID. And I was disappointed to hear you didn't have BQA training yesterday. So we do a lot of BQA training in our state as well. And one of the things that we don't like are those big old California brands right all across the animal, but ways to visually identify livestock. We can use paint or we can use freeze-dried branding, things like that. Keep up with fly control, mosquito control. Did I hear about this? Right. This was a bunch of cattle in Louisiana. that died from hordes of mosquitoes. I read it. Is this a joke? It's not. It's just a matter of after a storm, a bunch of cattle got caught and basically didn't have, I would imagine, didn't have really good fly control to begin with, and also had a lighter body condition score and got caught up with that. We've already talked about water. Yikes. Okay. And if you're going to evacuate, evacuate early and don't get caught in contraflow. We've already talked about our disaster kit. Anybody have a disaster kit for animals? Most of your horse owners, right? Y'all have horses. AAEP has a really nice brochure on evacuation kits for horse owners. If you want to take a look at that, and so does the SDVMA. But having a preparedness kit with basic first aid items is very helpful in a disaster, to have the bandaging things and having all that stuff ahead of time. Animal photos, proof of ownership. And again, a lot of these you can refer your clients to the SDVMA guidelines. Know where you fit in, I guess, is my bottom line. The role of a large animal veterinarian can be as much or as little as you want it to be. And so, you know, and I'm with you guys. I mean, you hear all these disaster talks, you're like, yeah, that's fine, but I'm not going to run off and go volunteer with my state. Or that's fine, but I'm not going to go run off and take care of HPAI for a month. Right? Do what you're capable of doing. If what you can give is best for your community, is staying in your practice and keeping your doors open, that's perfect. Okay? Just think about how a disaster happens and how you can fit into that community. Because I know most of us don't have the capabilities to go out and respond somewhere. Take care of the community first, and then, go out of your community if you have the capabilities to do that. Know where you fit in, and know if they're calling you out to be a vet or a consultant. There's a big difference. Are you coming out to sew up a bunch of dairy cows, or are you coming out to give them some nutritional consultation so they can get these things bred back? Okay. This is actually, again, our tornadoes. Dr. Christensen and a bunch of our vet students, what did? They went and sewed up a bunch of cows. So knowing what kind of advice to give. Think all hazards. These are some plannings we did in Montana with the Stock Growers Association on animal disease disaster preparedness. Again, maybe a different situation, but the planning and the preparedness is going to be all hazards. This is how we get organized. This is how we prepare. This is how we get to know our community, because whether it's an animal disease or whether it's a tornado, you're going to want to know the sheriff. Getting everyone together in the same room is very helpful. All right, last one. Loaded livestock trailer overturns in a busy intersection. Traffic is stopped both ways. There's onlookers everywhere. Oh man, does that happen? What are you gonna do? Oh, I don't know where that came from. Oh, sorry. I will play that again. Can that happen? And what's your role? How long is it gonna take you to get there? How long is it gonna take you to get there? How long is it gonna take you to get there? Depends on where you're at, right? As veterinarians, are we going to be the first on scene? That's why working with your communities is, again, first responders is going to be really important. This actually, this one happened. This is the road to Memphis. There's only one highway going there from where I'm at. We were actually doing a training with the fire department, and our state emergency response. And when we get a call, it's like 8:30, day one of the classes, and hey, we just have a trailer overturned. This was kind of fun. Pulled off the trailer. Evidently, she was on her cell phone, went off the road, and it rolled. The cab caught fire. And again, these horrible, horrible things. But like I said, we just happened to be having a large animal emergency rescue class that week. The whole front of the trailer where carcasses had to be euthanized. Fortunately, with our network, picked up the phone. Hey, Dr. Thompson, we need you out there right away. They're 10 miles from your clinic. Take a case of euthanasia. Again, we are all kind of part of that network. All right, so here's our emergency manager. Our emergency managers in the khaki, that's my veterinarian. This was actually the trainer, Dr. Jimenez from North Carolina, in the fire department. Who's that guy? He is really powerful because nobody could do a thing until he showed up. Who is he? Insurance adjuster. Is that what you said? Yeah. We couldn't move anything until he showed up. Yep. Am I had to deal with one of these before? Have you? What's your experience?
I was practicing in Northwest Indiana, so between Chicago and Illinois. And there was a lot of cattle going from Illinois up to Great Bay. The upper deck was dairy cows, and then the lower deck were beef cows. And they are not cattle friendly handling there at all. So thankfully myself put a background help a little bit on finding emergency response on where to stand and how to get the beef mamas on one at a time and shut the gate in between. Got them in there, back out.
What do they want to do? What do people want to do when that happens?
Stand in the way.
Stand in the way or just open the door and let them out? Get them out of that. Get them out of it. Doesn't matter.
Get them on, right?
Right, glad you were there. They were lucky you were there.
Yeah, it was interesting. They had basically, and we were like right on the line of Indiana and Illinois, and it was who had authority to dispatch a firearm to euthanize, and that was the best we could do it. Our practice had that euthanasia solution available at the time, and not. Yeah. We have a situation like this happen within wild. They did not. He called my husband because he's got portable corrals. My husband goes out there and he's telling cops how to properly euthanize his back house. There's nobody.
Nobody called it. Nobody called. Yeah. So that's it. Communities, knowing the laws and knowing who can, getting that. So we hosted we went out, there was a 911 conference. The 911 operators meet every year, just like veterinarians do. And we got a hold of them and said, hey, can we get 30 minutes on your time? We talked about emergency response and who to call. This course right here, it was sponsored by, I think, NCBA, check off dollars, bovine emergency response, Plan Burp. It's a great course, and Dave Workman, one of the guys who teaches it, was a 911 operator. And he's got a layout of a template of, hey, you get the 911 call, here's your calling tree right here. So that's pretty neat. Then you were saying about the trailers, okay, veterinary suits, or even veterinarians. I had been out of practice 15 years before I ever walked in those trailers. How many of you walked in one of those trailers and seen how it works? Very good. How all those gates and things work, and you pull this down and this, and there's great videos on there. Right, so trying to get animals out of something like that, especially when it's turned over, can be a nightmare, but yet everybody wants to help. So having those kind of trainings, one of the things that we do with our large animal training is we'll bring a trailer and let everyone walk through it, and see how to do it. And even the firefighters are going, oh, I didn't do that. You know, and just things like that, just that kind of awareness. But not only that, then you'll get that phone call in 6 months. Hey doc, what'd you say? I need a hand here. We're just getting to know that, right? We all went to school because we don't like looking people. So you stand them up. You know how big those little holes are? About perfect for a 4-weight cat. Just put their little foot in there. Right. So I think this is what he's showing them how to put something down. Get a lot of broken. Something like that. There's my veterinarian doing what he does best, holding up the gate, talking to him about flight zone. Okay. Usually they're going to cut a hole in the top or the bottom. I think that's the bottom. Well, having these things in place ahead of time. There's still like 6 they never found. Right? Be part of the system before something happens. Get to know people. Dangle that carrot. And I think that's what I said. Get on your SART team if there's a state team or a local team. Get with your county They call them a county cart, C-A-R-T. Let's see, another example. This is a pipeline explosion. This one's kind of graphic. Pipeline explosion. The state came in, the EPA came in, it burned for like 48 hours. They couldn't get to it to cap it off. 2 people lost their lives, but they set up an incident command system. They called it a unified command. And set up, that's an instant command post. They gonna make it? No, family wanted to keep them. This is what they all look like. Okay. You can feed them, you can water them, they're not gonna make it. And again, sometimes we've got to be the ones to make those decisions. But we also have to switch into how do we do it? How do we do it properly? Do you know in your state who can legally euthanize an animal? You do now, right? Or in Illinois, right?
It was the sheriff's deputy could, but he was emotionally unable. And so the owner of the cattle at the time came with an improperly sized firearm and finished off.
In this state, do you have, is there, I guess I'll challenge you to figure it out. If you have to have, in the state of Mississippi, 2 reasonable people have to decide that an animal can be euthanized. And at least one has to have a medical background. So I get calls from ambulance drivers, I get calls from deputies that'll say, hey, doc, and they'll show me a video, hey, this is on the side of the road, and I euthanize it. Like, yeah. In Mississippi, we have two reasonable authorities. 2 reasonable authorities can be allowed to euthanize them. So get to know what your laws are if you can do that. And then documentation for insurance. I hit those. All right, it's all about partnerships. One last thing on this part. We work with our veterinary students, but this is something you can do with your local schools. If you work with your local schools or you got kids in 3rd grade, take the 3rd grade class to the fire department. But we take our students, our veterinary students, to the fire department because do you think they know what this, how many have heard the jaws of life? How much noise does it make? It's pretty quiet. Some of them are pretty quiet, right? But some of the other machinery they use is pretty noisy. The generator makes the noise, right? So it depends on what kind of equipment they get. Work with your fire department for your local, I'm sure you've got local ag school. Because that's the other thing, veterinarians don't have a monopoly on animal health. Go to the local community college, the ag school, work with them on disaster management. So when that trailer overturns, you can call them, right? It's all about getting yourself surrounded by the right people. So we get them out here and they show us how to do a hoist, right? Get that cow out of a ditch, get that horse out of a ditch. I save my old gates and panels from the house. Unfortunately, I get too many and I let the kids cut them up just so they can hear the equipment and the different types of equipment they have. And then they take them out there and just show them what equipment's on a fire truck. You know, it's kind of, it's always a learning experience because if something happens and you get an animal tangled up or an animal hurt or an animal in a truck rollover or a trailer accident, knowing what to expect will help you prepare better. That gets you out of that deliberation stage a little bit better, doesn't it? So, all right, and the final one. Out in the United States. Yes, that was 1929. 1929, I think it was Pennsylvania or some northeastern county. There was a vaccine contamination. Okay, so there's a lot of history behind the foot and mouth disease. I believe we've had 4 major outbreaks here in the United States of foot and mouth disease. So we know it can be pretty harmful. We know it's very contagious. Right, one of the most contagious diseases known to man, according to every textbook we've read. Right. You guys, students, most contagious disease known to man, I get it. What else do we know about foot and mouth disease? Easily transmissible. Causes blisters. Causes blisters on the feet. Causes blisters, coronary band. Causes blisters on the teeth, in the mouth. Right? What's it do to does it kill them? High morbidity or low morbidity?
Lawrence?
Y'all said high, right? High mortality or low mortality? low, high morbidity, low mortality. So are you going to get called out to look at one animal out of 100? I think that might be a FMD. I'm just gonna put that in my head. Yeah, no, it's just one. I'm really gonna think about that a lot harder. Okay, it's gonna affect one. It's usually gonna affect many. Thank you, Russ, Dr. Bailey. It's gonna affect one. It's gonna affect many. Okay, we're not gonna see those lesions on the coronary veins. If I go out to that dairy, what's gonna happen? It's probably covered in wool. I said, he's done this. Am I gonna get everyone up and examine them? I'm gonna think population medicine curve wise right now. These guys are getting. So most, does it affect sheep? Pigs? Horses? Okay, right? Wildlife? Deer and hogs. Y'all have wild hogs up here? Oh, this way.
I think we're good now, Karen.
Everywhere, right? Talk about disease control.
I think we're good now.
Everywhere.
I think, yeah.
Okay, thank you. All right, here's our differentials that we think about. You were reading them. I was so impressed you guys knew all these. Y'all were reading them. All right. We won't talk a whole lot about them again. You guys are pretty familiar with these. We've all had them. Swine vesicular disease. It's in Europe. Vesicular xanthoma of swine we haven't had since the 50s, but it can affect marine life. They get little lesions on sea lions and things. Seneca Valley virus. We probably have a lot of Seneca Valley virus up here. Are you FADD? Do you see a lot of Seneca Valley?
I haven't seen it, but it's.
Okay, so I know at least so Seneca Valley virus looks like FMD. It's in pigs. It was discovered in a slaughterhouse in Canada and pigs that came from the US. But it causes blisters on the snout and on the feet, just like an FMD. And at least our ADIC in Mississippi says that's, or actually, Bell Stevens said that's the #1 cause of FAD investigations in the country for Seneca Valley virus. Fully indistinguishable from anything else without an FAD. So some people think it's related to the idiopathic swine vesicular disease, but it's out there, right? The big thing we know, we can't tell these vesicular diseases apart without diagnostics. We've already said this. High morbidity, low mortality. You're usually not, these are Plum Island pictures. You're probably not going to see this either. That's a pretty clean break. Again, if you happen to see it, it's going to look nasty. You're probably not going to see those blisters, right? Because what do pigs do? They root, and you're going to break those blisters before anything happens. So usually what you're going to see are crusty type lesions or raw lesions like this. Cover that. Abortions due to fever. You can get high mortality in neonates, and they'll have that tiger stripe thing according to the textbook. Right? If you're nodding your head, you've read that class, right? Tiger stripe, hair, right? We're not going to see it, but that is one of those things. And this is where it's at. Indonesia has had a few outbreaks. This is a WOA map. Basically, the green's free. This is free with vaccination, with or without vaccination. These countries don't report. But that's another thing. Maybe travel internationally. I travel internationally or do mission trips or go anywhere. We always look at where we go. And like we were here in Guyana. Guyana is a free country for FMD. And we were doing veterinary assessments and cattle assessments. But they're right next to, hold on, where is it? Venezuela. Venezuela is not, thank you. I knew it. Venezuela does not report. So can you really say they're free if they're next to a country that doesn't report or test? So it's very interesting world trade and how things are determined. But these are by WOA, and these have actually had the veterinary assessments that say whether or not a country can be considered free or not. The outbreaks we've been seeing have been in Indonesia, Jakarta, Kazakhstan, and a couple other places are active. And pretty much FMD is endemic in these other countries.
Sorry, one more time.
Okay. Pretty much FMD is endemic in other countries. So if you see that case, right, what are you going to do? Right, rule out a couple other things.
The least popular guy at the conference.
You're the most popular guy.
Will that
So-
work?
I just needed to take out. So just to keep an eye on things, and I just put these up here really quickly, is that FMD doesn't just affect, you said trade, right? But there are other issues going on because, Brazil is one of the biggest exporters of meat, right? And we bring a lot of meat in from other countries, and the trade is a huge issue. There are things like whether or not they can bring frozen meat in there, whether or not they can bring fresh bovine tongue into the country, whether they can bring ground beef into the country. There are a lot of different things that go into that. And then to top it off, somebody mentioned BSE, bovine spongiform encephalopathy. So a lot of these countries also, in order to trade with us, have to have BSE equivalency status with us in order to trade. So they got all these different layers on foreign animal diseases. Which is why we really need to make sure that we're vigilant on keeping it out of the country. The last ones I've heard where there were concerns after reporting cases of BSE in Brazil and South America, that they thought they were hiding cases of BSE, and there were some concerns that they might actually have hiding other things. So the other things, I don't know how to say it politely, countries can be like gossipy old women. They like to point fingers at each other in terms of where they got disease and where they came from. So you do see a lot of that because some countries like to have trade advantages over each other. This is the South America situation right now, current as of, I think, May. Guyana, Venezuela, Brazil has, excuse me, there's some controversy in Brazil. Dusty, you may know a little bit more about that they claimed that they're free without vaccination or. There's 3 right there. No. Right there. Okay, so just one state. The Iowa of Brazil, okay. And I read something where the country tried to claim 2 more, but yet nobody would recognize it. The country, like on its own, says, hey, we're free in these other 2 states, but it hasn't been approved yet, right? Yeah. Okay. So that's kind of a working target. And I like to look at South America because it's an easy place to go. And I know at least a lot of our students and a lot of our people take mission trips down to South America in different places. We do a lot of exchanges in South America. Is there a vaccine? Is there a vaccine? Yeah, why aren't we using it? Don't look at the slides, come on. There is a vaccine. We don't use it for 2 reasons. One, there's a DEVA vaccine. You remember what DEVA vaccine stands for? That's students with the DEVA vaccine. Differentiate infected versus vaccinated animals. So we need to know, one, is it a DEVA vaccine? So if an animal pops positive and it tests positive, is it positive to the vaccinated or is it positive to the got infected? Okay, so that's a DEVA vaccine. You do have FMD DEVA vaccines, but they're not used because, as Dr. Dustin said, right, trade will vary if you're free with vaccination, right? It's a different set of trade rules and regulations. So everyone wants to be free without vaccination. Okay, so there's lots of different reasons for vaccines and not. Very closely monitored by the World Health Organization whether you vaccinate or not. The cost is high if we were to get FMD here in the country. Anybody else here go to UK? Anybody else here go to UK for the 10 million animals slaughtered? They say at least 6 million were because of welfare because they couldn't feed them. Okay, 85, 90 suicides. So things that we want to make sure that we prevent. But that's foot and mouth. It's a bad disease. We want to keep it out. We want to be vigilant. And you don't want to be the one to forget it. So if you see any of those, I mean, we've all seen IBR, right? Sewer pipe trachea, crusty noses. We've all seen things like that. But we don't want to miss it. So call somebody if you have, they want to be called, right? Right. Okay. Vesicular stomatitis virus. does affect horses, cattle, can affect small ruminants. Camelids is pretty much considered endemic. It's cyclic because it's spread by culicoides, which means it comes usually in the late summer or early fall where we see the cases. Crusty nose, actually, if it did show up in sheep and goats, it'd be like an orf, look like an orf. Crusty muzzle, but some of the neat things that they learned in one of the biggest outbreaks in 2015, around 2015, the pinna of the ear. They were having lesions in the pinna of the ear, which was kind of unusual. No heart lesions like FMD, and it's transmitted by midgets. Currently, let's see, that was the biggest outbreak, 2014, 2015. A lot of cattle, which was surprising. A lot of cattle. Usually we think about it in horses, but it had a lot of cattle. And then in 2023, we've got an outbreak going on right now. And the interesting thing about the outbreak right now is that it's in like Santa Barbara County and what's the other? Santa Barbara County and one of those other coastal counties in California. So it's spread to 2 counties that normally hasn't been found in. So this is ongoing. As of about a month ago, there's still 50 something premises under quarantine. Okay, so we see vesicular stomatitis virus. We see it quite commonly in the southwestern states because it's seasonal, and it's one of those things we've got to rule it out versus foot and mouth disease. Okay. Malignant catarrhal fever, you mentioned that, I think, right? 2 different types of malignant catarrhal fever. Malignant catarrhal fever, how many of you have seen that? Okay, so we see it sometimes. It's either wildebeest associated or sheep associated, and usually it has a little bit different signs that we can rule out. So sometimes we can rule it out without calling a foreign animal disease diagnostician. The most common being what? What do you guys see? What do you normally see in malignant catarrhal fever? What makes you not call your veterinarian, your state veterinarian? Commingle with sheep. That's kind of a dead giveaway, right? Right, we're at the Buffalo Park with the wildebeest because they're commingled with sheep. Right, what else? You know, that characteristic. Crusty muzzles, and usually they have ocular opacities. Crusty muzzles, you see that ocular opacities in there? They usually don't have lesions inside the oral cavity. Okay, and again, I'm a big one on history and talking and getting things out. It's not always going to be so obvious. Like I was traveling out of the country last week. But talking to, hey, my kid was at the fair. I think it was Oregon or Washington had a big outbreak of MCF a couple of years ago where they actually had their sheep and their cattle and everything housed together and they had a big outbreak. This was one from Mel Stevens, USDA. One of the FAD cases that they went on was a bull with malignant catarrhal fever. But you see that really copious ocular discharge, nasal discharge. They're just nasty. You've seen them. Somebody else mentioned hemorrhagic disease. I think you mentioned hemorrhagic diseases, right? 2 different types of hemorrhagic disease affect our cloven hoof stock, blue tongue, and EHD. You guys have EHD here, right? Lots of it. You get a lot of blue tongue too. Yeah. Okay. And why might they be, right? They get a swollen head, swollen tongue. They get some erosions on, oftentimes in the mouth. Very hemorrhagic in deer, can kill them quick, kill them dead quick. So sometimes we're suspicious on that. Blue tongues mainly in small ruminants, but again, can have some oral lesions, coronary band lesions, a lot of discharge, but usually don't have those lesions in the mouth. And then your EHD, we've had a lot of it. I think Ohio's had a lot of EHD in the past. Southern Ohio's had a lot of EHD as well, but they tend to get neurologic, and people call them in and they get them taken care of pretty quickly. What else did you told me? You told me IVR. Y'all seen these IVR lesions? What we've always called our VMO or FADD is where they get the lesions on the vulva, pustular vulval vaginitis. And that's one we've had to call for an investigation just because it didn't look quite right. But sometimes when you get a really severe case, if you have a lot of mucosal lesion, you might want to investigate a little bit further. But they get that red nose syndrome. Well, BVD, mucosal disease. Again, and I think as far as differentials, these are the ones, like I said, you might get one or two. You're not gonna have a whole herd of lame animals. And, you know, as veterinarians, we know the health history, we know the vaccination history. And these are things as we do our epidemiologic investigation or our outbreak investigation, we can pretty confidently rule most of these out, can't we? Or rule them in, I would say. Hopefully rule them in. How about that? That was the first animal I saw in Scotland. And I was ready to say, I got foot and mouth disease. Look at it. Thank goodness I had good mentorship. That scared the heck out of me because I almost took somebody's farm out. Just how many times you look in a sheep's mouth? Remember over sheep a lot? You look in their mouths all the time? Yeah, that's just a normal. It wasn't about 50% of them because the grass was short because they've been in quarantine for foot and mouth for 4 months. The grass is short and now their mouth is. So there can be non-infectious causes. Oh man, this is another one. My students called this one broken jaw, broken leg. Okay, broken jaw, broken leg. Lameness, hypersalivation. All right. Think about history, think about the big picture and the context. All right, how did it get here? How can a foreign animal disease get here? You guys are getting tired of it. Come on. Where's the last time you went out of the country? A what? Travel. All right, I spent 4 hours in the Minneapolis airport last night. Could I have brought it home? Okay, I'm going to Bolivia next week. Can I bring it home? Maybe, right? When I travel, I don't know about you guys. When I travel on an airplane, if you look in this bag right here, I got trim, I got gum, I got crackers, I got all sorts of stuff. Anybody else travel like that? What would you do if you travel internationally? Do the same thing? It didn't work, right? Is it possible that an accident happens and bring something home? Not only that, I walked yesterday, I walked a young lady from, I think I couldn't tell where she was from, she couldn't speak English. She kept saying, Salida, Salida, Salida. Yes, and she wanted to go out. That's where I took her. She had bags of food with her. I don't know who she was or where she come from and what she brought back with her from South America. Right? But accidents happen. So keep vigilance, how things like that could get there. But some of the things that make me think, so these are, what do we say foot and mouth is the most transmissible disease known to man? Does that like make you scared just to shake my hand when I come in from South America? Right? So here's a couple things I just was going to share. This is kind of neat. This is some research we did in Vietnam with the USDA. And so this is mother-daughter. I spent 2 summers in Vietnam. Mother was positive, daughter was negative. That's everyone. So we said, okay, let's go get this beef cow. Negative beef cow from a new farm. Put them with 2 positive mamas. Tested every month. Never popped positive. And I burned all my clothes when I came home. Right? So it makes you think that there's so many different things that go into transmission of disease that we have to just be vigilant and think about what it is that we're bringing in and what it is and what activities that we have. All right, these are pictures in the Guyana import station. You can't see this. This is a snake. See that? That's a tick. It's as big as his head. We're going to talk about ticks in a minute. Anteater was in the jungle less than 24 hours before. Caiman, alligators, birds. There's a lot of animal imports out there. Think about the monkeypox outbreak. Mpox now, right? Mpox now. Monkeypox outbreak because someone wanted to have prairie dogs for pets or Gambian rats from Africa. Okay. People want to bring dogs here. Everyone wants to rescue the dogs, don't they? Right? Did they bring something in? Possibly. All right. Let's do what?
The dog is bringing it in from down south.
Yeah.
You do a lot of stuff in Wisconsin.
We're giving you heartworm. We're giving you heartworm. We're giving you guys anaplasmosis. Right? Is that nothing, Nathan? We move, we travel, we take a risk, right? Here's another one. What's going on in Russia, Ukraine? So many aid organizations, NGOs coming back and forth, going to, going back and forth for aid organizations and helping over in the Ukraine, Russia, Belarus. Okay. And I love these statistics because you read them everywhere on how many people travel throughout the United States. So I sat down, I spent about an hour trying to figure out where these numbers came from. I don't know. The National Transportation Board, Bureau of Transportation Statistics. It all depends on how many people come internationally through our airports, whether they're just traveling through our airports, whether they stay, whether they enter customs or so forth. All I know, it's a lot of people. There's a lot of people traveling international every day. At least 250,000 people from foreign countries enter the US every day. That's busy. Then think about people like me that travel with my snacks. Okay. All right, questions on vesicular diseases, on those vesicular diseases, right? The ones that we're gonna see, and that's how I always like to divide things, we're gonna see things like IBR. Here in practice, we're seeing IBR. We're gonna see things like VVD, mucosal disease. We're going to see traumatic injuries. We may or may not see vesicular stomatitis, and we hopefully will not see foot and mouth. Okay, so knowing some of those common differences will help. Some of the other diseases of cattle that we see that I'll talk about, screwworm, pox diseases, and I'm thinking of the ones that I hear in like the global circle with some of the circles that we work with that our other industries are scared of. We're always scared of screwworm because it's another easy one that comes in. It probably comes in and we don't detect it. You guys know screwworms, right? If it feeds on live tissue, it buries in instead of crawling across like maggots. We've all seen the gory pictures from Florida. These are USDA pictures where basically they form a pocket under the skin because they bury in. Let's see. Where is it? Right, South America. Okay, we see it in South America. Right there is the Darien Gap right there, which is where kind of the line right there between the control zone and the positive zone where they release the sterile flies is right there. Recent incursions. One of the concerns, Costa Rica has had several this year. And Panama, right there where the border is, has had some in 2020 and 2021. So something to watch out for. Again, I've got a group of students going to Costa Rica for spring break every year. This is a map that basically shows the good news. The good news is while we have sporadic cases of screwworm in the United States, it hasn't yet gotten into cattle. There are several cases where horses have gotten it, and horses travel, and somebody may know more than I, but you know what horses do when they come into the country? They quarantine, right? Somewhere in there. Oftentimes they quarantine off the coast before they come into the mainland of the United States. Okay. There were also, that transportation thing is a big deal. All right, questions on screwworm. We may or may not see it. If you see something, say something, recognize it. The last case we had in Mississippi was in 2006. Actually, a former student of mine, she pulled out an eyeball. She enucleated a dog's eye from Tobago, I think. And that's exactly what she saw was a maggot behind the eye. So, oh, how odd. Called the USDA. They came out and tested it. If you see something, say something. It doesn't hurt to test. We good? I know diseases are not always the most fun thing. All right, pox diseases. I wanted to mention pox diseases because lumpy skin disease is becoming a very big problem overseas, globally, costing more and more money, and it's actually spreading into areas, into states where it hasn't been previously. So I wanted to mention lumpy skin disease. There's also sheep and goat pox. They're both orboviruses. They're both from the same family, and the vaccines for them also have cross protection. The difference is sheep and goat pox tends to be more internal. And obviously in sheep and goats, it affects internal organs, your visceral organs. It is much more highly fatal than your lumpy skin disease in cattle. But for cattle, the lesions will cause those big pox lesions, kind of has those big scars with that black center in them that falls off and leaves raw skin. They're pretty nasty and really hinder production, which is why that's on the list. But again, if you talk to people from USDA, right, World Organization for Animal Health, OIE, lumpy skin is one of the bigger concerns. This is where we find it. And there's drama here too. Mostly cattle, not sheep and goats. Acute viral disease. One of the biggest concerns right now is that it's moved into China. And China's health reporting isn't always stellar. So they're concerned once it gets into China that it's going to just explode into China and Russia. Those are what the nodules look like. Okay, like I said, lower morbidity, mortality. There is a vaccine available, but it's non-diva. They've actually used the vaccine in Europe and it works quite well. Current outbreaks, 2023. Yaks. So if anyone goes to work on yaks, yaks in Nepal, they say at least 28,000 affected and several have died, several hundred have died. And then there's a big drama, some drama between Indonesia and Asia or Australia right now. So Australia is one of those countries, right? It's an island, and Australia is one of those countries that they're like free of everything because they've got good borders. They can keep things out. Don't ever try to take trail mix into Australia. They'll take it. But Australia's got a very robust animal health system. So right now, Australia has been free from lumpy skin disease for many, many, many years. They sold a bunch of cattle to Indonesia, and Indonesia claims they're positive on arrival. So from a global standpoint, there's kind of some controversy there. And again, it's that transportation and knowing about the incubation of disease. Let's see, sheep and goat pox, I said was a little different, goes visceral. These are some of the lesions, higher morbidity and mortality. Questions on our pox lesions? Those are quick and dirty diseases. Coronaviruses, after what we've been through the last 5 years, I could not talk about coronaviruses, okay? So just to mention, right, shedding feces and nasal secretions, and we have 3 different types of syndromes in cattle, right? That was the one thing we get questions on all the time during Corona. Hey, can we use the cattle vaccine? That's why I make work, right? Can we use the cattle vaccine for Corona? People were actually stealing the stuff. We've got winter dysentery, capid diarrhea, and then the respiratory disease that most of you are probably very familiar with for Corona. And I like to remember this. This was January 7th of 2020. U.S. warned citizens in China to avoid animals and sick people over the mystery pneumonia disease. Pay attention, people, to what's going on in the world. This was the start of the coronavirus outbreak. Okay. Pay attention to what's going on in the world. Another coronavirus that's out there is MERS-CoV. This is in camels. Again, can be highly fatal. Is a coronavirus. Transmission is close, but it has not seemed to come outside of that. And very few human-to-human transmissions have come out of it. But it is another coronavirus to be familiar with. Questions on coronaviruses. We see it in cattle. We have vaccinations for it in cattle. Causes disease in cattle. Rift Valley fever. I want to mention this one because this is one that's been a target of potential bioterrorism agents. You've probably had Rift Valley fever drills, right? I know Florida's had some exercises as a potential bioterrorism agent because it can have strains can have high morbidity and mortality. It is spread by biting. It's bloodborne pathogen, biting insects, and basically causes abortions and mummifications in small ruminants, pretty much. Characteristics of a Rift Valley fever is a macerated liver. You open it up to necropsy, and the liver just falls apart in your hand. Again, I don't want to go over all the pathophysiology of it, because that's not what we're gonna see, right? I do know that there's a lot more sheep and goat imports, and I think nationally, one of the largest growing sector of agriculture and livestock are sheep and goats. So we're seeing more and more sheep and goats. Epizootic in sheep cycles in the Middle East. I think I've mentioned that. All right, questions on Rift Valley fever? We don't have it here in the United States. We don't want to have it here in the United States, but it is a transboundary animal disease that is a potential bioterrorism agent. All right, Asian longhorn tick. You guys seen these yet? No, you don't have them here, right? We haven't made, I think the closest it's made to you is Missouri and Arkansas, which would be closer, Missouri. All right, Asian longhorn tick popped up about 2017. They basically exsanguinated a bunch of animals, and they found this tick that hasn't never been identified in the United States before 2017. But now a lot of our entomologists are going back some of their stockpiles of ticks and finding that the tick probably has been here a little bit longer than that. It just hasn't been identified. The concern about the Asian longhorn tick is that number one, it can reproduce asexually. So one single female can result in thousands and thousands of ticks. Okay, so it can suck the blood and exsanguinate an animal pretty quickly, especially a small ruminant. And the other thing is it could potentially be a carrier of Tyleria orientalis, which we have not had here in the United States yet. They say experimentally, it can also carry things like Babesia, anaplasmosis. I think the jury's out on Rocky Mountain spotted fever, right? And I think they said not likely Lyme disease. Has affected humans, has been found on humans, but they don't seem to like us. That's a good thing, right? But it is spreading, so something to watch out for. Those are the states where we found the tick. Most have been in deer, a couple dogs, a couple humans, and so forth. I've already mentioned. To date, all the ticks that they've tested, they have not yet found a pathogen. That's the good news. Not yet. Right? And we can't be complete without an African swine fever update. African swine fever, as we all know, is a transboundary animal disease similar to classical swine fever, but we've had outbreaks of African swine fever and it seems to be spreading across the globe. This is a map of where we currently have African swine fever. Let's see. The triangles are wild animals, wild hogs, and the dots are domestic animals. So here's the thing about African swine fever, and this is something I learned overseas, is, okay, vet students, I'm going to get you guys, what do we learn? What's the transmission of African swine fever? How's it transmitted? We were always told ticks, right? They emphasize it's going to be through the ticks, that sylvatic cycle, it's ticks, and everyone else says it's food, right? So, and I know we've got swine experts in the room, but African swine fever is similar to FMD in that it's very, very transmissible. It can be spread in not only ticks with the wild cycle, but different types of foods and feeds that are brought over. We import a lot of proteins and protein substances from other countries. It can be brought over in that, and it seems to live long periods of time, over 20 days, and things like protein supplements. It can live in my snacks, my ham sandwiches, things like that. It could decimate our population of hogs. And this little graph just shows where we've seen the outbreaks of cases and losses since, I believe, 2017. Right, carried by the soft tick, affects wild boars. It's pretty much endemic in those populations, and has great survivability. There's our textbook, right? Turkey kidney disease, right? We've all seen, or blackberry spleen is what they teach us in school. Highly contagious, can be highly fatal, can be peracute to chronic. Beagle Brigade, one of the targets for bringing in meat. I love these guys, the Beagle Brigade. They've been catching people left and right. Japanese sausages, Brazilian meat. That's what the dogs are meant to do. All right. So it's going to require vigilance by us. biosecurity at all different levels to protect. I'm gonna leave it one more, see if this will work. Lost power on our sound. That's just a quick video. It's kind of, I don't know if you're gonna get the sound now, but. Ooh. That was me. So this kind of is gonna lead it, foreign animal diseases, and like I said, the kind of these 4 hours, when we think about all hazards, I know the first 2 hours, we really talk about natural disasters, tornadoes, hurricanes, things like that. But the whole process of how we respond to a disaster situation is all gonna be the same. The better prepared we are to make a decision, the better we're gonna recover and mitigate and then have resiliency. So whether it's a natural disaster like we talked about earlier, or a foreign animal disease, we've got to think all of the steps that we have to control. So this video is kind of neat. Yes, if you just watch it.
Britain in the grip of the foot and mouth epidemic. All indications at the time this report was being prepared were that the disease had been checked and was on the way. But the stringent precautions to arrest the spread of the cattle-killing sickness were intensified. Counties unaffected fought to stay that way, and all traffic had to pass through the disinfected roadblocks. Already, well over 200,000 animals had been slaughtered. In terms of hard cash, that's £12 million worth of livestock. No one could afford to take chances. This was the scene in the home county. All over the country, racecourses stayed empty. Racing had been banned. Though expected, it still came as a severe blow to those dependent on the sport. And up and down Britain, the scene was the same in hundreds of betting shops. Even greyhound racing, though not banned, had imposed tough restrictions on itself to prevent the movement on animals about the country. On Exham Heath, horses trained to their peak for the national hunt season still had to have their workout, though there seemed small chance of any racing until the end of the year. In farms where the dread disease had not struck, the battle for survival was a very real one. Others not so fortunate had lost entire homes, often a lifetime's work to build up. Compensation for so many was little consolation.
Oh my gosh, I don't know how that happened. Ah.
Britain in the grip of the foot and mouth epidemic.
What do you think of that? What about their control measures? Get out of there. Any comments? Oh, this stuff is. Huh? It was a start. All right, here's some pictures from the 1929 outbreak. How's that different than what we're doing today? How is that different than what we're doing today? Are we still euthanizing? Are we still burying? Are we still disinfecting our tires? Right. Early outbreaks of foot and mouth disease, they did nothing because early outbreaks because of the weather were like up in Pennsylvania, Ohio, Michigan. And they thought, hey, it's not going to overwinter. They weren't sure what the transmission was, but they knew if they had it in the fall when it was warm, after the winter, it was gone. You know why that was? Probably there was no point. They didn't know that. Do nothing. Quarantine, slaughter, cull, control host movement, fomite. All things we do today. These are pictures I took in 2001. Well, I didn't take that one, but right? No entry. Drive through that. Wash your tires. Slaughter, cull. Is it any different? What do we have today that's different? Right? Just something to think about. So a lot of the tools that we have today are same and similar to the tools that we had 50, 60 years ago, right? Those of you that work with stocker cattle, remember stocker cattle. How much progress have we made in bovine respiratory disease in the past 30 years? We still have the same incidence that we had 30 years ago, right? We just have different drugs, different antibiotics, different stressors. The rate's the same. Okay. Only thing we have different, possibly vaccination. Okay. So these are some of the pictures. Actually, I took these in Vietnam. Here's our biosecurity. We're gonna wear a mask and gloves. All right. This is the guy going around giving the vaccine. He's got sandals on, but he's not breathing anything. Yeah. And he drove around from farm to farm in a motorbike. So biosecurity means a lot of different things. Again, we're switching gears and thinking about ag and bioterrorism, but the threat's real. This is that ProMed site I told y'all about. I sign up for this and get a digest every day, just to see what diseases are out there. But I also see what's all around me here as well. So, promedmail.org. This is another one that's more of a security one that talks about bioterrorism, agroterrorism threats, school shootings. This one is globalincidentmap.com. If you have a bomb threat in a school, it's going to show up on here. So that's another neat one. All right, so I'm going to hop right into any questions on diseases. Like I said, that was kind of the quick and dirty ones that I thought might be important to you guys. Like I said, the singular diseases, because it'd be illegal if I didn't mention FMD and an emerging diseases talk, right? Keep an eye on Rift Valley fever. Keep an eye on African swine fever, lumpy skin diseases. We all just need to keep on our toes on it. So the last part I'm going to talk about is biosecurity. Everybody needs to get up and stretch. Now's the time. All right, Russ, what did I do again?
Just pull up here. Pull up what you need now.
All right. 4. Here's the flyers for that bovine emergency response. Again, this is funded to check off dollars. And I think, I don't know if it costs, what it costs now. I think it costs the instructors. You've got an instructor in North Dakota, West Virginia, Florida. If any of you guys want to work with Extension, your Extension agent, we have an outline of a program that we do that we get hours for. There's lots of resources out there. All right. Everybody awake? You still with me? All right, I got a couple questions for you. Do you make multiple farm visits a day? Do you own or care for similar species at home? Can't walk past you guys evidently. Are you exposed to potentially sick or infectious animals or animals with unknown health status? Well, we do, right? Right? Do you wear the same clothing between farms? Everybody look down at the boots. Okay. You wear the same clothing between farms without washing or changing them? Do you wear the same boots or shoes without washing or disinfecting them? Before going home, so you notice I'm not asking anyone to raise their hands, right? Do you use animal equipment on multiple operations without disinfecting them? Here's another one. How many of us disinfect our tires when we leave an operation? All right. You? Yeah, where's VMOs? Not sure. Do you travel out of the country where you'd have contact with animals or animal areas? No. These are like these are kind of like the dumb giveaway questions from your FAD modules at USDA, right? Do you allow foreign visitors to ride with you without screening or quarantine? Anybody? Okay, let me ask you this. Do you allow students or other guests to ride with you without asking them where they've been? You gonna let me ride with you in 2 weeks? I'm going to Bolivia. Do you ask the question? That's the question. Do we ask where our visitors have been? Do we ask where our students have been? right? Do you have a dog that goes with you on farm calls? Is your truck cleaned on an as needed basis? Or just when it gets dirty? Hey, I don't wash my truck every day. I'm just saying. I'm not armchair quarterbacking, but think about the risky behaviors that we do. Okay, if you think on a scale, a visitor scale for our farms, we're very risky, aren't we, as veterinarians? The good thing is we know about things like biosecurity. All right. Somebody give me a biosecurity recommendation. I'm gonna ask 5 of you. Give me a biosecurity recommendation.
Front gate.
Front gate, what about it? Shut it. Thank you. What else? Call for entry. I like it. Contact the owner. Thanks. What else? Have a boot dip or shoe dip. Okay, great. What else? Don't visit other operations. Great. What else? What do you do this every day? What else? Wash your hands. Wash your nose off. Right? Test for trichomoniasis. Quarantine to arrival. Don't fly from the stockyard. Or if you do fly from the stockyard, quarantine. Vaccinate. We have lots, right? Lots of biosecurity recommendations. Right? They can be general or specific. Y'all give me some great general ones. Lock the gate. Know who's coming on your farm. Right? They can be agent specific. Right? Remember the old Yonis. How many of you ever use those old Yonis? Risk assessment. Thank you. I'll tell you what, to this day, they're probably still the best risk assessment tool that we have. And while it says Yonis on front of it, it can be used for any of our fecal orally transmitted organisms better because it was both quantitative as well as qualitative. It asked you questions like where you keep your heifers, where you keep your calves, are these separate, in quarantine? They also have some for, that's what this one is. They also have some for BVD. I think there's one online for BVD. They can be agent specific, they can be industry specific, biosecurity for aquaculture, biosecurity for stocker cattle, and they can be situation specific, biosecurity for 4-H and 4-H livestock. We have lots of different recommendations. We've already talked about how disaster response is from national, state, local, right? Or local, state, national. Our preparedness, our response, and our recovery to an animal disease would be just similar to any other disaster. It can be local, it can be state, regional, or national. Okay. So I named this peacetime and war because just like the term TAD is kind of the global term for transboundary animal diseases, they'll use the term peacetime and war. Peacetime means when everybody's happy, healthy, everybody's getting along, and war means when there's an outbreak situation. That's kind of some of the terms that are used globally. I've already mentioned what those are. We know there's lots of opportunities for things to go wrong. And we know there's a lot of diseases that we talked about in the last hour that we've got to be vigilant of. So a lot of our biosecurity, you gave me 5 general biosecurity recommendations, are going to help prevent any of these just as much as they would an IBR, VVD, or a salmonella, right? Yes. Okay, I know it's getting late. Okay, so we think about our biosecurity at the state level. We've already talked about CBIs, right? We've talked about looking at the list and seeing how states are different, but also how states are similar. We've talked about how transportation is an issue as well. Okay, on a farm, which is where most of us are gonna, it's not necessarily the most important, but this is where we're gonna have the most effectiveness, is on a farm, on an individual farm or individual clinic basis. Okay, we also have to think about the term, right? Biocontainment means what is inside of an operation versus biosecurity is between operations. All right, here's one more. No sound needed on this one. This is, I make the trip to Memphis quite a bit. This is actually, so there's a lot of debris, and it looks like urine and manure falling out of this cattle truck that I'm finding on the highway. Basically, I'm on Highway 40 between Nashville and Memphis. I smelled it before I saw it. That is my windshield, other than the crack, which was crystal clear before I started. If you watch up towards the top, you'll start seeing the splatter. How do the diseases get here? I don't need biosecurity. I've got a closed operation. Y'all see this every day, probably, don't you? Okay. How do diseases get transmitted? When you poultry operations, right? What do they do when they clean out a chicken house? Where do the dead ones go? Check them up top. You think they fall off the top of the truck? You just drive down 25 South Mississippi and you'll see them spotted down the truck. Okay. Or spotted down the road. So they can get there. What if the truck's going down I-29, up I-29 in South Dakota? Right. Do we have concerns? I've got a closed operation. I'm not concerned. I don't go anywhere. Right. So biosecurity is basically looking at our risks and doing a risk analysis. What are we afraid of? What do we need to do to protect ourselves against it? What's the chance of it happening? And how do we respond? Okay, that's going back to that whole, wait a minute. Denial, deliberation, and decision. That's kind of a risk analysis, right? All right, I'm an epidemiologist. I had to throw this in. All right, just because I had to. My point is you can't protect everybody against everything. We have to prioritize. We have to, from a veterinary standpoint, think about economics, right? We can't recommend to our clients to vaccinate everybody against everything and use Burcon because Burcon's kind of expensive and close off our gates and put signs up everywhere. We've got to pick and choose on what we want to protect against. So we do an assessment. I'll kind of skip through these. The risk analysis cycle is always constant, just like anything other decisions we do. How do we get on a farm? Do you think? So what I asked you at the beginning of this section, the questions from this little flyer right here. Do you change your clothes? Do you have similar stock at home? Oh, yeah, another one for you. Do you have a rodent and bird control program at your house?
Yes.
Good. Yeah. All right. Do you use ponds and water supply? So these are all questions. Do you think you should fill this out? Would you fill this out in question? You think? Oh, sorry. He drops it on you. What are the sacrifices to do that back? He's not going to give that back to you. What are the chances that you hand that to your client they're going to give that back to you? They might keep it. They might be polite. How do we get on farms? Initially, isn't this usually a lot of times how we get on? So I guess I'll spend the rest of the time discussing how do we get, and you gotta remember, when I say I don't work for the government, all right? I'm not a pathologist, but I work in extension. Part of my job is getting the people up here to talk to the people in the field, right? We've had biosecurity risk assessments out for how long? They don't even remember the ownings. That's like my golden jewel, right? But the thing is how do we communicate with the people that need to know? Do you think your farmers and ranchers want to know about foot and mouth disease and whether or not the vaccine's a diva vaccine? Do they care? No. Well, then how am I going to get them to fill out a biosecurity thing so we can protect our country from African swine fever? Okay. So one of the challenges we have is, number one, this is when they call us, right? When I get called, I'm an extension. This is when they call me, when we have a rep. But it's an opportunity to discuss with them, isn't it? Because as I'm out there, I can say, well, you know, what went on? They watered from the pond and said they probably could pick up some toxins from the pond. Oh, did you know they can get diseases from that pond? Okay. So we've got to think about every interaction that we have with our clients as an opportunity, because while I really, again, I've been on the other side, I've seen foot and mouth disease, I've seen how bad it is. But we've got to make sure that we're getting to the people that need to know, okay, that need to actually protect against us. Veterinarians, we know how bad it is, right? But how do we get that message across on how severe it is? When do we investigate? Right, we go out to farms for outbreaks, population medicine, suboptimal production. They're just not producing enough milk. My calves aren't weighing like they should be. We've got a public health concern. That's when we get out there, right? Now, ideally, a lot of the conditions that we face in production medicine can be identified through good record keeping. How many of us go over records with our clients? A few of us. It's not every client, is it? It's our good clients. It's the ones, usually the good ones are the ones that want to progress. Okay. How do we get buy-in? So some of the things, awareness and opportunities that we can look at. Herd management planning. Okay. If you're going through the records with your clients, let's talk about biosecurity. Let's talk about this. Because again, what I say before, that stuff costs money, doesn't it? Biosecurity costs you a little bit of money. It's not really expensive, but it can cost you money. It'll save you even more. So by doing herd management planning, and you talk to your clients about, okay, this year we're going to buy X amount of vaccines. We're going to do this twice a year. We're going to get this kind of disinfected. This kind of like, what? We need disinfectant for what? For that foot bath that this young man's going to put in here. But we can't operate a foot bath. Okay, then we're going to buy boots for all of our workers so they can leave the boots at work when they go home at night. They can put on the boots when they get to work. Yeah, they're gonna cost you $20 a piece, but could save something. Disease program enrollment. I've already mentioned the Yoni's program, right? If you wanted to be enrolled in that disease program, you had to fill out a biosecurity plan. At least in our state. Did y'all ever have a BVD? Did you have a BVD? You have a trick? Okay, does it have an assessment with it? Okay, so if you're doing a disease control program, veterinarians, because here's the other thing, guys. Are you going to get paid for this? If you want to go out and do some consulting and some biosecurity recommendations with your clients, you also have to get paid for it, right? Or is it part of your consulting? So again, this is nice, but are we going to expect our clients to do it and we're going to go over it with them for free? All right, we all have to see the benefit and show the benefit. So when a disease program enrollment, as part of my BVD control program for your herd, it's going to include those boots, those this, and we're going to do some consulting an hour every year thinking about our biosecurity plan. Okay, that's kind of idealistic, isn't it? It's what we'd like to have, and hopefully we can get that way with our clients. But like I said, for the most point, it's going to be here. When something bad happens, but you know what, we've been giving a really good opportunity. June 11th. What happened June 11th? What happened June 11th, the 2023? It was 11th, wasn't it? Was it? Right. Was it 11th or 17th? 11th. 15th? Oh, close. Come on. 13, right? June. What kind of opportunity is that? I don't know about you, but I've gotten so many phone calls from my producer saying, hey, Carla, how do I establish a BCPR? All right, well, although we've been telling them for the last 5 years they needed it, right? Well, I have to come out to your farm, have to get to know your operations, I'm comfortable with you, and I have to develop a relationship. How better to develop a relationship than talk about biosecurity? Walk through the property. Hey, here's where I keep my heifers, this is our milk. You know, hey, here's the biosecurity, do that while you're doing that, right? So I think from a biosecurity standpoint, we've got to look for those opportunities that present themselves to us and what we're doing on a daily basis, right? I think the whole weed CPR and the new antibiotic, or the new drug regulations give us a really good opportunity and excuse. Because the next question I get is, well, Dr. Smith's coming out for BCPR, what's he gonna do? Walk around your farm? What's he gonna do to walk around a farm? You know what I mean? So talk about biosecurity and have that conversation, and then you can, that's an easy follow-up, right? If you require a visit every 6 months, hopefully it's more than that hopefully it's gonna grow into herd health planning. Hopefully it's gonna grow into a relationship where they're calling you for consultation on other things. But if not, at least we can get on that farm every 6 months to do some biosecurity discussions. And you can learn a lot by walking through and learning about the disease control programs on an operation. Does that make sense? Okay. So one of the things that we do, any other ways that you guys have to discuss? Because it's a challenge, isn't it? Especially now, right? Yes.
The state does want to get into the livestock auction on free lunch.
They hold that carrot, right? If they would do the biosecurity audit.
If they would come in and learn about it.
See, yeah.
People showed up for lunch.
Right. I did it. Well, so.
I showed up for lunch.
However, get your clients to do it, whether it's an outbreak investigation, because right, when you do an outbreak investigation, what do? Get a good herd health history. There you go. You want to know, do you vaccinate? Do you have farm dogs? Right? Why am I asking about farm dogs? What kind of outbreaks? All right, let's look at some pictures. All right, percentage. These are some NOMS data, the National Animal Health Monitoring Service data, and I just picked some things out that might be interesting. I'll blow past a few of these. Cows, lameness, foot rot, pink eye, respiratory disease, right? Do these require antibiotics? Most of my producers treat these on their own, don't they? Not anymore, right? Opportunity, discuss disease control. No. Unweaned calves, diarrhea, scours, respiratory pink eye. Last, I believe sulfa boluses are now a prescription. Most of our BRD meds are now going to be prescription. Hey doc, I need a prescription. What do I need to do to get a VFP? Let's talk. What's your receiving protocol? What's your biosecurity protocol? All right. Take a walk and look. What biosecurity concerns what I have here? This one's kind of hard to tell. That's a calving pasture, and they're anywhere between 1 month and 6 months of age calves. So think about, you can discuss Sand Hills calvings. You remove calves that haven't paired, or you remove cows that haven't calved after so long and give them a clean pasture. You water out of a pond. What are you concerned about? Leptospirosis, any other types of diseases? Just some NOMS data. Not back. Let's see. Oh, doc, I use these mirror fountains. They're really clean. How often do you clean them out? Oh man. Okay, in case you don't know what that is, that's a feral hog. And they will follow that feed. They will follow that feed trough out there every single day. They're carrying brucellosis, but the Suis type. Do you have dogs on the operation? Do you have a rodent control? Why did I ask you if you had a rodent control program? What am I worried about there?
Depends on the operation. Like salmonella is the biggest thing. If I need in a harbor.
Yeah, salmonella birds, salmonella rodents. What else do rodents harbor? Lepto. What else do rodents do? What?
EPM and horses.
EPM and horses. Yeah. What else? Toxin for sheep. They attract coyotes and dogs. What does that do? What's that do? Yaspro. Okay. They attract coyotes and dogs. Coyotes and dogs coming in the mines here. And these are all questions that would come in. Do you have a rodent control program? All those things you just named. Educational moment. Do you have a carcass control program? Do you have a cleaning program? I want to go past these pretty quick. Do you have, oh man. Oh, I've got a closed herd. A grandkid showed county fair. That's one of my favorite ones. All right. It's closed herd. Take advantage of your opportunities. Know the current health status. know the herd inventory, find out that type of information and create opportunities to talk biosecurity with your client. Handing them something like, unless I'm feeding you lunch. Actually, we tried that too. We do that at our cattlemen's meetings, we do that and we'll feed them, right? You gotta give them a little carrot. You guys have great opportunities with like the BCPR disease program enrollment. So this exercise that you saw, let me just go through this, is, so this is, and probably because the state of Montana, like most of the other states, got money to do biosecurity. Remember the last time I said, where's the money going right now? Where's the federal money going to disease prevention? A lot of states got a lot of money to do biosecurity education. We did too, so did Montana, right? So we developed, this is the one we developed here, was a biosecurity checklist, which is just a color-coded little checklist that I can use with my, I do it to my cattlemen's meetings or my 4-H kids. It's simple. Draw a sketch of your farm. We have a fly control program. You use a pond. You share a fence line with other cattle, livestock. Use common roads. It's just a really quick, easy, color-coded. So if I only have 20 minutes, I can say turn to the pink pages, and we're going to talk about that. Biosecurity checklist. If you want to go a step further, the next step up, the National Cattlemen's Beef Association, NCBA, has this great resource, the Daily Biosecurity for Disease Prevention. It's a daily farm thing that actually comes in and asks you these questions. Have you had BQA training? Have you had this? What's the number of the person in charge of biosecurity? A little bit more specific. Do you have a PREM ID? It's a little more specific. It's going to take a little more time. It's going to show a little more dedication. After you go through this with your client, they're going to think, ooh, yeah, I could do a little better. Okay, let's take it to this next step. This is free. It's online. Anyone can get it. And then the next step is foreign animal diseases. I mean, they could shut down trade everywhere. You've seen this one. Secure beef supply plan, secure milk supply plan. This is even a little bit more in depth, and it works with a business continuity plan. We got a drone to show borders and things. It's a little bit more complex. So this is kind of our step up process for biosecurity. So I wanted to introduce those tools for you because all of those are things that you can get for free that you can work with your clients, and you could stop at any level for your clients. You can go over the checklist with them, hand them the daily biosecurity, go to the ranch manager and give them the SBS plan. That's what they look like. These are the color-coded little questions. Perfect opportunity to discuss BCPR, people, employees, all the little questions in the book. Hold on, sorry. This is your daily biosecurity plan available at bqa.org and bqa.org. I think that's in your notes. It has one for group training, biosecurity daily plan, and then your secure beef supply also is online. But you can get that little document on there. Any questions? Real quick, I'll just show you on this one right here. On your SBS plan, it asks to look at the farm layout. And we found that a lot of producers, a lot of our ranches weren't really sure, like, oh, I don't know when they moved in, and you don't know maybe what creeks are overflowing and certain biosecurity points or how many entrances are to a farm. So we did a quick little project with drones that's part of the SBS. And it was just a little interesting to see things that we could look at. Farm boundaries. Most of your counties have, and your extension agents will have a drone. So these are always eye-opening to our producers. Creating a line of separation is something in the SDS plan. Where are your entrances, exits, road access points, environmental conditions, where things might flood, where things are, newly washed out, any other types of environmental issues that we need to know about. Geography, lay of the land, slope of the land. Environmental runoff. Are we moving our hay bales enough when we're feeding in the winter? Monitoring of animals, are they where they should be? Is there one off by yourself? Great for calving, but we can have biosecurity applications. How are they grazing? Sometimes if you can tell they're only grazing in one area, or if they're avoiding an area that you can only see from an aerial point, that could be a good indication as well. I don't know if you guys have a lot of oil drilling here. We have a lot of oil drilling, and sometimes we've got to watch where they're at, and we'll see a difference in the color of the grass and color of the ground. We're like, yeah, we need to avoid those spaces. Again, feeding locations, handling facilities. Future application, thermal. So everyone always asks the question, right? Because I know with COVID, we saw some of those thermal cameras being used on people. They have actually studied the use of thermal cameras and thermal controls in animals for the prediction of foreign animal diseases or animals coming in with a fever. And they haven't been able to accurately get it within a certain zone unless you buy this really expensive camera. So for day-to-day practical applications, it hasn't been used yet. They have been studying it. And the other issue is for climates like mine, where the ambient temperature is 105, how do you know if an animal has to? So they are doing, there are some companies in Sweden and Norway, I think, that are doing a lot of work. They're working with Plum Island on looking at thermal imaging and identification accuracy. It's just a quick one. See how much cooler it is under there? Look. I think that's kind of neat when we think about providing shade to our animals. See that white cow? See how much cooler she is than the black one? Okay. Any idea what that is? Sorry. Hay. How hot the hay gets that's stored. Incredible, isn't it? Future applications, chemical applications, possibly for the treatment of animals. And then radio telemetry data. Okay. So getting biosecurity buy-in isn't going to come from the USDA, from the World Organization for Animal Health, or the OIE. It's got to come from our producers, our veterinarians up. So finding creative ways we can promote it. And I guess to pull everything together is thinking of it as disaster preparedness, right? Denial, liberation, decision. Whether it's a foreign animal disease, the better we know what our choices are and how we might mitigate a foreign animal disease outbreak, or how better we'll plan with the biosecurity plan, the better we're going to recover and have resiliency. Just like whether it's a tornado or something like that. All of these outbreaks or disasters are going to take community pulling together and working with each other and exchanging business cards before an event actually occurs. That's all. 8 minutes. I'm giving you back 8 minutes. Any questions? If anybody would like, I brought some of these and they're not going back home with me. I've got some of these little one-pagers that I use for my cattlemen's meetings and for like the poor